वक्रतुण्ड महाकाय।
Once again, a warm welcome. Good morning, ladies and gentlemen. Today, I stand to shed light on the revolutionary emergence of digital health solution and how they are poised to positively impact the lives of rural population around India. We've been talking hospitals, now we are talking hospitals to smart hospitals, which is very important in today's era because we are only reaching to the urban. There are still people in rural areas which we not been able to reach out. That is where the digital health is going to help. So I'm very happy to let you know that we have a beautiful panel here. We have hospitals, we have the ministry, we have the Rupcha associations, and we have all the partners, various partners, those who do the digital health. We also have people from the nursing colleges and almost all the nearby hospitals, nursing directors and doctors and MDs, medical directors, all are here. And you will hear them in all day how the digital healthcare is going to change the life of this country. The government pushes a lot on digital health, starting from checking your lungs up to the pregnancy. I was very happy to see yesterday a demo how a pregnancy lady can be monitored from the day 1 till the delivery and after the delivery. So I request all of you, when you get on the break time, do visit all these stalls to see what all they have to offer you for the digital things. Rural populations have long faced significant challenges when it comes to accessing quality healthcare services. Limited healthcare infrastructure, a shortage of healthcare providers, long distance to healthcare facilities have often resulted in delayed and indicate medical attention for those living in rural areas. That's a big concern. And I'm sure the panel will also address on that because it's a big concern for our country. 140 crores of people in this country, and we talk big things, but still the rural people is far away from the reality of called health. Furthermore, digital health solutions are empowering individuals in rural areas to take charge of their own health and well-being. Mobile health applications and wearable devices and enabling individuals to monitor their health parameters, track their fitness level, and access vital health information in real time. This proactive approach to healthcare not only promotes preventive care but also enables early detection of health issues, leading to better disease management and improved overall health. Without taking much of a time, let's listen to the experts. What do they have to talk about on the digital health? Ladies and gentlemen, I invite Father George P.A., Director, Holy Family Hospital, to address the gathering. Father George.
Respected dignitaries on the dais, the delegates, ladies and gentlemen, we are in a digital world. Digital health is a rapidly growing field that offers exciting opportunities for innovation and improvement in healthcare delivery. The goal of digital health is to make healthcare more efficient, accessible, and effective by leveraging the power of digital technology to collect, analyze, store, and share health data. Digital healthcare interventions refer to the use of digital technology and to get connected devices to improve healthcare outcomes and healthcare delivery. This includes telemedicine, electronic health records, wearable devices, mobile health applications, and other forms of digital health technology. To this end, several research and developmental activities in various fields are gaining momentum. For instance, in the medical devices sector, several smart biomedical materials and medical devices that are digitally enabled are rapidly being used through the various stages of drug development, namely computer-aided drug design, computational modeling for predictive toxicology, and big data analytics for clinical trial management. In the biotechnology and bioengineering fields, investigations are rapidly growing focus on digital health, such as omics biology, synthetic biology, systems biology, big data, and personalized medicine. Digital health-focused medical devices are devices that utilizes digital technologies to improve healthcare, and provide these devices are playing an increasingly important role in improving healthcare delivery by enabling remote patient monitoring, increasing access to medical devices, medical services, and reducing healthcare costs. They also offer the potential for improved patient outcomes by enabling early detection and intervention in medical conditions. However, there are also challenges associated with the use of these devices, such as the need for appropriate regulatory oversight, privacy concerns, and attention to cybersecurity risks. Moreover, digital database of organ donor also is on the cards for smooth transplants. The advent of digital healthcare and healthcare provided the way for tremendous development in the field of material science and related research. Modern material science can contribute smart materials and analytical tools suitable for developing wearable medical devices and sensors required for this purpose. The wearable devices could help in the monitoring of chronic health conditions, therapy, diagnosis, rehabilitation, and tracking of physical activities. Timely intervention supported by the real-time monitoring of health parameters using wearable devices would save the lives of many people in the country. The cloud-based operation of wearable medical devices enables medical professionals to monitor real-time vital parameters and to plan the requirement of physical visits, changes in therapy, and modalities for disease management. And the list goes on and on endless. Today we are in a digital world, as I said. I'm sure the sessions which you are going to have is going to take us next level as to how to reach out to the people, especially of the rural India, where the healthcare is skewed, man. The healthcare professionals, the facilities available in India is skewed ratio. I'm sure the digital is going to take us to the next level, and the whole day we are going to have wonderful sessions and have a wonderful seminar, and we learn from each other a lot of devices and a lot of the startup. It's been a part of the India government project. A lot of things have been part of the mainstream now. Let's hope we will also utilize these things and improve the service which we are giving to the entire country in terms of healthcare service to the country.
Thank you, Father George, for addressing the gathering. Now may I request Dr. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital, which based out of Ghaziabad. You must have heard a lot of, FM radio which comes into that. Madam, congratulations. Please welcome Madam Dr. Upasana Arora.
Good morning, everyone. I think everybody must have taken their tea or coffee. So everyone is awake? Yes. Thank you so much. First of all, I would like to thank this conference organizer who called me, and I am here. Rather, this is a new gathering I am meeting because I am a conference fellow. I am going everywhere, but it's a totally new crowd I can see, as well panelists as well as our audience. So anyhow, digital health is a need of era. Reason behind this, we actually need to provide, our population is I think number one in the world, everybody knows. So we need more hands. Our government has tried a lot and they, started new medical colleges. We got first time in my life, now I am 55, so you can understand, in my life that government is thinking about some nursing colleges and all. Otherwise, health was not priority for anyone. So this is a very good time when if we want to implement something, government is actually very favorable for healthcare. That is what Ayushman Bharat is here. And Ayushman Bharat is also depending on digital health, ABDM. I am very lucky that I am part of committee of Ayushman Bharat. So you can understand when this ABHA will be implemented everywhere, how easy it will be. Like I travel a lot. Half of the time I am some other country or city. So if that kind of facility will be available that I can go to any hospital and I will just tell my name or my ID and I can see whole my records, so need not to carry all the time big papers. Same time, hospitals are providing end-to-end care for the patient. But after discharge, what is happening with the patient, no one knows. So, with the digitization of the healthcare, it is very easy, rather because I run hospital, basically I'm involved in day-to-day activities, so lots of companies are coming to me and they are showing their gadgets. Before you told that go and visit, I already visited everything and I invited everybody, please come to hospital and show me what special you are doing. Because if you see, IT is actually doing very well everywhere in the world. For all devices, you start from the admission till discharge, you are depending on a software. So I think this conference is very important and we should, whatever we are learning here, we should not keep it only to ourselves. We are supposed to tell it to our colleagues also. If we know some good company, we are supposed to tell others that this company is good. Adopt this technology, adopt this equipment, whatever ways we can help them. Because that is how we encourage those who are doing startups. Young boys who have done some IIT and now they started something new. I am using Dozy, which is so helpful. So whatever I use, I tell to others, please use it, it's good. So I mean to say, our organizer has a very good vision that he organized this, and especially panelists who are sitting here, they are such a wonderful people and very, very intellectual, intelligent. So I will not take much time because I am not that much tech savvy, but still I understand, like if I will go out after this conference, I will put only one post on my one social media and it will go everywhere. Like I am using 4 accounts, so everywhere it will post automatically. This is the IT, this is the software, these are the technologies. So we should adopt them, we should support them, and I am always ready for all new things. Everybody knows me in healthcare because for you people I am a new face, but other in quality, I am actually brand ambassador for NABH also, so I am everywhere in quality and healthcare. So everybody knows that Upasana and Yashoda is always ready to adopt all new things, all new equipments, new technologies. So most welcome, please come and show your talent to me. And thank you once again.
Thank you, Dr. Upasana Arora. Whether we like it or not, AI is going to be part of our daily life, and without IT, no hospital can run, and Holy Family Hospital medical director can vouch for it. Dr. Sumitri is here. So, ladies and gentlemen, thank you very much. Having said that, I invite the next speaker, Commander Navneet Bali, Chief Executive Officer, Clear Media Healthcare. Sir, ladies and gentlemen, please welcome Commander.
Thank you very much. At the outset, I would like to thank you, sir, for inviting me here. Now, before joining Clear Media Healthcare, for 6 years I was in the Mecca of healthcare called Narayana Health, where I established the North region for NH. We had a hospital in Katra, if many of you have gone to Vaishno Devi, it's a small village. And then 3 more hospitals here. And before that, international oncology, where again we had cancer centers in tier 2, tier 3 cities. And now in Clear Medi Healthcare, we just started a hospital in Gwalior. We have hospitals in a small village next to Baroda. It's Kailash Cancer Center. We have 3 linear accelerators who treat around 200 patients on the couch every day. Please get out of Delhi, travel for 1 hour, and you'll start understanding the healthcare scenario in India. It's dramatically different than what we are here right now and what we talk about. It's completely different. I was in Nanded yesterday. We have a hospital in Nanded. As you're aware, Nanded is a small town in Maharashtra. And we just adopted a new HIS system, and I asked the hospital that why don't we tell patients to come on the app, and why don't we want patients to be digitally aware? He said almost like 100 patients on couch on linear accelerator there, huge amount of cancer burden. And they said that patients don't want to, because they still want to carry a file, because it gives them that sense of they're carrying something with them, and then they go here and there with the file. So 2 aspects of the whole situation right now. Great amount of advancements been done in IT, no doubt about it. We got fantastic digital transformation happening. But if you really ask me, the pace of this digital transformation, or what we are going through, has been extremely slow in healthcare. I think you started using Ola and Uber many years back. You started booking your movie tickets and Book My Show, etc. You started booking the airline tickets. But if I ask how many of you are today using an app to book an appointment in hospital, I think it will be just about 5% of you. That's all. Almost none of you will have an Aadhaar ID. And almost 80% of you will not be using a wearable device or monitoring your health parameters on a digital platform at all. So what I'm trying to tell you is that although the technology in this case has gone much ahead of what it should be, the adoption is still a very poor, dismal part of the entire ecosystem. Now, where does it bring us? So let's first understand the problem. I'll just take 2-3 more minutes. We got 140 crores of us. Out of that, some of us are covered by some panels, etc., ECHS, CGHS, ESI. Some of us are ultra rich who don't need anything. Then a part of us are covered by Ayushman Bharat. As you know, the family gets covered by around 5 lakh rupees, for the entire family. Some states like Jammu Kashmir, Rajasthan have got 100% Ayushman Bharat coverage. So whoever you are, you could come with a card and come to an hospital. But there are about 60 to 70 crore Indians who are neither covered by anything at all, zero. They have no coverage, they are nothing, and as you're aware, our out-of-pocket expenditure was highest, one of the highest in the world, somewhere around 58 to 60%. The data tells me that it has come down now, but still a very, again, and not a picture which is we need to be very happy about. So what is the solution of the problem? We all know the problem. And by the way, this gathering here is more of a knowledge sharing, experience sharing, where people sitting on the dais and, in the hall can then go and talk about it somewhere else, and maybe it makes some difference in a small village and a town. So the problem, we know, the solution is actually through digitalization or digital adoption, and a genie called insurance. As you're aware, healthcare insurance has shown a great promise, but not the way healthcare insurance is today, where you pay a huge amount of premium, you go to a hospital and still you are not paid for your expenses, and you're aware. So I think the combination of insurance and digital steps and their percolation down to small towns and villages actually is going to really transform Indian healthcare. But I'll go one step further. We are just too many of us to be treated in hospitals. Too many, 140 crores of us. I think if you really want to look at Indian healthcare and our population to be much more healthy, I think we need to move towards wellness, whether we use digital methods, we use technology, we use AI, or whatever you want to use. Since we are too many of us, the first step has to be wellness. The second step has to be adoption of digital means into the smallest towns and cities of India. The third has to be insurance. And a combination of all these three things, maybe in the next 5 to 10 years, we'll see us completely change the scenario that we are facing right now. As you're aware, truly speaking, if a poor person has to today go and get his cancer treated in a hospital, believe you me, even if he has an Ayushman Bharat card, he still won't be able to get the completely treated. Okay, that's the truth of the situation. Because I run hospitals in these small remote areas, I've been to the smaller towns and places, it's extremely, extremely difficult. But yes, there's a promise in the air. As I talked about, there are so many things that we are very, very optimistic about it. And please never ever discount the power of policy. And as Dr. Upasana also spoke about, the government is quite proactive. And I think policies are much, again, for a country like us, I think policy interventions by government are going to also lead the way. So with that, I just want to say that there is a huge amount of, I would say, hope in the air. But yes, it has to be clicking of all these factors together if we want to really, really see us move towards the glorious era where Indians don't have to bother about how much money they have in their pocket and they get treated in the best hospitals in the country. Thank you so much.
Thank you, sir. I agree with you. The rural areas, one hour from drive from Delhi, you see the healthcare of this. So we also have a director from Bijnor Hospital here. He was sharing with me the kind of problem they are facing. You know, first the doctors and then the patients. So both, so both. And what you said is the healthcare app. I do agree, we all have a healthcare app, but the problem is we don't do a publicity kind of a thing. Everybody still prefer a print. Mera appointment kitne baje hai? 11 baje ka hai. Prefer to have a, in writing. So that's what India. But I do agree we need to move slowly into the digital. And that's where we started this conference, that we need to move into the digital. Ladies and gentlemen, I'd like to welcome Father Sabu PL, Director Fatima Hospital, Gorakhpur. He is also the Vice President of Rupcha Association of India. Father, join us.
Good morning, everyone, respected dignitaries on the dais and respected delegates from various organizations and hospitals, healthcare systems. Myself, Father Sabu from Fatima Hospital, Gorakhpur. Speak on to digital technologies are now integral to daily life, and the world's population has never been more interconnected. Innovation, particularly in the digital sphere, is happening at unprecedented scale. Even so, its application to improve the health of populations remains largely untapped, and there is immense scope for use of digital health solutions, as already mentioned by our speakers. Digital transformation of healthcare can be disruptive. However, technologies such as the Internet of Things, virtual care, remote monitoring, artificial intelligence, big data analytics, blockchain, smart wearables, platforms, tools enabling data exchange and storage, and tools enabling remote data capture, and the exchange of data and sharing of relevant information across the health ecosystem, creating a continuum of care, have proven potential to enhance health outcomes by improving medical diagnosis, data-based treatment decisions, digital therapeutics, clinical trials, self-management of care, and person-centered care, as well as creating more evidence-based knowledge, skills, and competence for professionals to support healthcare. Digital health should be an integral part of health priorities and benefit people in a way that is ethical, safe, secure, reliable, equitable, and sustainable. It should be developed with the principles of transparency, accessibility, scalability, replicability, interoperability, privacy, security, and confidentiality. The vision of the global strategy is to improve health for everyone, everywhere, by accelerating the development and adoption of appropriate, accessible, affordable, scalable, and sustainable person-centric digital health solutions to prevent, detect, and respond to epidemics and pandemics, developing infrastructure and applications that enable countries to use health data to promote health and well-being and to achieve the health-related sustainable development goals and the triple billion targets of WHO's 13th General Program of Work 2019 to 2023. Digital health will be valued and adopted if it is accessible and supports equitable and universal access to quality healthcare services, enhances the efficiency and sustainability of health systems in developing quality, affordable and equitable care, and strengthens and scales up health promotion, disease prevention, diagnosis, management, rehabilitation, and palliative care, including before, during, and after epidemic or pandemic, in a system that respects the privacy and security of patient health information. The vision further seeks to enhance research and development, innovation and collaboration across sectors. It recognizes that digital health can radically change health outcomes if it is supported by sufficient investment in governance, institutional and workforce capacity to enable the changes in digital systems and data use, training, planning and management that are required as health systems and services are increasingly digitized. With this essential investment in people and processes, in line with the national strategies that lay out a vision for the digitalization of the health sector, digital health can improve the efficiency and cost effectiveness of care, allowing for new business models in the delivery of services. The Catholic Health Association of India, CHAI, mooted the idea of decentralization in the 80s. That gave rise to the formation of regional units. Member institutions belonging to various geographic regions got together and formed the regional units. Presently, there are 11 such units of CHAI. Even though Rajasthan Uttar Pradesh Catholic Health Association, in short form, RUPCHA, the largest regional unit of CHAI, was formed during the second half of 1980s. It started functioning actively in the year 1988 onwards with the assistance of CHAI zonal office at Delhi. It was registered under the Society's Registration Act 1860 on 14th March 1991. Since then, it has been growing steadily and playing an effective role in the promotion of the comprehensive and holistic process of community health in the region. We, the RUPCHA family, is spread in 7 states and 3 union territories with 235 member institutions having a total 6,000 bed capacity in this northern part of India. Already, many of our centers in the remote areas are digitalized with online consultation facility and telemedicine. I am also coming from the northern part of Uttar Pradesh, Purvanchal, Gorakhpur. We have some 10 satellite clinics, 7 vision centers. Many of our sister concerns, our sister religious sisters are using telemedicine program and online consultation program in their own centers. We are in the process of digitalization and ease of doing the healthcare services. Our deep appreciation to BE exhibition for organizing today's event and making RUPCHA a major stakeholder in the North India as part of this program. Thank you very much for patient listening. Jai Hind.
Thank you, Father. That's what the RUPCHA is doing around the northern part of this country. Ladies and gentlemen, now let's welcome Shri Arvind Kumar, Director General Software Technology Parks of India, which is called STPI. They are doing a lot of funding for the medical startup companies, and you can see a few of them are here. Ladies and gentlemen, put hands together welcoming Shri Arvind Kumar.
Good afternoon. It's really proud privilege to be part of this very Health Tech Digital Healthcare Summit. Sri Robert Ravi is my colleague in TRA, and I truly technology man. You know, we are talking about the 5G right now, people are using 5G right now, but he's talked this maybe 6 years, 7 years back. So truly technology man, is really glad to see him on this very conference. Sasi is my old friend, and I think it's very good that he has entered from technology to healthcare as well. It's really. All distinguished delegates from various fields, on the dais, off the dais, backbone of this whole country, health system, our sisters, they are really backbone of health system of this country. You know, now we are in the era of technology disruption. I am not going to talk about using IT system for hospital management. I mean, this is done. HRMS of the hospital is done. Now this whole new tech has triggered a different domain altogether. This new, when we call this new tech, this is we calling artificial intelligence, machine learning, data analytics, genomics, one side, which can handle million data. And the other side is 5G, so that it can reach to anybody, anywhere in this country, AR, VR. So there are two parts of the technology. One is about handling the data, another about the reaching the data, AR, VR, which is ensuring that everything reaches to the masses of this country. And these two together triggering to almost different paradigm of the medical and health system in this world. But I am sure India is going to lead it. There are regions behind it. The important part for the health system is that everybody has the different human body. It is a different composition. So in India, we have 1.3 billion data point, if you consider one as a person. Then it has millions and billions of the cells and neurons. So just think these data. Till now, all the studies, because there was a technology limitations, you can't handle such a huge volume of the data. So we are working only on the sampling theory, right? Today, drug discovery take 10 to 15 years. You have to first test on some animals, then you have to test the drug on the people who have very high immunity, then you have to go to the masses, but you don't know whether this drug is suitable to me or not. This is just an statistics. But this paradigm is going to change. You can have the drug discovery for each and every person individually. Which drug is suitable to whom? We can create digital twin, we can create digital twins of everybody. And the digital twin, you can do the experiment on that very digital twins. So we are going to talk, I'm going to talk how this is going to change discovery and drugs and how it is going to be useful for the humankind in general. How it is going to use for medical devices. Now we are not the country who is doing some conventional research. We are now in deep tech. This is the new trend which has been emerged in this country, that now we are excelling. We are doing best in the world on deep tech. And deep tech most useful case could be the medical science. And I'm really very glad that these engineers one side and medical professional other side are sitting together. Actually, this kind of the collaboration is the need of hour. I must thank Bharat Exhibition and Sashi Dhuran who brought doctors and engineers together. Those generally are working in silos. Third is, I said, healthcare management, patient care management. It is in any case is happening because IT has developed so much. Now, when I say drugs take 10 to 15 years to come into the market, we have to find, and this is what the startup today needed. A startup needed only the problem statement. And who can give the problem statement? Today, startup is not requiring funding. They'll have lot of funding source. They can get the fund if they can get right consumer to the product they are developing. Now, what product they should develop? They should develop the product which is required by the industry. So, who can give the direct right problem statement to them? Good hospitals, doctors, pharmaceutical companies. They can give what kind of problem they are facing when they are doing the drug discovery. And this drug discovery concept should be changed into maybe drug design, maybe drug engineering, maybe drug modeling, and it should not take 10 to 15 years. And it should be very personalized to everybody. This kind of the problem statement is just responsibility of our pharmaceutical company to give the right problem statement to our startups who is working in artificial intelligence, who is working in machine learning, who is working in data analytics. Then this problem is very much solvable and we can lead like we always be in the pharmacy of the world that we have shown in this COVID era, and we can tomorrow become that all digital health technologies coming from our country. Second is about the devices. Today, if there is a knee implant, you know, when the doctors put the cut there, then only they know how much bone has to be broken, cut, how much portion has to be cut. If they don't know how much blood will flow, they don't know how much recovery time will be. But I think this technology, if this artificial intelligence technology is provided along with all kind of the statistics, MRI, X-ray, everything, they can very well make a very next guess that yes, this will be the recovery time, this will be the blood flow, and this kind of the cut is required for this very knee implant. But who will give this problem statement? Artificial intelligence people, technology people knows how to solve this problem, but somebody should tell the nuance of that very problem. And this has to be done. This has to be done immediately. Similarly, we should create, I said, digital twins. Tomorrow biggest problem is our senior citizens. They always go to hospital multiple times. All right. What is the problem? Sometimes they fell down. Can we create some digital twin? Can we create something which is similar to that very person, and you can always do some prediction, yes, this problem may come at this point of time, and they may not require to visit hospital always. Third problem is, which is you have not that many doctors as is required, and this problem can very be solved by AR, VR and the metaverse. Some doctor may be sitting in London. You can have feel of that very patient, that very operations through this metaverse. Fourth, which I can understand is this, is called digital therapy. And digital therapy, today we have all conventional method of digital therapy. You just give the ball, you kept moving this. This is all traditional methods, not suited to everybody. It is on the basis of statistics. All digital therapy can be created, can be done, personalized using artificial intelligence and all deep tech technologies. Today you don't know, doctor, when you go to neurologist, when you go to orthopedics, they say, okay, there is no medicine for it, do these 3 exercises, 5 exercises, physiotherapists used to tell you, and your back pain will go. After 2 days, you realize nothing happening. Why not go back to doctor, ask, please give me some pill, it will be okay for me. If you can create some digital prototype of that, so you can see it on your TV, okay, when I am doing exercise, this muscles is being actually released. Because you are not realizing, when you are doing 3 days exercise, to just release that very neurological, I don't know what is happening or not happening. You don't know whether there is a effect of that medicine which I have taken or there is effect of exercise which I am doing. If we can create something good for them, that yes, when you are doing this muscles, when you are doing this exercise, this very muscles is being relaxed, you can measure, yes, yesterday it was, muscles was in this position, tomorrow it will be in this position, you will have encouragement to do it. This is where technology can be used. And as I said, there is a need, I mean, time is essence, time is up already, Sasi has announced. So, we say there is a need of, I must say, collaborative approach, co-innovation approach, and be also running a startup on health tech at Lucknow, it's called MedTech, where we are supporting around 30 startups who are in various domains. There's no time, otherwise I could have explained what exactly they are doing. But there are 3-4 startups who are present here. You can see what they are actually developing. But it's really nice to see them. They are able to produce number of IPRs. Their product is very good. And it's not only us. There are many incubators who are providing a lot of facilities to startup. But I expect from this medical fraternity is kindly adopt some startup, give problem statement to them. Money is not an issue. You are not solving your problem, you are solving a country's problem. So co-innovation model. Thank you very much.
Absolutely agree with you, sir. They are solving the country's problem, the huge population of this country, so that everyone is accessible to the health care. Having said that, we are slightly running late. May I request all of you to put your mobile on a silent mode, as I see some people are talking on the mobile inside the hall, which disturbs the panel and of course the other delegates, those who want to listen. Sorry for that. I will not request you to switch it off, but just put it on a silent. Ladies and gentlemen, let's put hands together in welcoming Shri A. Robert Gerard Ravi, ITS officer from Department of Telecommunications. When he, what Arvind sir has said is right. He was talking about 5G use cases. Now me and he started talking the 6G use cases. That was a beautiful thing which we did 2 weeks back. Me and Robert sir, we've been talking. What are the use cases for 6G and how 6G is going to play a vital role in the healthcare sector. Sir, over to you.
Thank you, Shashi. It's always good to come to some events wherever you're arranging, especially such events. A long time friend. And my dear Arvind, we have a long association. As you rightly told, we have both on the tech side. So he is helping on the startups. We from the government, we try to see what best we are trying to do. And dignitaries on the stage, ladies and gentlemen, it's again a pleasure to be around with you for this summit. I'm not going to touch much on real technology because it's been talked. I want to just put a few facts before it, then just pass a bit and see what we are, where we are and what we can do. Going back to our basics of what we call about sustainability. So when you have the UN goals, what are the 3 main essential goals on the health sector we are talking about? Acceptability, affordability and availability. Today is the healthcare affordable, acceptable and available? How far we are done? We talk about digital transformation. That's the main topic to talk. Digital transformation of the health sector. How are we going to put the pillars? The government has done a lot of efforts. I think you might have seen in the last few years. We've been pushing a lot in the health sector. Now the entire digital transformation of the health is going to anchor itself on 4 key pillars. What are the key pillars? One is, of course, affordable. How affordable your health? Whether these health services are available, access to health. Next is how decentralized these health facilities are there. Can it all be available, decentralized up to the rural areas? Third is, can I bring in technology? How smartly we can give these activities to the public? And of course, the affordability. These are the 4 pillars on which any transformation, if you think, on the health needs to be done. Let us go a bit of statistics and say, yes, we all know that, Arvind clearly pointed out. Health sector is one of the largest sector today in the country. We actually, not only for the country, the international, I'll just come to what we say, the medical tourism, a lot of happenings are happening in exactly the health sector. But what does the stats says? Fortunately, 1 year back, the government stepped in and put it up a lot of PPP, partnership, pressing insurances, etc. Today, we are fortunate, at least 70% of the population today have some sort of a health access available. But still, we have 30% not access. 1 year back, it was still bad. So, as the private sector and the health and the government, we are pushing. Are we only concentrating only on the urban centers? How are we going to take the rural centers? It's a very big. I think, as she told, I was probably 1 year back around in Tamil Nadu as CTO. We were trying to say that, how do I take whatever I was available in the urban centers like Chennai, can I take this to my PHCs, which is available in my rural areas? What is preventing us from doing it? We have the technology available. We have every means is available. Can we do that? That's how, like what Arvind says, we have a number of startups. We started funding these startups, coming up with ideas. How can they use technology? They came up with beautiful technology called what we call ATM, health ATMs, where something like a kiosk could be built. Somebody can go and put their hand. All parameters, I think 30, 35 parameters captured, sent to a common place, and then the doctor can analyze and come back. These are some of the examples. So we have a lot of other activities still we need to do. For the statistics, 30% still not covered. We don't have access. Another alarming rate, 70% of all the heart attacks is happening in the country. We claim so much, but still it's happening. We are still, because as I say, the availability, affordability, how soon we are able to access, is still a big, big problem. There is no problem in even, say, following some of the models that is happening across. So for example, the other day we were having some dialogue with, because health is a very real important subject. We all know that we gave the vaccine to the world, you know that. But the other side of the story is also existing. So when we are talking about to some government agencies in Philippines done a very, very interesting, on the mountain top, they can do an MRI scan on the real time. Can we not copy that? We talk about Colombia, it's again an almost similar country. They have developed something like smart clinics, smart establishments. We talked about telemedicine. I can share you, telemedicine is nothing new. Way back in 2009, when I was there, we used to run a telemedicine facility, connecting the hospitals, and of course, we did it on a small scale. Very interestingly, we found it was done on the coastal area of the Kadalur, Pondicherry, Chennai area, and we found there were a specific disease which is only available in these coastal regions, which were not even available to the mainstream. So these guys were brought to these the common government GH, and then we came up with ideas. So what I'm trying to say is, the country is a vast country. We still need to put our things done. That is where the first access is available. Second is how decentralized we are doing it. Fortunately, we have technology available. We have 5G. We have opened up 5G corridors. Today, if you see that, the green corridors, when you want to have a transport system available, we are in the process of building what we call intelligent automation transport system, which means if a vehicle or an ambulance need to be moving, all the connected vehicles around will automatically give way and a green corridor will be made available. This is one of the use cases which we are trying to build in 6G. It's happening. Another use case is, I think Shashi was talking about 6G. It's another a few years away, but we have still started testing of some of them. One very interesting use case for the medical side will be your wearables. We will all shortly go away with these smartphones. Smartphones is going to be a story of the past. We are going to have only wearables. So using these wearables, how we are going to connect your wearables? I know you already have that we can monitor the basic health parameters. But suppose I walk in a road and then due to some reason I fall down. The wearables can connect and they can automatically connect to an hospital, and then an ambulance can come and pick. That's some of the use cases which we have built. This is of course again the urban side. Again going back to the rural. We we did a very, very interesting case study. Because, this is the right forum. What I request to you, we have the engineers, as Aravind was telling, we have doctors, we have the engineers, we have startups coming up. I request you to only think about how effectively the rural people also should have an equal facility, what is available in urban. How are we going to do it? We did a very, very interesting case. One I told about that ATM, health ATM. The next very important thing is, of course, there's a research going on in IIT Chennai on this particular aspect. So can we build some sort of a small capsule? I think the doctor from is available there. We did something so like what we call an endoscopic small capsule available with a small camera, which could be swallowed in, and then without invasive pressure, key parameters, 10 parameters, I'm very sure doctors will be able to say, if these 10 parameters have been captured, can I detect what type of disease is there? And these devices, right now it is available for 20,000 rupees, maybe we are trying to bring it down to 1,000, 2,000 rupees, accessible, government can even fund it, 1,000, 2,000 is not when a lot of incidents is happening. So just imagine a scenario, I have a PHC in my village available, people walk into it, we give this capsule, you swallow it, gets the information, and that assimilation happens on time, a big data analytic happens, and then a doctor sitting some far away can even analyze it, depending upon the need. For example, it's cancerous, or it could be heart-related, it could be gastro-related, the experts' information can go on. Can we not build some sort of system which does automatically? This technology is available, we are all pushing it in a big way. That's one key thing that we can see that, can I make a society that is healthy? Our ultimate aim will be, though the doctors may not like, no one should be having any health-related activities in the world. Can you not do it? That's what is we have to do. The technology is available. Can we build an environment which is a healthy environment for all? Let me go back a bit on this. A lot of researches is going on. I think Arvind touched upon the can I do targeted analysis of your drug management. This is a very, very interesting topic. Material science and biotech which is going on. Say for example, in any of this, not only the drug, can I compartmentalize, say every patient's data, like genes, for example, analysis of genetic analysis. I'm sure the doctors are aware. There are 63 genes available which is responsible for this aging and other related things. Some sort of a genetic immortality. Can we think about it? We don't want to be immortal, but at least can we be a healthy human being using the 63 genes? The technology is available. How? Let me again go back. We are setting up what we have quantum labs, quantum computing. Earlier, the molecules of these genes to be detected and is really, really difficult. That's what Arvind told. It takes 15 years. But today with the advancement like quantum computing in place, right now as we speak, we are setting up a full-fledged established quantum computers up and running in Chennai. We have our own Indian quantum as a service available in Bangalore. Suppose you have the data set of the people, what is available. Can I put into this computing facility and on the fly get to know which is the exact gene which we require to check. And this you can even put with big data analytic. I can analyze big and I can categorize. Because what the Indianized environment and the European environment is totally different. Can I make something for the Indian environment? All this comes on big data analytics. Most interestingly, I talked about the 4 pillars. The second pillar is decentralizing. Decentralizing means I no need to bring all the data to one place and do an analysis. And a very interesting case of, I think, Tamil Nadu. I don't want to quote unquote. We did this because of our eager to help the people. We told, okay, let us take data of all the people. We'll do an analysis. We make an analysis. Unfortunately, we got down into a cloud system where we were not able to retrieve the data. We have to also be careful on the technological other side, what type of environment you're building in. Please ensure that we should have the data security also is a very, very prime thing. So can I host it in my own data? So I used to always talk, whenever I meet the startups, health startups come, sir, we have developed this, it goes on the cloud. The first essence is how secure it goes on the cloud, what is the data? So my request, I'm sure, STPI, Arvind, and we have the NIC, we have our own government data centers. We are free to open up this to anything amount at low cost. All your data should come to this particular cloud source and do an analysis rather than the other going outside. This is another very important thing which people should think in the long run. I can also go on giving examples. Apart from this use of technology in these areas, another very critical area is how do I do predictive analysis. I was working in Uganda for long back, maybe 3-4 years back when I was in Uganda. You know that there is a virus called the Ebola virus. Ebola virus is very, very powerful. It's very dangerous. And we wanted to find out a way of how do we prevent it. Deaths used to happen because of Ebola. So what we did, we took, with the help of UN, we took the data of the stamp base, and then we know the area. We were able to predict using big data analytics, AI analytics. We used to predict and say there could be a probability of outbreak in this particular area when particular scenario is like that. We were able to, that's the first thing. Second thing is random check of analysis of the borders. It actually originates in Congo, those of Ebola, though they call it the Ugandan thing, but it originated in Congo. So whenever the guys from Congo gets passed on, we were able to predict in the first 1 week of the outbreak itself. In 2016, probably it was the first year, we were able to effectively, to reasonable extent control the Ebola outbreak. So this is one example. So I'm trying to say is the technology is available. We have the AI, we have satellite-based maps available for your analysis. We can even do AI on the top. You can even use edge computing, even at remote areas also can work as your computing and develop its own model. You don't need to set all the modeling here. All the technology is available. Only what is available, as Arvind was also telling, let us take the problem statement. The problem statement today is, can I make rural on par with urban? Second, that is what we call access, decentralized access. For the startups available here, another very, very critical thing which I wanted to say is, any analysis which you do, for example, you say, I put my machine, I did my measurement, my BP is so much, my sugar level is so much. How are you validating it? If a doctor or someone or a hospital is going to own it, how are we going to validate it? There is some agencies, I think you're all aware of the startups. I request the startups, whenever you do it, parallelly you should also start engaging with these registered bodies. And you know that unless the accuracy rate is 98%, you will not be given a certificate of validity of use of this product. That is what your medical MCI says, the old MCI states. So we should not get bottled. See, we should not blame the doctors. They're not adopting the technology because they're not able to adopt the technologies. Are you able to prove what you're delivering is on par with what has been registered? So my request to the techno people or the startups also is, whenever you start doing it, kindly see that you register yourself and then ensure that registration is in place so that at least we meet the 98%. So these are some of the problem statements I have thrown up. I'm very sure we have to create a world which is healthy, is possible, because we are the, the actual doctors of the world, we can say. We are the vaccines of the world, we claim, but really we have to do. Another very important, I talked about the medical tourism. Even today, some certain countries like Africa totally depend only on India. So can we not do our own country itself? That is what the government is pushing in a big way. The government of India is supporting all its efforts to make and bridge this gap. Ensure these 4 pillars are really, you make it affordable, you make the access to health easy as possible, you decentralize the data up to the rural, and the last and very important, how smartly we can do it. With these few words, thank you for the opportunity. Let us make an healthy India. Thank you.
So thank you so much. I agree that affordable healthcare, whether we use it digital or whatever it is, and without digital, no more healthcare. So affordable healthcare is very important. Having said that, Deloitte has come out with a beautiful report, The Future of Health in India. So now I request all the dignitaries on the dais, please release this book on the stand. I request Shri Robert Reviji to launch this book along with everyone. So ladies and gentlemen, this is the book which is on the future of health in India. So to talk about what is this book, may I request Mr. Joydeep Ghosh, partner and industry leader, life science and healthcare industry from Deloitte India. Sir.
Good afternoon, everyone. The advantage of speaking after such a distinguished panel of speakers is that everybody is well and truly woken up, because a lot of important points, very important points have been made. The bad thing is, of course, that I don't have too much left to say, because what I wanted to say and the points I had prepared painstakingly over the last couple of days is more or less all spent. But that tells me something, is that you're on the right track if all of the distinguished panelists have had similar remarks that is corroborative of what our thought process and our report has been, which we have just launched, as you can see. Still, I'd like to particularly thank that it's a matter of privilege and honor to speak in front of such a distinguished panel. Dr. Basant Garg, Additional Chief Executive Officer, National Health Authority. I wanted to thank Shri Arvind Kumar, Director General, STPI, Shri Robert Ravi, for your remarks from the the previous speaker. Your support and the insights you have given right now on various aspects of technology enablement in the healthcare sector, with the beautiful examples which you have given, really very grateful to you for bringing those to light. Those are very good use cases which we are seeing happening right now in various parts of this country. Maybe the rural-urban divide, we have still probably some way to go to bridge that. But some of the strategies which we have suggested in our report, using hospitals without walls, satellites and kiosks, telemedicine, telehealth, are some of those which will bridge those gaps, but we are cognizant of that. A lot of thanks to Shashi for Bharat Exhibitions for allowing us this platform to launch our event. I'll speak 2 minutes about how the technology enablement of this healthcare sector is going to affect our lives going forward. Having said that, in our report also, we have pretty much dwelled on the most important technologies: 5G, AI-enabled healthcare, IoT, wearable devices, IoMT, sometimes those are called, various security aspects of it, some of which also came up, were highlighted in the panel, which are important aspects of it. Generative AI, AI/ML is becoming all pervasive, as Madam yourself, you also remarked in your speech. We have dwelt upon those topics in our report. However, some of the things which probably have not been said so far, I'll quickly add to that. One of the primary reasons for this shift in healthcare is not only because of the availability of technologies, disruptive technologies, which collaboration between doctors and engineers is bringing to the table, but also because of the paradigm shift in the mind of the consumer. And that probably, though we may be seeing it more prevalent in the urban areas where people are getting or willing to take more control of their own health, which is kind of evinced by the fact that between 2012 and now, the monthly spending of families on healthcare increased twice, from 3% 2012 to around 5.9% recently. So it's not that that is entirely prevalent to the country. The rural-urban divide remains. That also is accentuated to the fact that most of our super specialty hospitals, most of our best doctors are probably concentrated more on urban areas, and our population is spread out much more. One of the other remarks which I picked up very well is that we are simply too many. I think some of you made that remark. That's absolutely spot on. And the only way, I mean, probably we will not be able to, the targets of WHO, so many hospitals, beds per population for 1,000 to 10,000 population, so many nurses per 10,000 population, we will really struggle to achieve those. A, because we are too many. Number two, we are spread across too many areas which are very underserved. And some of the areas, for Spiti Valley, for example, is cut off half the year. How do you deliver healthcare there, which is cut off half the year? There are places which are very difficult to reach. We have infrastructural challenges, we have technology challenges, we have social challenges as well. While internet, has permeated a lot to our population, still the divide between the female population using internet is still much lower than the male population. These are things which will improve over time. And how we address those things is a matter of, as somebody said, and one of my panelists, co-panelists said, never discount the power of policy. So policy is extremely important. I'm very glad to note, and our report dwells upon that as well, the achievements of Ayushman Bharat, all the schemes around it, e-Sanjeevani. These are the building blocks of our national digital health of the future. This subject is as important as our national security. As we saw during COVID times, how important it is. It could grind any economy to a halt. These are some of the subjects which we have dwelled on that. So we have talked about the demand and supply sides, that is what kind of technologies are available, how those can be deployed to improve the quality of human health, how to bridge the gaps, particularly in underserved rural areas which are difficult to reach. We have talked about how the mindset of the population is changing. People who were earlier used to carrying a token in a bank and a check, they today have learned to use UPI, and that's pretty much permeated at a very fast pace. And it has happened nowhere else in the world other than in our country. We're very, very proud of that. Why can't it happen for the health scheme as well? That is as much interoperability, accessibility, affordability as you can talk about. If we can do that for FS sector, why can't we do that for health sector? That's far more important, isn't it, to all of us? So that's some of the demand and supply side challenges we have talked about. We have talked about technology, infrastructure challenges, social economic challenges. And lastly, we have come up with a roadmap in the medium, short term and long term, how those kind of gaps can be bridged. In all of this journey, data will be key. So the DPDP Act, which has come up recently, is one of the key pillars to protecting the privacy of our citizens. We have talked about interoperability. We have talked about usage of generative AI and AI in terms of clinical decision making. Because obviously our doctors are probably our doctors and healthcare professionals, salute to them. They're probably the most overworked anywhere in the world, and they still deliver a fantastic job. Really, I request you to put hands together for the nurses and doctors who are sitting in this room. And I'll end by saying that while we always say technology can do this or that for you, yes, of course it can, and over a period of time it will prove itself, including digital twins and things like that. But one needs to also appreciate that of all the technologies, of all the things which we are able to do in our human daily life, probably some of the least understood things is the human body. I'll make a quote from, I'll try to figure out where this quote is from. Vas Narasimhan, the CEO of Novartis, he made a statement. What's often lost on people is how incredible is that we find human medicines at all. Our body is about 40 trillion cells working together. Out of that, we have only about 1,200 druggable proteins. Only a fraction of that we understand. So if you look at the records which have been kept with various drug agencies, more than 120 years, probably a few hundred proteins are discovered which are non-overlapping. Obviously, there are a lot of overlapping therapeutic areas in the drugs that have been discovered. So the fact that our understanding of the human body, both in health and in disease, is rather rudimentary, and the fact that it's so difficult to find systems, protocols and processes which can address the diseased human body, we still have a long way to catch up. in developing technology solutions which will address all of that. The science is really difficult, as opposed to many other areas where it may not be, that challenging. And that too, here, if a mistake happens, that mistake is extremely costly. A life is what is in the bargain. It's not like losing a few thousand rupees or something like that if you have a banking scam. It's of a very different order, isn't it? So with that appreciation, and with the appreciation that there are new technologies which we absolutely need to adopt, need to encourage, and need to vouch for, which will help our digital health mission in our country, across the length and width of the country, particularly in the hitherto underserved areas, is what I would hope. And with all of everybody's support, including the distinguished panelists, all of you in the room, the medical fraternity, the tech fraternity, the startups, I hope for all our continued success. Thanks a lot.
Thank you so much. We are running late as we have a beautiful panel. The next one, all the panels are very good. So I request Shri Robert Rivi to present a memento to our distinguished panelists on the inaugural session on behalf of Bharat exhibition. First to Father George P.A. Father, thank you very much for joining us and addressing us on this session. Then to Dr. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital. Thank you, Madam. Thank you to be here with us and sharing your views on the digital health. Commander Navneet Bali, the Chief Executive Officer, Clear Medi Healthcare. Sir, thank you so much. Be with us. Then to Father Sabu PL, Director, Fatima Hospital, Gorakhpur. Then the digital man to the software technology park man, Sri Arvind Kumar sir. Then to Mr. Joydeep Ghosh. Anthony will get it in the next session as he is going to moderate the next session. And Robert sir, I have the privilege to present a memento to you. Thank you so much. We come to the end of the inaugural session. We are starting the next session. May I request all the distinguished panel, please join us. A group photograph? Okay, fast. Now the next session moderator is already here, Anthony Prasad from the partner from Deloitte. I request the distinguished panelists, Dr. Sumit Ray, Medical Director, Holy Family Hospital, please join us. Dr. Vishal Arora, Chief of Business Transformation and Operational Excellence, Artemis Hospital. Mr. Amit, the founder and CEO, Logic Boots Private Limited. And Dr. Reshmi Gupta, is she here? Yeah, Dr. Reshmi Gupta, Managing Director, Felix Hospital. Ladies and gentlemen, put hands together to welcoming all the distinguished panelists. May I request all the panelists, please take your seats, sir. Arvind sir, hope you are joining us for this panel. लंच साथ में करके जाएंगे प्लीज. अच्छा ठीक है, डिनर करने आएंगे. गुड, आई विल वेट फॉर यू. So once again, I would like to introduce the panel. The panel is moderated by Mr. Anthony Prasad, the partner of Deloitte India, Dr. Reshmi Gupta, Managing Director, Felix Hospital, Dr. Sumit Ray, Medical Director, Holy Family Hospital, Dr. Vishal Arora, Chief of Business Transformation and Operational Excellence, Artemis, and Mr. Amit Singh, the founder and CEO, Logi Woods Private Limited. Anthony, over to you.
Thanks, Shashi, for this. We had a exciting inaugural session which got concluded, and the type of insights that came out and the interventions that we are looking at for the industry is much promising, and I think it sets the path for this conversation as well. Maybe I'll give a quick brief, taking points from the previous session. A lot of us spoke about AI and advanced analytics and how it's going to have a big impact on the healthcare ecosystem. Ultimately, when we talk about all this, it's primarily to achieve 3-4 obvious goals, right? We talk about improved quality of care, affordable care, and accessible care. And most important is when we talk about affordability, how all this can be at a reduced cost, right? And technology is playing an important role. When I walked out into the Delhi airport today, and imagine 15-20 years before, when we had to get into an airport, look at the airline ticket that we had. It was like a passbook, or like a checkbook that we had, right? And later it changed into a piece of paper, and then post that it changed. You don't need a paper, you can just show it on your mobile phone. And now you don't even need to show your mobile phone, you just walk through Digi-Yatra, right? It recognizes your face. So that's the shift that we are seeing in technology and how it's changing the way we as individuals function in our day-to-day life. And that's the big, and how are we as a country adopting to these changes? And also we spoke about 5G, Mr. Robert spoke about it. But the biggest impact that we need to also be aware is, because of 5G, the consumer of the future is also going to be different, right? He is going to demand a lot of outcomes, right? AI-based outcomes for healthcare. He's going to exert pressure on the system. And with that segue, I thought maybe Dr. Reshmi, I will start the opening question with you. Where do you think AI is going to play a big impact on the patient journey, right? Right from diagnosis, or rather from preventive health to diagnosis, treatment, and then post-treatment. What's your views on that?
Actually, the AI has come so much into the system that everybody is aware of it. It is going to help us. But the major gap is there, because we have worked on AI, we have worked on the system, but we have worked very little on the data security and privacy. That is the big challenge. Even when the hospitals are using it, there is a challenge of data security and the patient privacy, which is a big challenge that we are not using it as at par as we should have. So now the people are aware. Now everybody is like, they don't need any hard copy of reports. They don't need, everything is on apps. So from the very beginning to the very end, it is working very good. So for the HIS, the Hospital Information System, the patient's journey from the admission to the hospital to the discharge, everything is there. And the most important is the patient is quite aware of the things, and we can track very well the whole journey of the diseases, especially if we talk about the chronic diseases. So it will be quite easy to map the things, because people often forget what treatment they have taken 2 years back, what kind of surgeries they have taken few years back. They don't have the document, they have shifted somewhere or the other, they got transferred to some place or the other. By AI and by this all digitalization, it will be very easy to improve the quality of services we can provide to the patient.
Great. I think the point that you made on quality and when we spoke about accessibility, maybe Dr. Sumit, I would wanted your views on this, because see, we spoke about, let's say, a lot of information which is available. Today, I mean, 2 weeks back I was speaking to another hospital, and they are looking at the moment you send a picture of your retina, they are able to predict whether you have a diabetic retinopathy, or whether you'll be impacted by that or not. So where it also reduces the inflow of OPD patients also. And the most important thing is, how is this shift that how are you prepared for this shift, and what are you doing it from your hospital perspective?
Yeah. So before I go on to that, just adding to what Dr. Gupta said, before I became I'm still an intensivist more than an administrator, health administrator. So as an intensivist, I see critically ill patients, and I've done that for more than 25 years. So I'm just giving you the history, the reason being that I look at healthcare a little differently. And we as intensivists have used technology as doctors, intense technology for a long time. Ventilators, monitors, huge amounts of data. So how would AI help us in that? One is that integrating all that data to give us, in a nutshell, a lot of the conditional issues that are there with the patient, which visualization of that sometimes is difficult. It would help us in that. Where it would help an intensivist or a clinician in many ways in terms of focusing on certain kinds of research which was spoken about, what is called now precision medicine or personalized medicine. I don't like the word personalized medicine because it puts individuals in silos, maybe more precision medicine, is the fact that huge data analytics is able to identify subphenotypes of patients who will require what kind of therapy. Those are the great advantages of AI. AI will be part of medical care, there is no doubt about it. Having said that, I have another introduction I want to, is that, when I was growing up, I was told never be seduced. My father told me never get seduced easily. And my partner in life also tells me that, don't get seduced too easily. And I'm never easily seduced by technology. Technology I use regularly, daily, intensively for many years, okay? So what are my anxieties about it? So the point is, when we are looking at artificial intelligence in healthcare, the importance is, who are we looking at? What are we trying to benefit, and who are we trying to benefit? Finally, it is the patient and the healthcare provider, the interaction between them. That is the focus of healthcare delivery, I think. It is not, so what has data and research suggested to us? Has it helped improve outcomes? No. That is the productivity paradox of AI and digital health till now. It has not improved outcomes. What it has done has improved billing, it has improved data collection, it has improved diagnostics, but not outcomes. Until it improves outcomes, the question, the role of it is, we have to see how we can improve outcomes. So that's the question. So for me, the focus is the patient. Are we involving patients in making the, the digital health with technology which we are developing? That's an important factor. The reason I'm saying is, there's an example from Kerala, palliative healthcare. One of the best palliative healthcare at one of the cheapest rates in the world, at the least amount of cost in the world, is from Kerala. What did they do? How did they gather their data? They always involved the patients involved who were at the receiving end of it, that what they need. Are we doing it with digital technology? Right? So that has to be the focus. Finally, it is not profit. I believe that healthcare should not be for profit. If you see the best healthcare delivery systems in the world, which are the best healthcare delivery? If you look at the outcomes of healthcare, these are good public healthcare systems. If you look at OECD countries, the best healthcare is provided by public health systems. not by the United States, which has an over-privatized healthcare system like ours. It is also financially unviable for the US. It spends 17% of its GDP on health with much poorer outcomes than any OECD country compared to 8.5 to 9% of GDP spent by other developed countries. If you look at LMIC countries where we are from, which are the countries which have done good and well in healthcare delivery and outcomes? Sri Lanka, Vietnam, Thailand. What is their spending on healthcare? You know, when we are focusing on digital healthcare and technology, we are forgetting the fact that healthcare requires investments. It requires people on the ground. I volunteer at a hospital in Chhattisgarh, 70-bed hospital, do fantastic work there. They do fantastic work. When I go there, when I help them in the ICU, what did I find out? I found out that when I'm there, it helps. How does it, with the digital technology, when I connect with them from here to a certain extent, it helps. But without healthcare workers on the ground, it is of zero value. Because why is that? There are many studies which show that. The touch of the healthcare worker is as important as the algorithms that we provide for better health. Without a good nurse, so when Holy Family, I mean, I'm not trying to brag here, is considered that it's a very good healthcare delivery system, what is the most important thing the patients say? They say, well, doctors are good maybe. The nursing care is incredible. And I say that not because I'm going to, I mean, for the nurses here, it is about the human touch. All these elements have to be considered in digital health and AI before we go forward. Sorry, I've taken a lot of time because I wanted to, as they call, disrupt. That's a favorite word now. So disrupt things, the excitement of technology. We have to question that excitement, not get completely seduced by it.
Thanks, Dr. Sumit. In fact, in my personal view, when we say AI in healthcare, I don't call it artificial intelligence. I would like to call it augmented intelligence. You augment your intelligence to take better decisions, right? So that's exactly what we're looking at. And obviously, you spoke about outcomes. Yes, while there are benefits in terms of how can you reduce diagnosis time and put your patient into the treatment cycle much faster, that's something which we are also looking at. As we discuss this, we also have seen that how can we do more with less, right? Because as a country, there are infrastructure challenges, but we still were able to rise up to the occasion, and COVID is a very big example for all of us, which means a lot of efficiencies that can come up in the healthcare ecosystem as well, right? While one is care delivery, but as a hospital, as a unit, there are, how do we build efficiencies using AI? And maybe this is where, Vishal, I thought I will like to take your thoughts. You know, you focus on business transformation at Artemis. What are ways that, you know, dimensions, while we can talk about cost, but more important aspects like reducing patient waiting time, or, you know, how there are a lot of movable assets in an hospital, how AI can help manage all of that. What's your view from an operational efficiencies point of view?
Sure, thank you, Anthony. So, AI in healthcare is something which is the need of the hour. So, there are no second thoughts to it. If you see from an administrator perspective, there would be 4 angles to it. One angle, Dr. Sumit has already covered, so that's the clinical angle. The 3 other angles which we largely speak about, one is the patient perspective, right? We're coming in, a patient coming into a hospital, how can technology help him? Second angle, I'll be speaking about all the 3 angles, maybe 5 minutes I'll take. Second angle is on the cost effectiveness. So how can technology help hospital become more cost effective? And third is how can it help increase the revenue? So these are the 3 angles. Now, touching on to each of them point by point. So first one would be on the patient perspective. So there are stats which says roughly around 15% of the patients who spend more than an hour in the waiting of a OPD tend to change their healthcare provider. So that's where it's a potential revenue loss for the hospital. There is a lot of load on the hospital, specifically coming from the front office where there are queued up. Generally OPD hours are limited, right? So typically hospital tend to do 10 to 3 is their typical peak OPD hours, where most of the OPDs would be queued up, the entire system is overloaded. That's where technology would come into play again. So using augmented intelligence from the point starting from the scratch, maybe where a patient can, as Dr. Bali was mentioning in the morning, how many of us would use app, right? So if a patient can directly book on an app, come into the queue, maybe he lands up in the OPD, a doctor prescribes on the EMR, the investigations and the pharmacy for the particular patient. The patient automatically gets a WhatsApp, right? These are the investigations booked for, the doctor has advised for you, this is the amount, click to pay. If you want to deselect anyone, deselect and just go ahead and pay. You automatically land up in the sample collection center where your queue is already getting displayed. You have already paid up. So you bypass the entire system going back to the long queue of reception, checking what the prices are, would you want to get the test selected or not. Eventually end up in the sample collection, getting it collected and your report is displayed on your WhatsApp as soon as it is ready. Right, so this, or from a pharmacy perspective, right? So your pharmacy is already ready in the pharmacy, just go and collect it, pay it and move on. So life can be that simple from an operations perspective when we talk about using augmentation in the real life. When we talk about avenues like a cost optimization, so I see many nurses from Holy Family attending this. So again a stat, I'll augment my statement by a stat, more than 10 hours a week of the healthcare administrator, 50% of the healthcare employees, healthcare workforce goes into the clerical works. How can we reduce that leveraging technology and effectively make use of that in delivering patient care? The same stat also says more than another 20% is the chunk who spend more than 20 hours a week, which is 50% of the time in the clerical work. There is where technology comes into play. I'll give you certain case studies. Maybe an example with a simple use case of a RPA, robotic process automation, where as of now, if I want to do a simple TPA reconciliation for any hospital, that's a pain area, against which patient the payment has come up, right? What is the deduction? Maybe more than, for a hospital of our size, there is a team of 3 people who are doing this job day in and day out, which is a simple thing where the technology can pick up my bank statement, what the payment has come in, open the account of the TP against which it has been settled, what was the due, what is the TDS amount, what is the balance amount and what the deduction is against. As of now, this for most of us would be a manual activity. Another use case on same thing on the CGHS ESI empanelments. Now we use the portal to update the bills, the exact history of the patient. That is again a simple manual activity which can be easily automated and lives of everyone becomes easy. Simple paradigm, rostering for a nursing. So as of now, how typically we tend to do nursing rostering, right? So we have a bed count, say particular floor would have 10 beds, we apply 5:1 is the ratio, we will stack 2 nurses per shift for the particular day throughout 365. But no one can actually predict. That's where predictive analytics would come into play, and using a dynamic rostering kind of a system, I can use AI, train my tech to leverage how I can stack my nurses across the year. It becomes more of a dynamic rostering wherein morning a WhatsApp would be given to a nurse, your shift is today at this particular floor, at this particular area, you will be seeing patient number this to this. That's where we can at least cut down our 5-7% of our cost, which eventually gets passed on to the patients. None of the hospitals, most of the hospitals are sub 20 kind of a EBITDA margin which they enjoy, barring a few who are northwards of 20%. So that's where the cost pressure on the hospital is there, where they can leverage technology and cut down on their cost as well. So these are certain examples where, yeah.
Sure, Vishal, not to put you on the spot, but we discussed this while there are operational efficiencies. Are we transferring this back to the patient?
So eventually, Anthony, we discussed this in the morning as well. So how would it get transferred? Eventually, every year hospital does a price increase to meet their inflation cost, right? If I am enjoying my EBITDA margins and I am at a healthy EBITDA margin, I would not tend to pass on that to my cash patients, right? I'll tend to, rather than doing a 5% price escalation, I'll settle for 3. That's a pseudo way on passing on these benefits to the patient, right? And that's how somehow eventually I told you in the morning as well. So hospitals cross-subsidize. The amount of CGHS and the panel business we have been doing, the eventual burden is passed on to the cash patient. So getting in the leverage of operational efficiencies, leveraging technology, the burden on the cash patients would go down lesser.
Sure. Just to flip this question back to you, Dr. Sumit, is Vishal spoke about how we can use technology to improve efficiency in hospital management. Now, if I take this further to the physician, right? A lot of times the physician spends on writing the case history and stuff, and then you have technologies on voice-based recognitions, auto dictation, and all of that. Where do you think today physicians are in the maturity curve for adopting technologies? Right. And also, when I started this, we spoke about how the consumer of the future is going to be more tech savvy, and he would prefer a physician who's also tech savvy, right? So, in your view, how is a physician of the future going to be look like? A physician with AI or a physician without AI? What's the preference going to be like?
So, see, there is no doubt that we, as physicians, as nurses, we have to be part of the whole process of adopting AI. There's no doubt, right? Having said that, 2-3 things. As I said initially, what is the intent of the delivery of care? Second is you gave very good statistics about about governance of healthcare, but also realize that 30% hands-off time by nurses and doctors because of electronic medical records.
Right.
Actually, you have to increase your staffing of nurses if you want the same amount of hands-on time on the patients in the IPD if you use electronic medical records. I'm not talking about the lab data, the radiological data, where it will be very, very useful, but I'm looking at writing the notes, etc. So when we look ahead, as you said, probably voice recognition, doing the notes like that would be very, very useful, because one of the biggest problems of non-adoption of EMR in many places by physicians and nurses is the time spent of the patient. In the OPD, so there was this major study in New York health system. They have adopted digital health. Huge amounts of money they have paid in, more than $3 billion into the, and they found that so many physicians said, the patients come and say, he's looking at the computer, not at me. Okay? So you have to realize healthcare is not like any other industry. That individual connect with the patient is as important for the physician as the use of technology. So that element has to be always integrated into that. And that is what, I'm sorry to say, please don't take it personally, that IT people do not take into consideration. And they are for me, sometimes if an IT person's relative is admitted to the ICU, it is the most difficult for me to explain to them, because they think life is an algorithm and patient is an algorithm which can be controlled, which is not true. As Mr. Ravi said, that patient is millions and trillions of cells, and we understand only certain elements of it. And a lot of it, our clinical judgment, what does it mean? Clinical judgment is not in the air. Clinical judgment is dependent on the information we get, but also the experience of a visual look at that patient and the touch of the patient, the feel of the patient. If you don't use a stethoscope, you may use an ultrasound probe, but you need to see, touch. So all these elements are very, very important, and that remains. The other is, as I said, intent. Is it for profit? So Mr. Ravi also spoke about many of the things that have been implemented in Tamil Nadu. He was focusing on Tamil Nadu. Why is it that? Kerala, Tamil Nadu, two different, completely different from the rest of the country. Why? The intent and the governance is totally different. And that brings us to the question that what you put about, data security. What is this information is going to be used? And I don't mean only data stealing. I mean surveillance by governments. You can have a Putin or a Chinese government which can have so much surveillance. DG Yatra, it's a mechanism of surveillance too. So all these elements have to be looked at, and as I said, I don't get easily seduced just by technology.
Thanks for putting that, Dr. Sumit. I always like these debative conversations, but just to give you another perspective is, technology can reduce the burden on the physician, and so that he spends more time with the patient, it's right?
Possible.
Right?
It's possible, but not being done yet.
Yeah, that's the intent.
Actually, this is all about a balance.
Right.
Yeah, everybody is very happy कि the documentation part or if the other part, if AI or with the help of digitalization, the time can be spared, that can be consumed with the patient.
Absolutely.
That can be consumed for the interactions.
Yeah. Actually hasn't happened. Actually, it has taken people's hands off patients more. Yeah. Actually, Denmark and Sweden, Denmark has gone off EMR as a country. Sweden is probably going to go off EMR because that's what they found. Having said that, again, analysis, Deloitte is one of the big four, so I think I can't remember, either Ernst & Young or PwC did an analysis. The only jobs which are going to increase in the next 25 years is caregiving jobs. For there, you need people's touch. Repeatedly, I'm reminding, because caregiving jobs are going to increase, while other jobs, AI will take away many of the jobs that we do, many of the scud work is done, but caregiving jobs will increase because the human touch is very, very important.
So I'll just add what Dr. Sumit has been saying. So Dr. Sumit, as an administrator, we completely echo what you have been saying. So, and I'm tempted to say, so 100% echo what you have said, that technology cannot replace clinicians and the personalized touch has to be there. And what Dr. Ashmi said, so where technology comes in and creates a balance, maybe in the OPD, I'll give you an example where it is a voice to text kind of a situation, or maybe a simple stylus and doctor scribbling on a iPad and the handwriting gets read and it is automated into a digital prescription to the patient, right? So that's the balance what we want to create, and that's the era what we are looking at. There have been hits, misses, and we are learning, right? So eventually that's where technology and sympathy and medical care gets balanced out. That's the future what we would look at.
Absolutely right. You put it right, Vishal. And as we talk about technology, obviously there is a lot of policy interventions.
Yes.
And then it also, like what you said, there is some people get seduced by technology, and you feel more startups also coming in. With that perspective, Amit, I just want to flip it to you. Where do you think the startup ecosystem in health tech is currently now? And also, if you look at today's adoption rate, you have digital pharmacies, diagnostic services, at least even for, like Vishal spoke about, app-based booking and all of that. Where do you think are some of these sub-segments in the healthcare ecosystem where it is a big play for startups? And what are some of the challenges that we face from a policy perspective that you think we should look into?
Thank you, Anton, for this wonderful question. I would like to answer same. Jai Hind, everyone. First of all, as a startup, we are working on manufacturing of such medical devices which is more advanced than what till now is being imported from other countries. Like as far as I am concerned, I'll talk about our products and what challenges we have faced in the past. We have been working into the innovation part since 2013. But the ecosystem now, what we are getting, was not available during that time. From funding to all, everything. Like Logic Boots is being nurtured under Ministry of Electronics and IT, STPI, and also incubated at IIT Roorkee. Our first product is the device which is the best friend of doctors, a stethoscope. We are working on that, and like as sir said, it's a AI-based stethoscope. And it can not only just listen the murmurs. The patient sitting in Chennai and the doctor sitting in Delhi can listen the real-time murmurs of that patient. First. Second one is, apart from that, we are also giving the ECGs on the cloud app. Apart from that, the most important work, which is also a dream project, it will detect the heart and lungs diseases at the moment in the real time, and the early detection of heart and lungs diseases is what we are working on. And this is the first project which is for which the preclinical trials are going on at AMTs at YZ. Apart from that, another project which we are working on is nanotechnologies. We are working on nanobots which can destroy the cancer tumors by blocking the blood supply towards the tumors. So these are the two projects in the healthcare industry we are working on. As far as government is concerned, I personally belong to a lower middle class family. My father was working in the Indian Army. I left the government job and just to pursue my dreams and do something for the country, at least in the innovation part in the health tech industry. And till now we have seen most of the devices are being imported from the other countries. And now we are capable to manufacture more advanced version of that. And that's what we are doing currently. So, and the government is helping from being, providing the mentorship to connecting to doctors. Like till now, engineers and doctors are like they are moving the another way, but now we can directly, we are incubated at MedTech SGPGI, we can approach to the doctors, we can take the time, even from AMTZ, even IIT Roorkee is helping to connect with biomedical colleges at Chandigarh to get the data sets and all. So it's a combination is what we are looking for, and that's helping us a lot to find the we can do the electronics and the software part, but the prime work is of the doctors, that has to be told by the doctors. And apart from that, government is providing a lot of funding, and वो कहते थे ना पहले कि पैसा नहीं है तो बिजनेस कैसे करो, तो वो चीज़ें ख़त्म हो चुकी है. Now we have the funds. Recently we have received around 15 lakh from Startup India Seed Fund scheme and through STPI. So we have the fundings, we have the proper ecosystem, we have the government support from preclinical trials. Like recently for the 3 times we have done meetings with MedTech Mitra. It's a part of ICMR, and they even अब ऐसा नहीं होता कि हमें कॉल करना पड़ता और we have to request, they eventually call us time to time every week that what is the progress, how we are doing, go do the preclinical trials, preparing the dossiers and all everything. So this kind of ecosystem we are looking for, and it's a perfect time for the startups to innovate.
Absolutely. In fact, Amit, you touched upon a very important point, right? Doctors and engineers working together. Let's say if you do robotics and patients, right? Patients too, absolutely.
Patients have to be part of these.
Absolutely.
Without that, it is not going to be.
Let's say robotic surgeries or AI. So just to flip the question, where do you think therefore the big change should happen in our education system itself? Because when you get into a medical degree, then the curriculum also needs to change. You need to be taught robotics, you need to be taught AI, right? Because that's going to be a big shift. So where do you think is the, maybe I'll take Dr. Sumit, your views on this. If you look at it from an education point of view,
Right.
What are the big shifts that you need to?
Yeah, our health, medical education needs many levels of change. One is obviously understanding technology more, so that when an technology person talks to you, what you expect out of that technology, we are also aware of, right? What we want out of that thing, what are the possibilities? So obviously part of that education has to happen. Also the education which doesn't happen is also our understanding of the economics of health. We don't know. We don't understand, in our education, we are never taught the economics of health. Why should, why should we need to do these investigations? We are taught, and also unfortunately, larger hospitals, etc. Our dependence on lot of technology which we can do clinically is also reduced. All these elements, it's also a pressure. All these elements have to be, an example of Ebola was given, okay? So if you look at the Western African example of Ebola, so what happened in Ebola? Yes, you predicted where it would transmit with technology. Who were the people who could take care? The American doctors who reached there could not take care of the patients. Who took care? The Cuban doctors. Why was that? Because they are trained to do the best they can with the least amount of available technology. And they perform the best and save the maximum amount of life. So that is also going to be part of our training. That yes, you learn to use technology, but do the best you can with the least amount of technology. All this also has to be part of our role. Because if we want to approach rural health, right, as I said, I volunteer somewhere. It is not just technology, but your ability to use the least amount of technology to do the best. That capacity also has to be developed.
And therefore the use of technology, Dr. Rashmi, to use very specifically, if you look at the caregiving population in India, right, or if you take physicians, I think we are at around 8 lakh to 10, almost close to 1 million physicians in India, but for a population of 1.3 billion, right, it's a huge gap for them. And therefore technology eventually solves some of our larger problems, right? Obviously, I know we discussed the emotional aspect of it as well, but where do you think the adoption rates for at least at the base level, right, like teleconsultation, telemedicine, are there from an India perspective?
Actually, the whole scenario is to use the technology judiciously. We have to be very cautious, and we have to be acceptable to this, because the scenario is like 35% of the population is there in the urban areas and 80% of the medical health is there in the urban areas. So we have to actually realize the real scenario and act accordingly. Because to reach to the underprivileged areas, to reach the rural areas, we have to be open to the use of this technology, use of telemedicine, because it is not possible. It will take a huge, rather a long way to reach all the population if we talk about the human touch. So we have to be very practical about what actually we need to do and what actually the telemedicine and the AI and the digitalization should be used. To serve the rural areas, definitely we have to be dependent on the telemedicine, and we should make system and data analytics and rather data privacy and education of the rural population. First we have to make them acceptable to telemedicine. So we have to be very practical and very receptive to the things. Because we cannot say this is practical and this is not practical and this can be done and this cannot be done. We have to see it into the real scenario, what actually is the scenario. And in Indian scenario, we have to be adaptive and we have to accept this truth that we should move to the technology and for urban population and to cover the health to all. This is not easy to say that this can be with the human touch. It is not possible. This is the reality, it is not possible. We have to move to the digitalization, we have to move to the telemedicine and make the health approachable to all rather first.
I think it's... I'll just come to you. Sure. Just get Vishal's view on this. From a hospital perspective, where do you think you are in terms of reaching to the masses, while you are there in an urban setup? But what are initiatives that you're looking at using technologies to reach in the...
Yes. So, I think I'll echo with what Dr. Ashmi has been saying again. So, I'll give you example, a case study of, and Dr. Sumit also mentioned that healthcare workforce will expand. This is the area where 25 years we will see more of people coming in. Now, as the demand increases, the number of, we are already low in terms of the doctor-patient ratio globally, right? So that everyone knows. And overnight nothing can be changed. So, we will be required to use our man force of the clinicians in such a manner that we are able to, leveraging technology, that we are able to cater to the needs of the people. So, that's where I'll give you example of radiologist. Now, radiologist is also an era where the radiologists are limited. Smaller hospitals cannot afford a full-time radiologist. That's where the PACS has come into existence, that X-rays are getting reported. Now AI has taken over, where with a confidence level of more than 95%, the X-rays are getting reported automatically by AI. That's beneficial for both the smaller setups and for the bigger setups like us as well, where we do roughly around 200-300 X-rays a day. The AI reports my X-ray, which are normal, gets passed on, where there is no intervention of a radiologist required. In the order of criticality, it also gets parked, right? So these are the critical X-rays or the critical investigations which the radiologist has to look on the first priority, so that the results are delivered to the clinicians and they get to know this is something which is of high importance and a high priority. So that's where technology would help reaching out to the masses as well as in the ecosystem. Given the count of the clinicians is limited, technology would help us deliver faster and deliver faster to the patient. So that's where I'll say
it's more to defined by the problem statement and what we want to do.
Correct.
Yeah, Dr.
Just adding to that, I don't think that digital health and caregiving by human touch go against each other. It doesn't go against each other at all. What I mean is that there has to be a healthcare provider, doesn't necessarily have to be a doctor there at the other end. Like I was saying, that small hospital that I interact with, there has to be a caregiver at that end. Doesn't mean to be a doctor necessarily. You can augment the knowledge from this side to a certain extent. Having said that, most of the good healthcare systems have people on the ground using technology, which augments, right? The third thing I want to add is this misconception about population. That has been debunked. that we are a large population. China has proved, I don't agree with their model of governance, but China has proved it. Second is the density of population, and second, if you look at our population, it is actually going to shrink soon. Only 3 states have net fertility rates, which will produce more than all states now have net fertility rates where the population is going to shrink. Only 3 states, UP, Bihar and Jharkhand. And in less time than we had been predicted, our population is going to shrink, and it is going to be a disadvantage at that time. So let us not make a bogey out of population. Other countries with higher density of population have done much better than us in health, even among LMIC countries. Look at Vietnam, which has a very high density of population. It's how you deliver care. Kerala is a very densely populated state. It has delivered fantastic healthcare relative to any other state in the country because it is about governance. Niyat kya hai? What you want to do for the people. Correct. So it depends on that.
Absolutely. I think well said, Dr. Smith. I think it's what is the intent and how are you prepared for both sides. Yeah. Maybe, we're running short of time. Amit, maybe the last question to you is primarily on, therefore, from a policy perspective, what are if you have to name, what are the 2 big interventions that we would need from a government to enhance adoption of digital in healthcare? What would be your 2 big asks?
Yeah, first of all, till now, whatever support from the government and the policies made for the startups are one of the finest, what I am feeling particularly. And apart from this, 2 things I would like to add on this. First of all, for the fundings, as a startup for the funding part, it takes a lot of time still. Almost sometimes it takes 6 months to 1 year. And the people, the startup founders need to wait till that time. They have 2 options, either wait or do something else. So first of all, this one is what I would like to add on. And apart from that, the trials and all, everything, they are going in place, like our last talk with ICMR. And they said within 3 months you can finish off with the preclinical trials. So this was earlier, it used to take 1 or 2 years. But now within 3 months we can cope up with that preclinical trials, and then for the real-time on-patient trials and all, everything. So the first one is the funding part. For a startup, it's a fuel. Without that, none of the startups would be able to survive. और सर कितना ही करेगा आदमी घर से लगा लगा के. So we'll be needing some support. To be very frank and practical, this thing. And second one is even I'm sorry if किसी को बुरा लगे तो, but when we approach the doctors ना, so they were like अभी नहीं, we'll meet 1 week after 1 week. और वो एक तो ये थोड़ा सा यहाँ पे प्रॉब्लम आती है. So I would like to add on कि ये सेकेंडरी प्रॉब्लम अब ज़रूरत अभी की है. We are writing the codes, so we'll be needing what medical advice from the doctor itself. मतलब प्रॉब्लम ऐसी हो गई थी सर, वन ऑफ आवर co-founders had married a doctor for the same problem.
That is true partnership, I think.
That may be a dangerous partnership.
So अब टेंशन ही खत्म हो गई सर. Even at night 2 AM we used to call her कि ये प्रॉब्लम है, how we are going to do it. So इस तरह चीज़ें चल रही हैं. तो ये एक थोड़ा सा है ना, वो कहते हैं ना, इंजीनियर्स एंड डॉक्टर्स अब तक हस्बैंड वाइफ की तरफ से लड़ेंगे दिन भर, काम साथ ही करना. बिकॉज विदाउट मेडिकल डिवाइसेस तो डॉक्टर्स के लिए प्रॉब्लम है और हमारे लिए भी. वी आर मेकिंग द डिवाइसेस. थोड़ा सा डॉक्टर्स के एंड से आई वुड लाइक टू रिक्वेस्ट कि थोड़ा सा टाइम दिया कीजिए आप लोग. एटलीस्ट दे आर बिजी, 18 घंटे काम करते रहेगा, बट 5-10 मिनट तो निकाल लिया कीजिए. तब तो कुछ बना पाएंगे, अदरवाइज व्हाट वी कैन डू.
Well said, Amit. Maybe I'll open up, maybe in the interest of time, maybe we'll take 2 questions from the audience to the panel. Any? There's at the back. Yeah.
So I'll like to ask Mr. Vishal, using any interventions as far as your radiology is concerned, utilization of some new AI tools or not?
So when it comes to our radiology at our hospital, we have been using PACS. So PACS is very commonly deployed across all our hospital network. And in terms of AI, what I spoke about, there are some pilots going on. so which would help us faster report X-rays and stuff like that. That's best what we've been doing as of now.
Thank you very much.
Thank you.
So actually I have a question to Amit sir. So like we are talking about AI, we are talking about healthcare. As a
Maybe you need to
concern
keep
raised
the mic little up. Mic,
Yeah, as a concern raised by Dr. Rasmi, the main is data security, right? What we are putting, either it could be genomics, metabolomics or proteomics, right? So the analysis what we are doing at the fast level, we are using the AWS, right? Which is a US based company. So is there any alternative available in India or supported by Ministry of Information Technology where we can access that server and do the analysis? Because that without that computing services, AI is next to impossible.
Yeah, exactly. As far as cloud server and these kind of
Exactly.
things are concerned, there are many options government is providing free of cost to the startups.
Okay.
Starting from Google or AWS, like we have the credit of 5 lakhs till date for the AWS, and apart from that, they are supporting for the next 10 years.
Okay.
So expenditure on the cloud part is almost nil for the startups as of now. We just have to work. पैसे हैं, server है, technology है, government है, doctors भी हैं, तो अब करना खुद को है.
Yeah, actually the problem is I am running like a genomics data startup, okay?
Oh, actually थोड़ा
So,
मैं सुन नहीं पा रहा.
yeah, actually I am running a startup. We are providing the analytics services.
Okay,
But we are impossible to get that information where we can access that file like a server or do the analysis. So
After this
yeah,
discussion,
yeah, I will do that.
Maybe,
I will do
yes.
discussion over that.
Maybe one last question.
Yeah,
from the
one
front.
last question. Yeah.
Hi, Sumit sir. This is Mansoor from PAL Healthcare. So I have a question that dependency of the AI, like we know that the data is not always to be accurate in terms of the diagnosis. So do you think that this is the major threat of the medical diagnosis or for the patient's records for their improvisation of their health, like in the major surgery concerns? Not for the blood test report or the preliminary type of things.
So if I'm get it right, so you're saying, does it help in our diagnostic ability as doctors? No, arriving at a diagnosis, I couldn't get it, sorry.
So what I'm saying that is,
I can hear you, yeah.
AI is capable, means whatever the data analysis report that AI is given, is that report is capable to cure to which help the doctor
Right.
to cure their patients.
Okay. Very good question. So what AI has been able to help us with, and this is based on a study on, I don't know if you know about the IBM Watson project, where they used AI and tried to compare it with a clinician. So what was found and what we see in our practice is that if AI is used to gather all the diagnostic data, the labs, the radiology, for critical care, the ventilator data, the monitoring data, etc. together, to give a kind of a report which helps us identify the possibilities. But finally the diagnosis still now, I think, depends still now on the doctor. But when there is more integration of medical disease processes into the AI, which Watson did to a certain extent, there will be a help from that. But see, 25 years down the line, we don't know. As Maynard Keynes and Manmohan Singh said, in the long run, we are all dead. So we don't know what to predict in 25 years. But in the next 10, 15 years, what is possible is that these data integration of our knowledge systems of research, etc., into the diagnostics, etc., will help us arrive at a diagnosis. But the diagnostic ability the diagnostic decision will still be left with the clinicians. It will help, it will surely aid. The possibility of it helping is absolutely there. We are already using it to a certain extent. We always look at Google for so many things, We are already using it, augmented intelligence.
Thanks. I think this was a very interesting panel, right from we discussed about addressing challenges of our nation to the emotional connect to startup ecosystem and operational efficiencies of an hospital. Thank you very much for my fellow panel members for making this very interesting, and thanks audience for your patient hearing.
Thank you, Anthony. Thank you so much. End of the day, as long as... No, we need to have two more. We need to present a memento. Don't be hurry. We'll give you lunch to everyone. Yeah, yes. So, having said that, the affordable healthcare is very important. So, using all this kind of digital or anything, if we can take the ECG from the rural area of Jharkhand or where, end of the day, the affordable healthcare is very important. Having said that, last week I got a call from IIT Mumbai. They started a course for all the healthcare industry, those who are in healthcare industry, for the doctors, for the nurses and everyone. They started same digital healthcare course with UNICEF. So they wanted to come and talk about it, but somehow they could not make it. So this last week they started. It's from IIT Mumbai with UNICEF. They started a special course on digital healthcare. So it's a 6 months and a 1 year course for all the people, those who are working in the healthcare. Sir, thank you very much for chairing this session. I would like to request Commander Bali sir to come and present the memento to the distinguished panelists. First to Anthony, who chaired the session. Anthony Prasad is a partner from Deloitte. Thank you, sir. Now I request Father George to please come on the stage. Thank you, sir. To present a memento to Dr. Reshmi Gupta, Managing Director, Felix Hospital. One hospital to another hospital. Thank you, madam, for sharing your views, and thank you, Father. I request Father Sabu to please come on the stage to present a memento to Dr. Amit. Mr. Amit, founder and CEO, Logic Boot Private Limited. I request Dr. Sumitri to present a memento to Dr. Vishal Arora, your ex-colleague. I hope I am not wrong. So thank you so much. We'll break for the lunch. Oh, sorry. Please. No. I will present the memento to Dr. Sumitra, because he is part of us. So, yes, exactly. Thank you so much. We'll break for a lunch, quick 45 minutes lunch, not 1 hour. And once again, I request those who are there in the stall in the back, please don't talk when the session is on. My humble request with folder dance. It disturbs the entire panel. Thank you so much.
Every need and in fracture around us. We have this concept of growing smart cities, where we have all the living amenities together. Today, the idea of community living has transformed into sensible cities. We do not have to step out from smart cities for any of our needs. Let it be the schools, hospitals, malls, entertainment hubs. Everything is available just a couple of steps away. A well-planned community living facility brings the world together to where you live instead of making you wander for them. While we are aiming for accessibility, we need to ensure these cities are safe for living. Yes, security systems are vital for smart cities. Why do we need to have a security plan in the first place? The answer is simple. because we as a community are going to live there. We need to ensure social safety, assuring complete city monitoring, help to maintain law and order in the community, controlling the traffic flow, improve city functioning, crowd management and analysis. How Norden Communications can help with all the concerns we discussed. City surveillance with constant video monitoring, providing public safety with accurate surveillance, traffic monitoring and law enforcement ecosystem, proper law enforcement with ANPR, automatic number plate recognition, and FRS, facial recognition systems. Smart crowd management and people counting, real-time alert for analytics and safety. Smart cities are meant to be safe cities too. Contact Norden Communication to discuss further. Welcome to Shivam Medisoft, where we are dedicated to simplifying hospital management with our advanced hospital management software, NeoSoft. We make hospital operations effortless. NeoSoft covers the entire chain of healthcare delivery, from small clinics to multi-specialty hospitals. We not only provide information, but manage the hospital, allowing you to focus on exceptional patient care. Introducing hospital control towers, real-time insights, timely actions, and multidimensional data exploration. Our hospital control towers revolutionize the way departments within a hospital manage their operations. A one-stop solution tailored to your hospital's unique needs, NeoSoft is built on the entire ecosystem of computers, tablets, mobile, and TV screens. Join our satisfied clients and let Shivam Medisoft simplify hospital management for you.
लोगो चेंज करवाना है इनको सर को ठीक है
हमारा विजन है कि कोई भी माँ और बेबी प्रेगनेंसी के टाइम, डिलीवरी के टाइम या पोस्ट डिलीवरी के टाइम ना तो उसकी डेथ हो, ना ही इसको कोई लाइफ लॉन्ग कॉम्प्लिकेशन हो।
वीडियो रोक दूं मैं? अभी QR कोड वाली
बात करो मैं
हाँ
फोल्डर वाइज नहीं बनाया क्या?
फोल्डर वाइज
मैं ये पेन ड्राइव में,
ये पेन ड्राइव इसमें।
हाँ इसमें ये सम्स का ये बोलोगे, सम्स आएगा हमके कॉपी कर लो और फर्स्ट सेशन
We live in an age of nearness and ease of access to every need, and in fracture around us. We have this concept of growing smart cities, where we have all the living amenities together. Today, the idea of community living has transformed into sensible cities. We do not have to step out from smart cities for any of our needs. Let it be the schools, hospitals, malls, entertainment hubs. Everything is available just a couple of steps away. A well-planned community living facility brings the world together to where you live instead of making you wander for them. While we are aiming for accessibility, we need to ensure these cities are safe for living. Yes, security systems are vital for smart cities. Why do we need to have a security plan in the first place? The answer is simple, because we as a community are going to live there. We need to ensure social safety, assuring complete city monitoring, help to maintain law and order in the community, controlling the traffic flow, improve city functioning, crowd management, and analysis. How Norden Communications can help with all the concerns we discussed. City surveillance with constant video monitoring, providing public safety with accurate surveillance, traffic monitoring and law enforcement ecosystem, proper law enforcement with ANPR, automatic number plate recognition, and FRS, facial recognition systems. Smart crowd management and people counting, real-time alert for analytics and safety. Smart cities are meant to be safe cities too. Contact Norden Communication to discuss further. Welcome to Shivam Medisoft, where we are dedicated to simplifying hospital management with our advanced hospital management software, NeoSoft. We make hospital operations effortless. NeoSoft covers the entire chain of healthcare delivery, from small clinics to multi-specialty hospitals. We not only provide information, but manage the hospital, allowing you to focus on exceptional patient care. Introducing hospital control towers, real-time insights, timely actions, and multidimensional data exploration. Our hospital control towers revolutionize the way departments within a hospital manage their operations. A one-stop solution tailored to your hospital's unique needs, NeoSoft is built on the entire ecosystem of computers, tablets, mobile, and TV screens. Join our satisfied clients and let Shivam Medisoft simplify hospital management for you.
हमारा विजन है कि कोई भी माँ और बेबी प्रेगनेंसी के टाइम, डिलीवरी के टाइम या पोस्ट डिलीवरी के टाइम ना तो उसकी डेथ हो, ना ही इसको कोई लाइफ लॉन्ग कॉम्प्लिकेशन हो।
Here with us today, we have the co-founder of Agatsa, a company working towards making healthcare services easily and readily accessible and available to all.
We always believed in the power of technology and innovation to solve complex problems. The challenge was really to miniaturize the big machines that are kept in hospital. So we've just miniaturized the whole setup and connected that to a smartphone.
Father was a heart patient, so we were regularly required to get his ECG done. So we thought, why not buy some device which could be as easy as touching your finger.
And that was a eureka moment for us.
That making high technology work for the rich, very easy. Making low technology work for the poor, very easy. Making high technology work for the poor is very difficult. And that's exactly what he has needed basically done.
Very revolutionary thing in terms of digitalization and transformation in healthcare. From community standpoint, यदि हमारे जितने भी elder patients होते हैं या bedridden patients होते हैं जिनको किसी कारणवश वो hospital नहीं आ सकते या जिनकी accessibility hospital पहुंचने में कम रहती है, चाहे उनके पास कोई भी साधन नहीं होता या उनके बच्चे बाहर होते हैं, and there's a lot of global medicine, लोग बहुत travel कर रहे हैं, उस टाइम पे आपको requirement होती है controlled remote monitoring की. आपको जरूरत होती है एक डॉक्टर की जो आपके किसी भी लैब या डायग्नोस्टिक को समझ के उस टाइम आपको बता पाए कि आपके शरीर में क्या प्रॉब्लम है. इट्स अ कॉस्ट इफेक्टिव डिवाइस और वो मेरी कार्डियक हेल्थ या ओवरऑल कार्डियोवास्कुलर हेल्थ के बारे में हेल्थ बता सकता है. इजी एक्सेसिबिलिटी, गुड अवेयरनेस एंड कॉस्ट इफेक्टिवनेस, ये तीनों जिसमें है वो है संकेत लाइफ.
आज आपके पास एक डिवाइस है जो 15 दिन पहले आपको बता देगा कि आपको हार्ट अटैक हो सकता है, नहीं हो सकता.
संकेत लाइफ,
संकेत
देगा लाइफ का.
डिजिटल डिजिटल संकेत देगा.
Patients can have it at home. So if they keep it at home and they use it, and they can send it to the GP immediately.
In the Indian settings, you can say it can reach to a more number of people. So those can be diagnosed early, can be saved.
SWASA, an ultra-scalable and affordable respiratory health platform developed as a point-of-care solution for triaging, monitoring and surveillance of various respiratory diseases. SWASA uses audiometric analysis to analyze the cough sounds using ML models to detect respiratory ailments like tuberculosis, COVID, COPD, pneumonia, etc. Typically, when a patient consults a doctor with respiratory ailments or symptoms, the doctor can advise SWASA test and other possible diagnoses. A small and quick enrollment can share the web link with the patient on their phone. The patient can start recording cough sounds in their SWASA application. The results are instantaneous. On one side, the patient can see their preliminary assessment of their lung health and associated risk. Simultaneously, the doctors can access a detailed report of the cough sounds on their web dashboard or mobile device. The report provides general lung health read comprising of spirometry results followed by identification of various respiratory diseases. In cases where the symptoms indicate a high risk, the doctor can choose to refer the patient for additional tests for further treatment. SWASA is developed and maintained by Salsit Technologies, and we are committed to making respiratory healthcare accessible and affordable to everyone.
We live in an age of nearness and ease of access to every need, and in fracture around us. We have this concept of growing smart cities, where we have all the living amenities together. Today, the idea of community living has transformed into sensible cities. We do not have to step out from smart cities for any of our needs. Let it be the schools, hospitals, malls, entertainment hubs. Everything is available just a couple of steps away. A well-planned community living facility brings the world together to where you live instead of making you wander for them. While we are aiming for accessibility, we need to ensure these cities are safe for living. Yes, security systems are vital for smart cities. Why do we need to have a security plan in the first place? The answer is simple, because we as a community are going to live there. We need to ensure social safety, assuring complete city monitoring, help to maintain law and order in the community, controlling the traffic flow, improve city functioning, crowd management and analysis. How Norden Communications can help with all the concerns we discussed. City surveillance with constant video monitoring, providing public safety with accurate surveillance, traffic monitoring and law enforcement ecosystem, proper law enforcement with ANPR, automatic number plate recognition, and FRS, facial recognition systems. Smart crowd management and people counting, real-time alert for analytics and safety. Smart cities are meant to be safe cities too. Contact Norden Communication to discuss further.
Welcome to Shivam Medisoft, where we are dedicated to simplifying hospital management with our advanced hospital management software, NeoSoft. We make hospital operations effortless. NeoSoft covers the entire chain of healthcare delivery, from small clinics to multi-specialty hospitals. We not only provide information, but manage the hospital, allowing you to focus on exceptional patient care. Introducing hospital control towers, real-time insights, timely actions, and multidimensional data exploration. Our hospital control towers revolutionize the way departments within a hospital manage their operations. A one-stop solution tailored to your hospital's unique needs, NeoSoft is built on the entire ecosystem of computers, tablets, mobile, and TV screens. Join our satisfied clients and let Shivam Medisoft simplify hospital management for you.
हमारा विजन है कि कोई भी माँ और बेबी प्रेगनेंसी के टाइम, डिलीवरी के टाइम या पोस्ट डिलीवरी के टाइम ना तो उसकी डेथ हो, ना ही इसको कोई लाइफ लॉन्ग कॉम्प्लिकेशन हो।
Here with us today, we have the co-founder of Agatsa, a company working towards making healthcare services easily and readily accessible and available to all.
We always believed in the power of technology and innovation to solve complex problems. The challenge was really to miniaturize the big machines that are kept in hospital. So we've just miniaturized the whole setup and connected that to a smartphone.
Father was a heart patient, so we are regularly required to get his ECG done. So we thought, why not buy some device which could be as easy as touching your fingers and the ECG would reach to us. We couldn't find such device, so we thought, we both being engineers, why can't we make a device? So that's how we started.
We set up a lab in our home and started designing the prototype, which was set up in a matchbox. The ECG could be displayed on a smartphone, and that was a eureka moment for us.
That making high technology work for the rich, very easy. Making low technology work for the poor, very easy. Making high technology work for the poor is very difficult. And that's exactly what he has needed basically done.
Very revolutionary thing in terms of digitalization and transformation in healthcare. From community standpoint, यदि हमारे जितने भी elder patients होते हैं या bedridden patients होते हैं जिनको किसी कारणवश वो हॉस्पिटल नहीं आ सकते या जिनकी एक्सेसिबिलिटी हॉस्पिटल पहुंचने में कम रहती है, चाहे उनके पास कोई भी साधन नहीं होता या उनके बच्चे बाहर होते हैं, एंड देयर इज अ लॉट ऑफ ग्लोबल मेडिसिन, लोग बहुत ट्रैवल कर रहे हैं, उस टाइम पे आपको रिक्वायरमेंट होती है कंट्रोल रिमोट मॉनिटरिंग की। आपको जरूरत होती है एक डॉक्टर की जो आपके किसी भी लैब या डायग्नोस्टिक को समझ के उस टाइम आपको बता पाए कि आपके शरीर में क्या प्रॉब्लम है। इट्स अ कॉस्ट इफेक्टिव डिवाइस और वो मेरी कार्डियक हेल्थ या ओवरऑल कार्डियोवैस्कुलर हेल्थ के बारे में हेल्प बता सकता है। इजी एक्सेसिबिलिटी, गुड अवेयरनेस एंड कॉस्ट इफेक्टिवनेस, ये तीनों जिसमें है वो है संकेत लाइफ।
आज आपके पास एक डिवाइस है जो 15 दिन पहले आपको बता देगा कि आपको हार्ट अटैक हो सकता है, नहीं हो सकता।
संकेत लाइफ, संकेत देगा लाइफ का,
डिजिटल संकेत देगा।
Patients can have it at home. So if they keep it at home and they use it, and they can send you the GDP immediately. In the Indian settings, you can say it can reach to a more number of people. So those can be diagnosed early, can be saved.
मेरा फाइल है। Dear ladies and gentlemen, please take your seats. As it's already 2:30, we need to start the session. May I request all of you to please take your seats. I request all of you to please join us back. We need to start this session. Once again, may I request all of you to please join us. We also have a tea break, so during tea break we'll discuss. Those who are on my left side, please join us. I know you all are very interested to see the demos. Ladies and gentlemen, please join back. My request, BE team, please get everybody inside. Those who are standing behind, please join us, please join us. Ranjit, can you ask everyone to join us, please? Ladies and gentlemen, we have the next session, Smart Hospitals, Transforming Healthcare Infrastructure for the Digital Age. It's a very beautiful session now. This session is chaired by Dr. Sushil Kumar Meher, Head IT, All India Institute of Medical Science, Delhi. May I request Dr. Meher to please come on the stage. Ladies and gentlemen, give him a big hand. And we have very distinguished panelists in this session. Dr. Amitabh Yaduvanshi, the coordinator and head of cardiology, Holy Family Hospital. Dr. Saab, please join us. Mr. Prashant Obrai, Director India SAC, Northern Communications. May I request Prashant to join. Prashant from Northern. Dr. Amit Swarup, Head Business Development, STEMS Healthcare. May I request Dr. Amit, please join us. Mr. Sharat Anand Jupali, Managing Director, Shivam Microsoft. Shivam Medisoft. Sharat from Shivam. Yeah, Sharat, please join us. Then Ronak Pradhan, Product Lead, National Health Authority of India. Ranjit, can we get Dr. Ronak? Dr. Ronak from National Health. Dr. Ronak from National Health, please. Prashant, please join. Dr. Ronak, yeah, please. So once again, ladies and gentlemen, this is the session, Smart Hospitals, Transforming Healthcare Infrastructure for the Digital Age. Sir, Dr. Sushil, over to you. Thank you.
Yeah. Thank you to the organizer. You have already been defined a wonderful sessions. And it is really this session will be give more light to how the technology leverage to the healthcare to give a quality of healthcare. Now technology is not an issue. Issue is there how to apply the technology in healthcare. That is the most challenging. Anything you will ask, you will get the technology, but you have to get a player to integrate the technology. It is a big challenge. I understand after the lunch it will be a difficult session for us because each and every people they feel definitely a little bit dodgy and they have lose their concentration, I think so. Anyway, I request everyone will try our level best to give a good quality of session to you. Definitely the takeaway will be rememberable for you. See, I am working the AIMS last 32 years. I have seen the whole digital transformation of the institute as well as in the country or government, how they have leveraged to define the technology. And today's days, we are talking about IoTs and IoMT devices. How the hospital will be smarter? How? What is smart? What do you mean by smart? Smart means without knowing everything is available to you. Whatever you want, it is available to you. Is it possible? Yes, it is possible. The smartness of the hospital starts from at the time of constructions. The major problems in the country is that do not take care of that things. When you are planning your hospitals from your drawing table, there you should start that what type of smartness is required of this hospital. If we talk about my aims, the old buildings does not support to make whole the hospital Wi-Fi. How to make that area with 5G enabled? This is the only campus in the country. It is fully 5G enabled institute. Both Airtel and the Jio has already been installed their devices there. Fully 5G enabled Wi-Fi. But my infrastructure, the building is not permitting me to do all these things. Anyway, smart in one example I am giving to you. We are talking about hospital means patient care. It means how to make hospital smart so that patient will get a quality of care without any hassle. Just one example I am giving you about AIMS. We get around 14,000 patient, OPD patient in a day. And every patient, they come with their own attendants, 1 or 2 people. So 50,000 nearly will get in the OPD in the morning. I have to manage these 50,000 peoples. These 50,000 people, how they will come to the hospital? First, you have to talk in that level. They will come by Ola, Uber, autos, own car, or metros, and by walking. How to manage this crowd? When you land up in your Ola and there is a lot of traffic inside the AIMS, is the buildings, roads are compliant? You have to look into that angle. When 50,000 patients are coming, my road should be like that. When they will come down from the car, that much of space supposed to be there. None of the hospitals, I have seen major hospitals in the country, none of the hospital is compliant on that. कहीं ट्रैफिक कहीं आपको पार्किंग नहीं मिलेगा, पार्किंग मिलेगा व्हील चेयर नहीं मिलेगा, आपको स्ट्रेचर चाहिए व्हील चेयर स्ट्रेचर नहीं मिलेगा. If you do the digitization, what is the use of that? When patient is landing, he does not have that kind of support. I have a trauma care. It is fully supported by, from the design level it is supported to how to care the technology. When the ambulance will come up, it will go to the RAM and remotely it will connect it to the hospitals, AIMS Trauma Center, that this patient has this kind of problems, get ready for it, and stretcher is ready when it will reach. Time is very precious. You will search wheelchair or stretchers, then it is gone. Second part is I am talking about in the OPD. Let's say I am a patient. I have to go to the AIMS to show something. What I have to show? You have to show to a doctor. You have to meet a doctor. First of all, you have to take an appointment. It is online. It is totally online. 30% the OPD quota is online. 30% on site. 30% revisit. 10% emergency and other cases. Total 100%. These 30% they have to take the appointments. Right now we want to start, 2 things are there. You can book your parking, you can book your stretcher or your wheelchair. You can book a slot. When you take the appointments, there will be a voice bot as well as online charting. It is AI based because 32% they landed in a wrong department in the appointment. It has been reduced to 10% because after using this bot. This is called smartness. So one patient will come, if he is coming for Ola, particular 10 o'clock, he has the appointments, his parking is allotted, he has got the wheelchair, he has got the, which doctor has to be seen. And one thing I'm talking about it, nobody has, I think so, done in the country. In the OPD, it is not required to go to any counter. You can do yourself registration or from your mobile. In the OPD hall, we have the QR code. It is pasted. Scan the QR code. Then it will ask, do you have the appointments? Then you have to write the appointment number. Then all the details will come out. Do you have Aadhaar ID? No. Yes or no? If it is no, then he'll ask, what is your Aadhaar number? Then it will generate the Aadhaar ID automatically from your mobile. It will generate your registration number from your mobile and it will allocate the room number and doctors. Not that it is. If the queue number is, let's take 8, to see the 7% by the doctor, it takes 1 hour. Then it will tell you, it will inform you that how IoT is embedded in medicine, that is IOMT. And in the one video I'll show you how we have made the smart lab. The pre-analytic, analytic and post-analytic all are automated and used by robotic hands. All the samples will be handled by the robotic hands. That video I'll show you. This is the one of the high-tech medical labs which we have already in AIIMS New Delhi. Thank you. I have many panels. Everybody, I think so, you have the presentation?
We have a presentation.
Okay, okay. So what we will do it, let me give my presentations. It is just very introductory. After that you give your presentation. Each presentations we have some questions. So that will be connect to the people and give more practical use. Because medicine is a practical. Without practical is not possible. So make it very simple, practical, but technology is supposed to be there. So this is my request to all the speakers. Okay, thank you. Hello. IOMT is a very simple critical device. 10 years ago, when I have talked about the IoT device, at that time it is a research format. At that time, I did not find any vendors to give a solution on IoT device. There's some research was going on in the IITs and other medical colleges, but not in the there. Then we have started to do something, how to use the IoT device in healthcare. First we have tested. And we can't believe it, there is a one open source device which was available. It is called Raspberry Pi. Anybody heard about Raspberry Pi? Yeah, Raspberry Pi. We have purchased from Amazon in 1200 rupees and we have tested in our TV. At that time, there are two types of TVs were it was coming in the market. One is a smart TV, another one is normal TV. So we have used Raspberry Pi to make the smart TV. And at that time, the normal TV and the smart TV, the price was around 20 to 25,000 rupees difference. And we have made successfully we have integrated and we have made the TV smart. Then we have started, why not it will integrate to our medical device. So when the patient is coming, he has to take in the weight, then enter in the computers, height, again and take the heights and enter to the computers, take the BP, again enter to the systems. There may be some typing errors or there may be some glitches to take the system to that place. So what we have done it, we have used this IoT device, the Raspberry Pi, to integrate this one, and it is connected with our network, intranet, and transfer the data, the weight, height, weight, and all the BPs to the systems. This is more accurate and online. When you reach the doctors, all the things are available to his desktop. So this is the first we have got the success in-house. It is, and today days, you can't believe it, in IoT device, if you'll see, only what I know, only one vendor is doing it, to integrate all the labs, lab equipments. Just I'm giving the, refreshing you, that this is a technology which is, we have seen in the past, and now we are in 20th century, 21st century, and the IT and communication plays a major roles. That's why we all people are here. Without internet, the life is totally a normal, you will not think as a normal life. Internet playing a major role for us. And through internet, we have to do each and every activities. So that's why this IoT device plays a major roles in the healthcare today's days. These are the technologies coming up in the healthcare. The IoTs, blockchain, AI, AR and VR, and another one is the high-tech cyber security. See, in medical science, how it is emerging and how it is coming up, you see it. In 21st century, it is the information communication technology in the healthcare management. So many people, they have their own apps. Even you see, right now mobile technology is totally absolute. What they are putting in their technology? They are giving the good processor, high amount of storage, and the new things is coming up, that is healthcare product inside the mobile. So you might have seen it. Most of the mobiles you will find, it will give your temperature, it will give your beats, means heartbeats rates, it will give your how much step you have gone, how much calorie you have lost. This sort of things you will get it. In future, definitely we are coming with the, what is the ECG will be in the mobile. So in this era, e-health is playing a major role for us. Electronic health is playing a major role for us. It includes the networking within the medical informations, health records, telemedicine services, wearables products, already it is there, and portable monitoring system which is remotely controlled. These are the things already been placed. This is the synergy of e-health. We are talking about the population's health care, that is public health informatics, another is the medical informatics, another one is your medical imaging, another one is your bioinformatics. This session is 1.5 hours. I am taking a little time, yeah. So everybody will get the time also. But you will make the things very interesting. I do not have much slide, just I am giving a inside of the systems. Now we come to, this is the one slide which is important for you. That the core area is mobile patient monitoring. And it has been accepted during 2020, after 2020, because of the COVID. Earlier, I was trying to implement telehealth or remote health care since 1999. Neither doctors nor patient is ready to accept it. After the COVID, it has gone in such a high, you can't believe it. So why you need? The lifestyle is one of the big issues in the healthcare. That's why people want that. Why not the health systems, health products supposed to be available in the mobile? So whenever it is required, I can go through it. So these are the e-health system available in the different users, different perspective. These are the technology which has to be integrated with the IoMT device. All the modalities supposed to be available and it is supposed to be integrated and it is communicable, because any information, people do not want to be within the four wall of the rooms. It's supposed to be exposed to everywhere, those who are rights to access the information. And today's people are looking towards one thing, that is personalized healthcare services. My health is different than anybody's health. That's why we have molecular engineering, we have sequencing, and in other fields we have a big data analytics. So for this, next generation healthcare is 4P. It is how to predict what disease we can predict ourselves, what kind of things we can prevent it. Another one is how it can be personalized. And third one is that all the people supposed to be participated. The 4P concept right now internationally people are looking towards it. For this you need data. And one simple statement I'm talking about, more data, more healthcare. Less data, less healthcare. So data when will be generated? It will generate from you only, your device only. So in the personalized healthcare, how we can detect early so that you can prevent that disease to go up. So you have to use the technology.
1 minute, sir. Every speaker has
Okay. So this is the things. These are the 4P's concept, how it is integrated. So this is the meaning of IoMT. IoMT means the Internet of medical things, which is mean the medical device will be integrated with the internet protocols to your database. So in IoMT, the health monitoring systems, people are looking towards it. Data analysis and integration of healthcare systems. The three components it is required when you go for any IoMT device. These are the examples, definition already I have spoken to you, because already they have told me that you have a limited of another 3 to 4 minutes. Here is some common type of IoMT device. Fitness wearables, already people are using it. It is integrated with their mobile. Clinical grade wearables also it is there. Right now, remote ICUs are there. It is already been integrated at the homes, and remotely doctors, they are monitoring it. Remote patient monitoring systems, it is another part of that. Smart pills, patient care device and kiosks, medical monitoring systems, and hospital devices. All are, it is been integrated with the IoMT devices. One laboratory equipment is there. How it will be integrated with your database. and you test the labs, your sample, say blood sample is tested, this is generating the reports, it will transfer to the database. How it will be? It needs some device. And that devices, it may be a one-way communications or it may be a two-way communications. So these devices can be integrated with the IoT devices. And already I have told you, I know only one vendor in the country who is providing this. It is not a rocket science. People can start up with these devices because majority of the devices is required some connectivity. Right now what people are doing it, this is another communications. We are communicating now with two things. The equipments, medical equipments, it is integrated with another language, it is called HL7 messaging. Right now people are using also starter fire also, but HL7 messages through, it can be integrated through your IoT devices. If we put a servers in between, it takes lot of space and limited number of devices can be connected. But IoT devices just, it is the size of your mobile. Your mobile size is almost same size of IoT device. So this is the diagrams. It is connected with the machines and transfer the data when the test will be performed by the medical equipments. These are the workflow which is being used in the laboratories, and we have already more than 150 machines. Okay, just 150 machines which has been connected each other. Anyway, I have got some. I'm showing one video to you. Then I'll end my. You'll see how the technology is leveraging in the lab reporting. Your mouse is not working. Play. This is the smart lab. There is two labs we have. We have the robotic labs and another is smart.
Laboratory testing is a crucial step in the diagnosis of medical conditions. It helps in planning and evaluation of treatments and monitoring disease stages. For these purposes, an accurate and authentic laboratory report is essential. Various laboratories and AIIMS worked tirelessly in this regard, but they were scattered and doing a limited number of tests. Patients had to run to different labs and undergo the same procedure everywhere. That led to delays in the test results and ultimately a delay in diagnosis and treatment of the patient. Smart Lab, a unit of the Department of Laboratory Medicine, is a major breakthrough in this direction. This lab was inaugurated on the 19th of May 2020 with a capacity of 8,000 tests per hour and 1.5 to 1.6 lakh analytes per day. This fully automated advanced lab is an umbrella facility for hematology, coagulation, biochemistry, and immunology tests. At present, Smart Lab is functioning round the clock, receiving on average 4,000 to 4,500 samples per day, approximately 60,000 analytes in a day, and reports are dispatched digitally on the same day. Patient samples are received from different outpatient departments, and barcoded samples are received from wards. Sorted and barcoded vials are then scanned for further processing. After scanning, the samples for biochemistry and immunology assays are loaded in the automated centrifugation unit. Centrifugation is done at various speeds for appropriate tubes. Then, centrifuge samples are transported to decapping module, which will decap the tubes and then passed on to the sorting unit Cobas P612. robotic sorter will transport samples by a track system which is interconnected to all analyzers in the lab. All the sample results are finally verified by resident doctors in the Infinity software. After successful verification, the sample results are transmitted to Hospital Information System provided by NIC. For hematology, we have the fully automated analyzer.
Thank you. This is fully automated, and the reporting will be done in the AI-based analytic. So only 10% of the sample reports it will be verified by the doctors. Other one is totally by the analytic AI programs. They're reporting it. Thank you. Anyway, just my introduction, it was IOMT. My other panel members, Mr. Amitabh, yeah, can I have your presentations and we can discuss after that, yeah.
Good afternoon, everybody, and thank you, Bharat Exhibitions, for allowing me to talk in this conference, and thank you, Dr. Meher, for an excellent talk, which made my job a little bit easier. So the topic given to me is Internet of Medical Things, Empowering Healthcare with IoT and 5G. So let me first introduce myself. I am a medical doctor, and I am not at all in league with the IT professionals that are there in this forum. So my only claim to fame is that I might consider myself as a technology enthusiast, and I was probably the first one to have a digital camera way back in 1990s during my school and college times. I had a pen drive. I was the first one to use the pen drive in my college. It was a 64 MB pen drive. Then I still keep on collecting a lot of gadgets. Most of them are now stacked in my storeroom. I don't have time to use it, but then that's how it is. As far as the technology part is concerned, I did self-taught myself, and I did develop a app which we are using at Holy Family Hospital to track the referrals that are given to us through the various departments, through the cardiology department. So we are able to track these referrals, we are able to store them, and we are able to kind of analyze the turnaround time. So that much is my technology thing. So forgive me if my talk looks like a little pedestrian and simple to you, but that's my limitation of my technology knowledge. So we all know that 5G, the spectrum of the Gs have increased from 1G, which was good for analog voices, then 2G, which was good for digital voices, 3G was good for mobile broadband, 4G was faster and better than 3G, and now 5G is a land of hyper connectivity, where interconnected devices, sensors and system can talk to each other with very fast speeds. And global adoption of 5G has been improving, and it is fortunately also very well adopted in our country. So as far as 5G is concerned, the important aspect is the capacity. It is very high capacity, 100 Mbps whenever needed, and more than 10 Gbps peak data rates can be achieved. So more than 1,000 times more traffic can go through 5G. It has a latency of less than 1 milliseconds. It is ultra reliable, and many more devices can be connected. So that's the advantage of 5G over the other technologies. So as far as 5G is concerned, these things like augmented reality, tactile internet, virtual reality, or autonomous driving, all these things can be possible only through 5G technology, because you can have person to person, person to machine, and machine to machine interaction with this. So as far as health is concerned, if you talk about telemedicine, the high bandwidth that is provided with 5G allows us to do teleradiology, telepathology, teledermatology. So in fact, in teleradiology, we have cardiac MRIs that are done in our hospital, but we are able to get it reported from a person who is situated in Netherlands, because he's an expert in cardiac MRI. So we always get an expert opinion from a person who is so far away. Telepathology, dermatology can also be done. The fact that 5G provides with a very low latency that allows us for things like remote monitoring, real-time interactive processing and remote surgery. You must have heard that people are doing remote surgeries. In fact, in India also, people in Gujarat, people have done remote angioplasties where an operator sitting 800 kilometers away from the patient was able to do a robotic angioplasty. Although it sounds fantastic, but then it is a time when it will no longer be fantastic. The adoption of 5G is also increasing, so remote monitoring is primarily the biggest chunk of utilization. Virtual consultations, which has also increased, especially after COVID, and connected ambulances and other things are also possible through 5G technology. Talking about Internet of Things, as Sir said earlier, it is basically what it enables is any device can talk to any device. So human interaction may not be required. So a device can talk to another device, which can then talk to a third device and give you the output. So intervention, manual intervention is decreased. So when you talk about the applications that are possible in healthcare with IOMT and 5G, they can be, as Sir mentioned, sports and fitness, remote patient monitoring, home healthcare. We can have smart watches, activity trackers, patches, and smart clothings. Then you can also have monitoring purposes like heart rate, pulse, blood pressure, glucose levels. Now CGMs are very commonly used in our country. We can have fetal heart rate monitoring, neuro monitoring, fetal heart rate. One of the system is in fact available to display here only. We also use remote monitoring for monitoring our patients who have cardiac implantable devices. Now Bluetooth enabled devices are available where the device can communicate through the patient's phone to the central server, and in case there is a immediate or concerning problem with the device or the patient, that can be immediately flagged on to us. So this is how most of the time remote monitoring is almost 32% of the apps that are available to us. Then there are diagnostic apps and then other things. So the estimated global impact of remote monitoring in 2030 is like after 5G, 4.2 million extra beds can be available, which is a 5.7% increase. 250 million extra patients can be treated through telemedicine. 35 million emergency can be better responded through connected ambulances, and this translates to 196 million extra patient treated. This is if 5G is adopted in healthcare. So the few examples how 5G or a connected IOMT can help. So one is asset inventory management. So again, as I told you, the interaction is very limited. So a technician or a nurse can just scan the whole room, and the inventory of all the devices or the things that are there can be automatically through the interaction between the various devices. You can find out what is the calibration, what is the expiry date, all these things can automatically. So it decreases a lot of time for healthcare workers, which can then be utilized for patient care. Similarly, asset utilization can also be there. So suppose you have, this is example of a defibrillator. The person is taking out the defibrillator, but the IOMT detects that this is the last defibrillator that is available in the cardiology unit. So it prevents that person from taking that defibrillator out, because cardiology unit is the unit where you might require the defibrillator more frequently. So useful asset utilization can be achieved through IOMT. Then asset safety, you can tag your assets through RFIDs, and then if suppose there is pilferage, that can be detected through the IOMT and person can be taken care of. Then more importantly is patient throughput management. So you can have smart tags that are attached to the patient, and once the patient goes from one place to another, so suppose this patient is going for surgery, then the technician, the people who are transferring the patient knows where the patient needs to be sent. The visitor is able to see what is the real-time tracking of their patient. So they are also comfortably seated in the waiting area, knowing that, okay, the patient is now in the pre-op, now the patient is sent to the right OT. So suppose you go to the wrong OT, it will give you an alarm. Once the patient is in OT, the attendant knows that the surgery has started, and once the surgery is over, they know that the patient is there back into the recovery room. So all this is totally automated. No manual interaction is required. It is all through the intertalk between the devices that are there, which can show you these things. Patient safety, another important. The same tag can be used to alert a nursing station. The nursing station will get the call. She will respond. She will see what is the requirement. Suppose an ECG machine is required. There are only limited ECG machines in the hospital. You can identify where the ECG machine is placed. The person can then straight away take the ECG machine, get the ECG done, and effortlessly and within a reasonable amount of time can take care of the patient. Infant safety, another aspect where you can have a tag, and similarly, if it's like geofencing that you use, so the tag is then fenced to the room. So if the tag is removed, if the tag moves out of the room, it is alerted and the security can be alerted. Staff safety, another aspect. If there is a violent patient, the doctor can or the staff can activate the emergency alarms and the person can be taken care of. Another important thing is location aware work demand management. So if you have a requirement of suppose a GDA on a particular floor, the location of the GDA is available to the central monitor. The person can be asked, the nearest person that is there can be asked to take care of the required thing, and all these are automated processes and feedbacks are there which can tell you whether the thing has been done or not. Similarly, environmental monitoring, there are certain critical areas where a certain amount of humidity or certain amount of temperature is required. That all can also be monitored through this IOMT device. So with an IOMT device, you can have a healthcare which is operationally aware. So all these things are available commercially, maybe not in India, but they can always be provided. As sir mentioned, these are not things that are, the technology is available, it's just we need to use it efficiently. So use cases of IOMT, advanced predictive maintenance. So before a device or before a biomedical device gets shut down, you can have preventive maintenance. Remote patient monitoring, already mentioned. Augmented reality, you can do surgeries, you can do dermatology through augmented reality. High definition virtual consultation is possible. Connected ambulances, as sir mentioned, as soon as the ambulance lands into the trauma center, the whole system is activated. Then inventory management, as I already mentioned. So with the advent of 5G, all these things have become more efficient, more reliable, and with less latency. So to end, a healthy society makes for a healthy world, and thus a better future comes with 5G enabled smart healthcare. 5G brings latency low enough to provide real-time information, either to deliver live HD videos to a paramedic or to even enable remote surgery. High bandwidth enables doctor to keep in contact with patients or the elderly, or to transmit and analyze large data files. So a large MRI data or large angioplasty data can be transmitted very easily. Reliable and security enhanced communication within the hospital, and thus 5G technology is said to have a transformative impact on the healthcare. Thank you.
Thank you, Dr. Amitabh. There are two things he has spoken to you. One thing is the tagging. It is really essential technology today's days. People have started now geotagging also, but it is very expensive. But in the medical equipment, tagging is much more required, because when you need a ECG machine immediately, where it is not available, and patient is waiting for it, and doctor is waiting for it to how to get the treatments, because without ECG they can't give any intervention on this. This is the technology, we have to leverage it. Can you share something if you have any such kind of wonderful experience in your hospitals?
Practical experience in the hospitals is not yet available, but these technologies are available. The only thing, we use remote monitoring very frequently, and we have devices now, implantable devices. We have an ILR which can monitor. So suppose sometimes some patients have very infrequent arrhythmias. Patient just fall down, but these falls are maybe once in a month or 3 times in a month. Then Holter recording is not really possible, because when the patient is having a 24 hours or 7-day Holter, at that point of time the patient may not have the symptoms. So now we have technology where we implant a device, ILR, and that can record up to 2 years. And through the Bluetooth mobile, in case there is a arrhythmia, that can be done. So all these things are there. As far as you said, now Holy Family is coming up with a new building, and hopefully, as you said, as soon as it starts from the time the hospital is constructed, because it has to be constructed in a way where all these technologies can be enabled. So hopefully that is something that we are taking in mind, and it's a futuristic thought process.
Yeah, that's why when we talk about smart hospitals, there is one software, it is called BMS, building management software. It can take care of your fire, you can take care of your air conditioning, you take care of your pollution levels, it can take care of your moisture levels, what it is there. So these sort of things, it is a part of the smart hospitals, and it has to be built up at the time of constructions or the time of designings. Okay, thank you. Next, Mr. Prashant, you can have a presentation.
Good afternoon, everyone. First of all, I would say we have been talking about this particular thing. I am no health expert, but when people have been talking about smart hospitals and smart infrastructure, and as Sushil sir said, we have to start from the time of the construction. And a lot of examples were given by Dr. Amitabh. So I would come from the IT background and present that. See, everything, whatever these people have talked is from a medical background, and they have been talking about IOMTs, which are basically the interconnected devices. Finally, those interconnected devices are getting connected to somewhere at the base in the hospital. Even though they are interconnected to each other, but finally the data has to reach the doctor and interconnected, which means we are consuming that kind of bandwidth. We are talking that kind of infrastructure which can handle these number of devices, which can process, the infrastructure should be able to process that kind of data which is being available. So we have to start right from the building stage. And that's what I'm talking from the product background on the IT side, nothing to do with health in terms of the medical terms of health. But yes, within that IT in terms of what it could create a smart hospital, and it could help in terms of infrastructure. I am from Northern Communication, which is a UK headquartered company, and we are into the ELV space, operating globally into 40 countries today, directly or through our distributors. We started nearly 2 decades back, and we have global footprint present into the ELV space. However, in India, there are certain limited things which we are doing, primarily on the infrastructure side. When I say IT infrastructure side, the surveillance and public addressal system. See, one is, and I would like to relate all these things to whatever two esteemed panelists have spoken before me, because when he talked about even the number of patients visiting the hospital, whether we have roads available or not, whether we are talking about, let's say even when he says Jio and Airtel have already enabled the hospital with 5G, but the building, because of the limitation of the building, he cannot reach it to every place. Let's say the building also, the new building can have that 5G infrastructure, but finally there would be base stations, and those base stations should have those kind of infrastructure. Or like one example which Dr. Amitabh gave of a violent patient. Just I am giving that particular example, or it could be the other side of the example where a non-medical staff or a security staff, there is an issue and he misbehaves. Now, we don't know which side is right at that point of time. What do we do about it? Though these kind of infrastructure elements which could help to avoid this, because a lot of things, whatever I wanted to say, have been put in perspective by both of them in a different way in terms of medical side, but like right from the infrastructure when we are building, right from covering the perimeter to even integrating solutions which are like entry and exit in terms of the car entering with the number. This could be not only for the security reason, this could be automated for the parking reason. We could automate with the number plate itself. We don't have to have manual parking. We can integrate it with now smart tag, fast tags available. You can integrate the technology, eliminating the involvement of the people. Then we can have the perimeter security, and then when we are talking about telemedicine and trauma centers and connected ambulances, there could be in-vehicle based surveillance which could be directly connected to the hospital, and where it may not be a very senior staff available in the ambulance, but that nursing staff or whatever can get instructions from the doctor available at the base, and they could tell them what could be the preventive things they can do while the person is on the way to the trauma center. So those kind of vehicle-based surveillance solution which can be connected two ways to help reduce the fatalities, as I said again, not from the health perspective, but all these things finally can help in being a smart hospital. Similarly, as I was saying, when we were talking about the violent patient, or it could be the other side, there could be body-worn cameras which could be used, which could be later used, because then we know who was at fault, and we can take corrective actions, post the action also. So those kind of things. Similarly, comprehensive coverage of the each area. This is one thing which I would like to highlight, which I have been highlighting in different events, whether it is earlier at Smart City, Safe City event also I highlighted, and today also I'm highlighting this, because this is one of the most neglected part in the IT, is the cabling solution, which we see. You put any IoT device outside, you put any router outside, you put any other communication or telecommunication device outside. You can replace it if it is not performing as per your expectation. Whereas this particular physical infrastructure, when we create, physical infrastructure generally we create for at least we expect it to work for a decade, 2 decades, 3 decades. We are not talking in 1 year, 2 years, 3 years. We are talking in terms of decades. We have to be very, very careful in terms of creating, and that's where I said what Sushil sir said. We have to start right from the construction stage, because we have to be mindful of the fact what could be, what is our way forward, where we would be reaching in next 5 years, 10 years, because this infrastructure cannot be created every 3 years, 5 years, whereas all the physical infrastructure which is outside can be replaced over a period of time, whatever we want, whatever we decide. It could be as low as 1 year, or a typical life cycle of any IT product, what we call as 5 years. But this particular thing is there for at least couple of decades. So what we can do, and as we are talking about this, is I'm just scrolling through because I don't want to dwell into the product as such, because that's not the whole theme of the event is. But when we are talking about smart, So what is there, because till now, even the cabling infrastructure, as whosoever would be in IT, especially Sushil sir can relate to it, we call it a passive infrastructure, right? Why should we call it a passive infrastructure when we are talking about smart hospitals? Why not have intelligent cabling being implemented now? Because when we talk about the hospital budgets versus this infrastructure, this would be probably overall only the 0.1 or even less percentage of that, even if you implement the whole intelligent solution. What it does is, when we are talking about so many interconnected devices, and today we are surrounded by IoTs, whether it is like phone or smartwatches or anything, whatever people, everybody is at least having 2 or 3 IoT devices currently in this room, on an average must be using in some way or the other. So when we are surrounded by all these intelligent devices all across, why the physical infrastructure be a dumb infrastructure and we call it a passive infrastructure? What it can bring you to the table is, when we make it a smart infrastructure, is you can pinpoint on that particular passive infrastructure, the so-called passive infrastructure also, as to which port has a fault. You don't need to physically find the reason whether the backbone has been cut somewhere or a port has been disconnected, how much time there is a downtime, whether it has been disconnected or cut. All those kind of reference points you can build and thereby save a lot of time, and especially in health, where we are talking about somebody's life, and when we are talking about so many interconnected devices, then for sure it can bring a lot of value on the table, because if we are able to save even one human life because of this particular thing, it is invaluable. And what we are talking about in the whole hospital, probably maybe 0.1%, I am still overestimating it. It may be even lesser than that. That is the only difference between the whole cost we are talking about, making the whole thing smart. But obviously, I cannot say you retrofit this because it is practically impossible for the infrastructure already developed, but for sure, at least for the expansions and the new infrastructure, we can look forward to these kind of things. Again, I'm not dwelling into, these are certain software features which you can get, what kind of reports which you can generate based on this for your, again, I would use so-called passive infrastructure. PA solution in healthcare, again, practical examples. I am not coming into the product, whether it is the announcement things for your medical and non-medical staffs, and your, similarly for your voice evacuation system in terms when integrated with fire alarm systems. So these are certain things. Similarly, the devices for telemedicine and all those things, these are the things. But what I wanted maximum to dwell on, which is the most neglected part, is the physical infrastructure, where we are not spending so much, which unfortunately cannot be even replaced. So we have to keep in mind where are we going and what are we heading towards, and we have to build our infrastructure which should be ready for that particular thing. I'm just scrolling through, I'm not coming to that. Though these are certain things, and we have practically most of the international certifications which are required for those products. However, in health, if there would be something more required, we are happy to do it. And with this, I would finish off. Thank you very much.
Thank you, Mr. Prashant. This is one thing what he's rightly spoken. If you find many times on the road, there is a lot of diggings are going on and cabling is going on. Today they have done it, you will find another 6 months or again you will find another cable is going on. So these are not properly planned. So it is rightly spoken that you have to plan early, put your specific components on place in time, so that should not be a problem. This digging, all these things will not come up. And second part is that networking is one of the biggest challenges in the healthcare, because you need a high bandwidth because you are using the high density of medical imaging within the campus. And this you know it, today's 256 slices MRI and CT is coming up. It is taken some gigabyte data. So it is a challenging way, and that's why you have to plan properly. Thank you again, once again. Next is Mr. Amit. Can I have your presentation? Yeah.
Hi. Good afternoon, everybody. So I have been listening to everybody as my esteemed Dr. Meher. Thank you very much for this opportunity. There have been a lot of information, a lot of knowledge which I have been hearing and trying to capture, and it's really overwhelming. And we are like, thank you for all the esteemed panelists for giving the knowledge. And we talk about smart hospitals. We're talking about smart hospitals, how and what smart hospitals can do, and especially through the IOMTs basically in our fields. So I'll just go through. I'm Dr. Amit. Basically, I'm from STEMS Healthcare. So at STEMS, we provide integrated services through preventive healthcare, healthcare technology, and curative healthcare through our very specialized smart clinics, which are outside India. We operate from 7 different countries, and we give very specialized cares. We operate from in 3 continents: Asia, Africa, and Europe, with about 8+ countries, 14 centers, 2,000 patient footfall every day, and 400 global staff across the world. We are also very happy to share that we are CAP accredited and NABL and all the other accreditations which we have. So that's a small part of about what we are and what we are talking. And I'm representing STEMS. I take care of business development. So we have been talking about hospitals, smart hospitals, future hospitals. Let's dwell 10 years back where we were and see where we are. And then I'll also like to tickle a bit where we would be in 10 years. So if we all remember, like 10 years back, everybody from healthcare industry, like lot of stalwarts here. 10 years back, it was a lot of more traditional healthcare, where a patient comes to the hospital, a doctor talks to him, prescribes, and that prescription is in a file, which takes you back. And we were very happy doing that, and I was also a part of that, so I was very happy. So there was limited automation at that time. Since the time changed, today when we see the hospitals, healthcare, not only the hospitals, any of the different verticals of the sections of healthcare, things have evolved, things have changed. If you see now, the automation is everywhere. Like we want to automate, and we are automating everything day in, day out. Like we are having things which are doing it. We have AI which is coming into the place, like which is taking a lot of attraction to these days, talking to a lot of people. We have communication systems, collaborations through various applications. We have platforms like softwares. Meher sir was talking about the laboratory part. I'll touch a little bit on that also. So diagnostics has changed, surgeries have changed, things have changed. And it's completely different. It's a shift. We never thought 10 years back that it will be like this. And similarly, we have to be ready for the future where we are going to, which would be next, like some of our esteemed panelists and the speakers were talking about the personalized medicines, personalized healthcare. So it would be coming to that, like more of the personalized cares, like I am different from other. Everybody would need to have a personalized care, and we are reaching there. So it's a precision medicine kind of a thing which will come in another 10 years, which we feel so. And when we say that things, how we are going to do that? So it's again the Internet of Things, medical devices, technologies, which will take us there, and we will for sure reach and things are there. So when we talk about these things, like when we talk about smart hospitals, like everybody, like if I talk about smart hospital, what does it mean to me, or it to be anybody else? I personally feel it should be a care beyond the walls, because see, hospital technology takes over, and I agree to a few of my panelists. It always there, care is there. Like sisters are sitting, care is one thing which cannot be like things. So it is care. It cannot be bound inside the walls of the hospital. Yes, a smart hospital will become when we take the care outside, and there are a lot of activities which is happening, started doing. We have started caring people outside also, home at health, other things, with the integrated software system. So it's care out of beyond the walls, and that is the next future. That's the smart hospitals which we are trying to build. So that's very important. Care remains the center of things, whatever we do and whatever we think. Automation is, yes, we have already started doing automation of a lot of things. And automation is, we do automation, we see a lot of automated things. We lot of devices, smart gadgets, smart, sir was talking, Dr. Meher was talking about it, gadgets, assets, things are coming. And I feel it's coming because of the requirement and understanding of the need. So there are two things which is, so the data is flowing from everywhere, but we have to know what we need from that data. The data, and then only the technical teams, the IT, the other things can collaborate, like sir was saying about the infrastructure part, but very, very true. See, we have to think like 10 years forward from now. If I'm putting even a cable inside my building, so that cable, can that sustain 10 years from now? What futuristic things can happen and what futuristic things we can bring to the system? So that's very critical. Smart spaces, like rooms, equipment, we build infrastructure in hospitals, we make a lot of investments in hospitals. So what is the rooms, equipments with the smart technologies? How can we make it to the future? Like that is the futuristic hospital, it is smart hospital to us. Hybrid care teams, we like our sisters, nurses, technicians, doctors, everybody there, they are doing things. We have specialized, we are going to the super specialization levels, multi-specialization, but there, if we see, we can optimize things in future in the smart hospitals by having more of the multitask skill sets. So that will help us in delivering things in a better, smart way. Hyperconnectivity, we all understand, we talked about hospitals too, super fast, 5G anyways coming, and I was very happy to listen in the morning. We already started talking about 6G. Sir was talking about 6G, so that's the great thing to happen, like we're moving pretty fast. That's very good actually. Standardizations. Standards, I am not so expert of that standards, but yes, whatever I talk and learn from people, we have made standards, and they are the global standards which are there, we are trying to get, and we have established in India, like Dr. Meher was telling about AIMS, and all other things, Holy Family, AIMS, they are all world-class facilities which we are doing. Amitabh sir was telling that he has a specialist in Netherlands sitting, who was there. So yes, so it's a standardized things which a person can sitting in Netherlands, a person in Delhi or in any rural area can be utilized. So that's very important. Another thing comes like flexible spaces. When we talk about infrastructure, again, sir, my thought and our thought should be like having a flexible space. We build a room with walls. We can think in futuristically, how can that walls be broken and that can be utilized some other things. So that could be a smart hospital. Optimized service lines. And at the end, everything which we do, we have to understand that whatever we're taking from this environment, we'll have to repay to it. So it has to be a little eco-friendly, and we have to reduce little carbon printing from the system. So that is very important, making systems and processes little paper-free, paperless, human intervention. So that is also our responsibility. So I think that is the concept of hospitals, smart hospitals, which we take care of from, and we think it should be the futuristic hospitals. And everybody, I think, sitting here, all the people from the healthcare industries, hospitals, all the stalwarts, they are working in some space. And sir has already spelled on different sections. I'm not going into that sections, how and what section, what everything, but I am very sure, and everybody sitting in this room is working somewhere or other on the aspects of automation, smartness, meeting the next future, meeting the things where I like to talk about little what Meher sir started actually from the diagnostics part, sir. You showed us the future of the AIMS laboratory which is there, and I was really impressed with that. So if we again go back to the 10 years back, we see our diagnostic industry, how segmented, how scattered it was. It was like very sad. And when we divide into the analytical, pre-analytical, and post-analytical things have changed, sir. Things have changed. I have seen changing it evolve. So now, even before a blood sample, how you order a test, that is also like our IOMT and IoT comes into place. People can order their test automatically. They sit into the convenience of the room, they are ordering the test. And there are devices. I was impressed with one of the labs I visited 2 weeks back. They have moved to a scanner. They have a barcode scanner. You scan that. It will lead you to a page where you have to fill some details and your vitals. So it leads to you and tells you what kind of tests at this age of your time and this kind of activities which is leading to you, so that you can do at your own. You can order those tests. So that is the level of artificial intelligence and the smartness which we are going on. I know, I'll do that. I'll not take much time. So that is the intelligence which we are talking about, like diagnostics. In everywhere we like sample transport. Sir showed that sample is into the track, but before tracks are also pre-analyticals. I remember sample got mismatched, sample got lost. They are smart assets, smart tags which are coming to the sample. So sample is not lost at all. So it is tracked. One hospital is a facility, but we talk about sample getting from like way from downtown, like any place in the country, like Chhattisgarh, Uttar Pradesh, and consulting a place with these smart things. So that is the power of this smartness which we are talking in the future. And ma'am also told me my time is also getting up, and I'll skip a lot of things. But yeah, the challenge, I have the routine things, like which is the problems. This slide I'd like to touch a little bit. This is Internet of Medical Things. We all know what IOMT, we have already been talking of IOMT. What is the four systems architecture of IOMT? How the medical, it has wearable devices, heart rate monitors, and everything. But only thing what I would like to touch on this point is, there's a lot of data. There's a lot of data. We have, and there are a lot of challenges also in the healthcare system. We need to understand what data would translate to solve what problem. That is the power of IOMTs. And then the devices, my colleagues, my startup friends, they are quite capable of manufacturing, changing those things. So it's very important for us to change this thing, get the data, help us go further, meet the world standards. Yeah. So I'll just skip these things, and I think that's the challenges which we have talked. So I'll step further, and yeah, and again I'll just touch on this slide. So when we talk, I already told that we have clinics across. So there are few things which we are trying to do. We also have the similar challenges in our clinics and the setups where the crowd management is there, which is a very common problem for everyone. We are taking the advantages of IOMTs and the medical devices and the technology to help us reduce these problems into the multiple ways, into laboratories, into the other systems, which I think my panelists have already spoken on the details. I'm not taking other time. And thank you very much for listening up to us. And thank you very much, sir, for giving this opportunity. Thank you.
Thank you, Amit. You have a good presentation here. There are a lot of IoT devices available in the market. You have to choose anyone which is required for you. That is the one challenging for you. Thank you. Our next speaker is Mr. Sarath. Yeah.
Good afternoon, everyone. Getting the last slot in a presentation means everything is already covered. So everyone knows now about IoT, everyone knows about this different kinds of technologies. I am managing director of Shivam. It's a hospital management software company. So what I'll cover is digitalization in hospital. In morning, I was listening to a panelist. Most of the advancement is already there, wearable, watches, this. But we feel from healthcare industry, the digitalization in the hospital itself is, suppose I get 10,000 patients, are we capable of? Is our digital thing, is our systems, process are in place? So I'm just going to give you 3 case studies in quick time. What is the digital health impact on operations of a hospital? What digitalization can impact on patient care? What digitalization can impact on convenience? I'll start with impact on operations. So, okay, everyone is talking about patient health from morning. So for a change, let's talk about hospitals' health. I feel a healthy hospital can treat patient better. Now, can digitalization solve the following problems? How healthy is my hospital? Can I measure it? What's going wrong in the hospital? Is everything all right? Are my departments performing and are accountable? What surprises am I going to get? CEO and administrators of the hospitals keep firefighting with complaints and distresses because your customers are already patients who are already distressed. So how do we help you? The answer is yes. All of you might be aware of this particular screen. This is ICU monitor, right? Every ICU is having a basic bedside monitor which says, okay, this is the alarm, this is ECG, this is heart rate, blood pressure, this. Without which no ICU patient can be monitored. So what is the beauty of this particular screen is, everything is in one screen. Every monitor, every parameter is in one screen, which is important for that particular patient in ICU. This is what we do. We call it as a control tower, a hospital monitor. If you go to a few of my clients, you will see a TV in each. Suppose CEO room will have a TV. Who will go log in and then see whether what is going wrong in the hospital and all? There should be a TV in the room. He walks in. He just sees something red. Now what is that red? Oh, how many discounts are being given? Oh, there is an expiry stock. What my pharmacy head is doing? Something is going to, stock is going to be non-moving. There are dues. There are items purchased. There are open bills. There are this. So, okay, I'm talking mostly about finances. The part 2 of my case study is medical, patient care. So when I'm talking about one particular screen, which is a health monitor of that particular hospital, the administrator's job is just to make sure that is green. Once it is green, there is no surprises you are going to get. And these monitors are not like, okay, I'm the CEO, someone is waiting and it becomes red. It has got 4 levels. It goes to the user, manager, administrator, and then CEO. So there are TATs defined, and then only if something is red on CEO's TV means no one has worked below. So this is how this is a monitor system. There is another example of this. This is a personalized thing where, okay, what discharges are going on? Where exactly the delay is? Hangama, where is the hangama going on? Patient, 4 ghanta ho gaya mere ko delay karke, this happened. This keeps monitoring on where exactly the file is stuck. It follows traffic signal, yellow, red, green. Yellow means under process. Red means gone beyond that, take action. So when below people know the CEO's TV, there is a TV which is going to beep, 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 they know I have to get it done before it goes till CEO. A lot of performance have improved in most of my organizations. So this is one of example. Okay, does the CEO only has it? Then when we introduce this, then the supply chain head says, then the CIO says, IT head, can I have something like this? So they have their own monitors. The supply chain head have their own detailed parameters. Again, to his level, next level. So what is this digital? This is nothing but your own data I am digitalizing in a monitor style. With this particular concept, okay, you don't need you are out of town, everything is available on your mobile app. With this particular thing, the whole hospital can be monitored. This is the first part. Second part, impact on patient care. I'll just take example of in digitalization, how exactly digitalization can help. All of us are from hospitals, we all know, this is an actual study, 5.2 million medical error occurs annually in India, which is a very high, which leads to very high mortality rate. One of the JCI meetings I was there, they told 40% of deaths in India happens because of medication errors in hospitals. We all know about it, published papers are there. Okay, how do we solve this? The problem is, you can see a TV, IoT. Earlier was again a TV. Just place one TV on a nursing station. What is the problem with nursing station? Every sister has to read do the same job 4 times. read the case sheet, indent it, think about the medication time schedule and write it, and then take the medicine. And 12 o'clock, right now it is 350. 4 o'clock there will be 1:5 ratio. Now I have to go through each case sheet to understand किसी patient का दवाई देना है क्या. Once there are 500 sisters in one hospital, one mistake allowed with so much of complication per month is 500 mistakes per month. Humanly allowed 4 times. So the problem is they don't have one particular sheet telling, okay boss, 12 o'clock, these are the medicines which are supposed to be administered. These are the vitals which are supposed to be taken. This is our solution. You can see at few of our clients. There, the mortality rate has come down. The medication errors have come down with one single order. I am not asking you to implement EMRs, nothing. HMI, SSR, IP, OP, diagnostics, pharmacy, everything is implemented. No need to touch consultant. DOMs are there. Just place one order. Keep what medicines are supposed to be given. System is capable of dividing it into this particular sort of screen, and it blinks. Sister clicks on it. It blinks exactly on the time. Give the medication. It blinks. Sister says, okay. Even the patient gets a SMS, this medication has been administered to you. You are safe medically, medico-legally, and this. If this is not, if sister has not done the compliance, the first screen which I showed you, it becomes red in the nursing station, nursing superintendent's thing. And she has not acted, within 1 hour, it goes to the CU. So this is a type of digitalization I'm talking about. Right side, what is this? This is initial assessments has not been completed for these patients who are already received. So when a floor manager is roaming around the floor, all she needs to see is, oh, just with that look of eye, sisters know, oh, there is going to be a round, this has to be blank, there are no tasks supposed to be there. This is power of digitalization. Once you click on that, you can see a blinking screen comes. It tells you the task, at what time it is supposed to be given. They just click on it and done. Just they can do it via their phone also or from computers also, and these are implemented solutions of ours. If this is not done, there is a screens which starts turning red and green, where you can see the nursing objections will be there. All the departments, there will be objections. Impact on convenience. With all this data, what do we have? For example, for doctor, every doctor of our hospital, they have their inpatient list, else they need to go to the reception every day to collect which exactly, where are my patients. So this is floor-wise sorted, so first floor, second floor, third floor, things like this. He clicks on the patient, he gets, lab is already computerized, so the data comes from the lab, X-ray, CT, everything is there. We are capable of, because of this, we have all the CQIs of NABH. We have 200 plus CQIs integrated over here. So this is just a glimpse of how digitalization can help if it is properly used and implemented. These are few of the implementation and installations in and around Delhi. These are our clients. So that's it. So I did well. I'm 2 minutes short. Thank you.
Okay, thank you, Sarath.
Thank you.
This is the one of the example of your smart hospitals. How smart you are. The color code, you see it. It is not required to go inside it. The color will tell you that what to do, what action has to be done. Similarly, in the AIMS trauma care also, they have a color codes, the red, blue, green, yellow. So that category of patients are there, how they can be given the quality of care in the high standards. So if you understand, you have to, frankly, those who are in the hospital, they are working, it is required, the dashboard. It will visualize to you that what kind of services required, what is the responsibility of the people, how they have to react immediately. This is the tools, it will help them out. Thank you once again. Good presentations. And the last presentations, Mr. Ronak, yeah? Yeah, so you will talk about ABDM? Okay, okay, thank you.
Good afternoon, everyone. So I think a lot of our panelists today spoke about IoMT, IoT, digitization, like how do you build infrastructure and things like that. So here I'm here to talk about how does all of this actually kind of bundle down together, or how do you build, how do you actually execute. So I think a lot of us in the room might have already heard about Ayushman Bharat Digital Mission, which is an initiative by the government of India to essentially help startups, help everybody come together, be it labs, pharmacies, hospitals, patient apps. How do they communicate with each other? How do they essentially establish that communication with each other? Whereas if there's a new hospital which is trying to come in a tier 2, tier 3 city of India, like rather than them approaching different vendors for different kind of, like if they approach different vendors for different kind of applications, or if they're wanting to build an application of their own, how can they leverage ABDM to be able to achieve their goals? So before we begin, I think like a lot of us today are talking about AI, chat GPT, generative AI, queue management, CDSS. We have all heard of it somewhere, right? But why is it that it is often thought that hospitals are the most resistant to adopt technology changes? Let us try to figure out why. So I think all of us have heard about the prowess of digital India. So India is, like the last 10 years, India has truly gone digital, right? We have 139 crore Aadhaar IDs issued. We have we have Jan Dhan accounts being created. We have 30 crore bill payments happening. UPI, we have crossed 18 lakh crore transactions. We had like 1.1 billion people who were registered and 2.2 billion vaccinations which are also given using CoWIN. So in digital health also, we have observed that like there has been some level of success achieved while both being scalable and frugal. So eSanjeevani has approximately 4 lakh consultations a day, which has 57% women, 12% senior citizens. So we've also built technologies which are inclusive. We have close to 2 lakh providers who are onboarded, 128 specialties being served, and more than 15,000 hubs. So we have truly kind of, with eSanjeevani, we had covered the breadth, we had covered the depth, we had made it inclusive as well. Internet access in India, as some of the panelists earlier spoke about as well, like internet is everywhere. Thanks to Jio and Airtel, everybody in any tier 2, tier 3 city in India or even villages have access to internet now. So what is actually stopping us from going digital, right? So to understand what ails digital health in India, so first is lack of infrastructure and resources. So like one of the panelists spoke about availability of hardware, connectivity, human resources. Then we have lack of interoperability. Everything today is very siloed and fragmented. There's no lack of standardization. While there are some conversation around HL7, FHIR is starting to get adopted, but most of the earlier systems, apart from the Apollos and the Manipals of the world, like if you go to a tier 3 city in India, they wouldn't even understand what a HL7 or a FHIR is, right? So there's severe lack of standardization. There is disinclination for use. A lot of people are comfortable with pen and paper. If you go to any, like if you go to Dharavi in Bombay, people there are, data entry for them is an additional task. There's lack of digital literacy. With telehealth, some of the concerns are that the doctor and the patient are not sitting in front of each other. So it essentially restricts empathy between the doctor and the patient. Then we have, while we have islands of excellence, there is CoWIN, Arogya Setu, PMJY, which are working in silos. Few hospital chains which are also doing good work, but they're not speaking to each other. And then lastly comes privacy and security concerns, which is legal provisions. They're difficult to implement. There's lack of awareness as well. So in short, there is not much adoption of digital health as of now. So just building on top of the last speaker, what does digitalization for a hospital mean, right? So there is discoverability, there is appointment booking, there is teleconsultation, there are aspects of inventory management, there are integrated labs and pharmacy, which Mr. Meher also spoke about, of how do the labs and pharmacies in a hospital talk to each other. There are regulatory compliances, there are HR admin functions to be managed. On the patient side, there are PHR applications, EMR for doctors, data storage has to be managed, money has to be managed via claims. There are invoices which have to be managed. Hospitals need to also start communicating with their patients so that care post-hospital also given. So there is a lot of things which have to be in place for true digitization for a hospital to actually happen, right? So the question to answer here is, will ABDM be able to help achieving digitization, or maybe the next step is making it smart? We'll try and understand ABDM in a bit more detail. So there are 4 pillars of Ayushman Bharat primarily. First is PM Ayushman Bharat Health Infrastructure Mission, which is to build infrastructure and strengthen the existing institutions. AIIMS is already doing a lot of pioneering work in that regard. There are Ayushman Health and Wellness Centers. These are health and wellness centers which are being established in the district centers to deliver primary care closer to home. There is Ayushman Bharat Digital Mission. Ayushman Bharat Digital Mission is more about building that backbone infrastructure to deliver and support delivering healthcare, digital health in the country. And there is Pradhan Mantri Jan Arogya Yojana. You would have heard Modi ji going and distributing cards everywhere. So this is essentially the health insurance which is given to more than 10 CR families today. And more than 4.8 CR people have already benefited so far. So when it comes to interoperability with ABDM, what ABDM allows is different applications to talk to each other. So if there are private hospitals, general practitioners, labs, ASHA workers who are collecting data on the ground, there are government health programs. One of the concerns that a lot of government health, lot of ASHA workers have is every ministry, like every department in the health ministry launches their own program. So data doesn't even talk to each other. They have to fill the same application again and again across multiple systems, right? Because each of them are running their own KRAs. So there is that. There are health applications and lockers, and there are multiple other applications as well. So what ABDM does is it gives you essentially a plug. All of these systems have to plug into that ecosystem so that they're able to talk to each other and data can be shared across these systems in a seamless manner. So from a citizen's perspective, ABDM allows them to have better control on their medical records, discover, access and avail health services and products, and digital records save time. From a healthcare provider's perspective, it helps them in better decision making. Like IoT kind of devices, AI kind of tools will help them make better decisions, promotes use of teleconsultations, allows them to manage their records better, and also helps in faster and cost-effective settlements of claims. For policymakers, it allows them to see, view and analyze public health data at the national level, and also implement policies at a local level more effectively. So these are the 4 core registries of ABDM. So first is every patient. So if we talk about the key stakeholders, there is patient, there is healthcare professional, there are like facilities, and then there are drug registries and things like that. So first is ABHA, which is a universal identifier for a patient. HPR is a universal identifier for healthcare professional. It could be a doctor, nurse, ASHA worker, anybody. HFR is a universal ID for a health facility, which is any lab, pharmacy, and all of them will essentially start having healthcare facilities. The architecture which ABDM follows is more federated, where the data exchange is happening via the central switch, similar to how UPI allows us to communicate from one bank application to the other, from one application to the other, from one bank account to the other. Similarly, with HICM, which is consent management, with patient's consent, a facility can essentially link a record, and with patient's consent, another facility can essentially access the record. A patient, while also trying to access the data, will implicitly give a consent which allows them to access that record as well. So there is no central repository for any health record. The data stays at the source where the data was generated. So there is privacy and security at its core. It allows more health facilities to participate. It has been designed to work with and without mobile phones. It is aligned with the data protection laws, and it's more of an ecosystem approach where the data sharing is happening with consent and for the duration that the data consent was essentially given for. So this is an overview of how, so anybody who's essentially generating a data is a health information provider, and anybody who's using the health information is a health information user, and the exchange happens via the consent manager which sits in between. So one more concept around ABDM is unified health interface. So today if I have to book a lab test for Lalpath lab, I have to essentially go to the Lalpath lab and book a test. So what UHI enables is any application which is connected to the gateway should be, any health facility should be discoverable. I should be able to book an appointment from Arogya Setu to AIIMS or CMC Vellore. Similarly, I should be able to use Arogya Setu to book an appointment, to book a lab test with Lalpath lab or 1mg as well. So it allows for like interoperability of services as well, similar to what ONDC is trying to do. So some of the services enabled by UHI are digital consultation, physical consultation, ambulance services, and lab diagnostic services. Digital consultation and physical consultation are already live, the others are work in progress. So ABHA essentially is more of, so this is how the government programs come together, where any person has an ABHA ID, like across whatever programs they are being catered to, RCH, IDSP, Ayush, Covin, or private hospital data, a longitudinal health record for that patient is essentially getting created. All of this data is also primarily anonymized and can be aggregated at a data policy level for more analysis to be done and for services to be delivered effectively. So impact of ABDM, there are it essentially leads to cost efficiencies. There can be more market expansion. OPD insurance coverage can be there. Increased patient compliance to treatment can be there. Home-based care can also be like extended. So there are multiple opportunities which exist once you build on top of ABDM. So these are the different stakeholders within ABDM. There are citizens, there are the government, there are health tech companies, insurance providers, pharma industry, non-profit organizations, healthcare providers. So each of them have to be uniquely engaged for ABDM adoption to happen. Yeah. So just to recap, how does ABDM help a hospital become smart? So there is UHI or scan and share, which is already functional in names, which allows discoverability, appointment booking, teleconsultation, and integrated labs and pharmacy. There are M1 to M3 integration, which is more around for PHR apps, EMR for doctors, data storage, and regulatory compliance. Health claims exchange helps in management of claims and booking. Yeah, and then there are like smart hospitals, which could include more of AI for smart diagnosis, fast patient registration, summarized patient history for diagnosis, claims, and providing care at home. Yeah, so that is what. Thank you.
Thank you, Ronak. It is a unique achievement by the Government of India. May I know how many of you have the ABHA ID? Raise up your hands. It is not even 10%. So the one facility come up by the Government of India, and you are the well-educated people. Why you do not have this one? It is free of cost. We supposed to have. If you use the ABHA ID, see what it happens. Today you are sick, you are going to hospitals and you are doing all the tests and all the information is in your hand. After 2 years or 6 months, you lost. But you can retrieve that one if you have the connected with the ABHA ID. This is the one of the plus point for you. So it is my request, all of you should supposed to have a ABHA ID yourself. Okay. Thank you. Any questions from the audience? Right.
Sir, we are running a little late. Okay. So we'll take the questions and we are also having the tea break at 5 because we're really running short.
Okay.
So I have one question for the Ayushman. This thing. Still a lot of rural hospitals are facing problem to register to you. Okay? Because either they have to use an agent to fill up the forms. So you need to look into a Saral form where the hospitals can get into it and the people of that village can benefit out of Ayushman. Still lot of population, the people not been getting the Ayushman facility because the hospitals have not been registered with Ayushman and the administrators of the hospital is facing a lot of problem. So this is something feedback which I got it, I thought I'll share it with you. You need to make it a little Saral, like IT, income tax, we have a Saral form. You should also make it a Saral form where the questions asked less. You know, otherwise a 50-bedded hospital or a 75-bedded hospital and the nearby people are not being getting a good health because they can't have the Ayushman facilities. I'm sure some of you are facing this problem, right? Yes? How many of you facing this problem? See, 1, 2, 3, 4, 5, see? They all are not registered with Ayushman. So you need to look into this. This is something
So
feedback.
I think the team is already looking into it. I could not cover that slide because of technical glitch, but like right now we are working with hospitals to simplify the entire integration process as well. Initially when we were integrating, when as a part of Bajaj Health, the integration used to take like 8-9 months. Now we have got it down to like less than
So
a week.
those who have not registered, they have a stall behind. You can go and check. The National Health, they have a stall here. Please go and give your name of the hospitals and all, and be in touch with them to get registered.
Sure, sure. Any questions, feel free to reach out at the stall.
Thank you. So thank you, ladies and gentlemen. May I request Dr. Sushil Kumar Meher to present the mementos. First to Dr. Amitabh Yaduvanshi, the coordinator of the cardiology head of Holy Family Hospital. So aims to Holy Family. Then to Prashant, who gives the digital, make it hospital more digital and secure. Dr. Amit Swarup, head business from STEMS. So any healthcare, any lab you want to set up, please approach the STEMS. Sharad Anand, for any hospital information systems, as he's put blue, white, red. And we all appreciate that red color which comes into these things. Dr. Ronak, now you will have a good crowd in your stall because they have to be registered now. So make sure all they are registered. Huh? Before you leave, make sure all of them are registered. Okay. Thank you so much. I request Dr. PN Singh to please come on the stage to present a memento to Dr. Sushil Kumar Meher. He is going to be the chairman for the next session. So let me start giving him work from now so that he is prepared for it. Thank you, thank you, thank you so much. We'll have the next session now. We'll move to the next session immediately. Please put up the names. Digital health and innovative medical devices in healthcare. I request Dr. PN Singh, clinic in charge and senior consultant, Holy Family Hospital, on the dais, please. Mr. Arun Agrawal, founder, Janitri. Janitri, Dr. Ranjit, can we get Janitri speaker? Ms. Neha Rastogi, founder and CEO, Augusta. Mr. Ashwin Amrapur, founder and CEO, Alkinist Technologies. Ms. Naiman Bindra, lead North Operations, Salicit Technologies. Dr. Seema Singh, founder, Unconsult. May I request all of you to be on the stage, please. Thank you so much. So this is all device and technologies which will help you to make it real digital, digital healthcare. So over to Dr. Saab, over to you. Here, Dr. Saab.
Good evening, everyone. It won't be wrong if I say that we are living in digital era. Digital technology is influencing our everyday life, all aspects of life, and in that matter, healthcare is no exception. Healthcare also is progressively being digitalized to improve its efficiency and care. There are endless examples how digital technology is influencing the healthcare. To name a few, e-medicine, e-pharmacy, robotics, artificial intelligence, and various wearable devices. Our next session is on digital health and innovative medical devices in healthcare system. So I would like to request the speaker, Mr. Arun Agarwal, to come and deliver a talk on it.
Thank you, everyone. Hi. Good evening. This is Arun, founder of Janitri Innovation. We are a Bangalore-based company focusing on wearable plus software plus AI/ML-based solution for pregnancy, labor, and newborn. So how Janitri journey started? So before I started Janitri, myself spent time in 100 plus hospitals across the country just to understand problems in mother and child healthcare, and just to understand why mothers and babies are still dying while giving birth. Even we are in 21st century, but why that number is still high. And it's just not the situation in India, but even the developing world. And that spent of time of 100 plus hospitals across the country. I have seen live birth, seen C-section, spent time with gynecologist, pediatrician, neonatologist, pregnant women, their family. And that gave me a good amount of idea like what exactly is missing. And that journey of spending time starting from a community level, PHC, CHC, district hospital, medical college, to a private hospital, to a very premium hospitals, and saw the difference. So what we figured out, 80% of these mortality and morbidities can be prevented if a right monitoring can be done at the right time and if right decision can be taken. And that is something which was missing. And we started our journey in 2016, considering that we should be able to provide a wearable plus software-based technology to monitor some couple of critical vitals during pregnancy, labor, and newborn. So yeah, I talked about this challenge, like it's a lack of monitoring and early decision making. That's a broader challenge. And that is what Janitri is looking to solve for the 1,000 days journey. And I'll talk about this 1,000 day journey clinically. So the whole 9 months of pregnancy, then labor, and after the delivery until the newborn becomes 2-year-old. So this 1,000 days journey clinically, it is very, very important from the perspective. It's very sensitive, very critical. And that is the product what we are building for 1,000 days journey, starting from as soon as she conceive and the whole 9 months, then further labor and after delivery for both mother and baby until the next 2 years. We want to make sure that at each and every phase of this 1,000 days journey, each and every parameter should get monitored at the hospital setting or at home setting, and early decision can be taken if there is something wrong. So we started with labor monitoring devices. Now we have a couple of SKUs which we have introduced in the market. So this is a portable Doppler and Toco based and mobile application based device which can monitor the fetal heart rate, which can monitor the contraction. A gynecologist or an obstetrician can see the data remotely on their phone, and it comes with the automated interpretation. We found that, in the district hospital kind of a setup or in the busy labor ward, there are 10 deliveries or 10 patients simultaneously in the labor phase, and nurses are going to each and every bed and looking at the fetal heart rate and contraction graph. So through this, we have also solved that problem by putting the centralized monitor on the nursing station. So it's happening at the ICU since long, but it never happened in the labor ward. And that is something what we are bringing. So ultimately, we have this setup. You can also check this setup on the back side. So this is a setup which goes in the bedside in the labor setting with couple of sensors which can give you the fetal heart rate, contraction, maternal heart rate, the baby kick, and it's all Bluetooth wireless probes. Talk to the mobile application. So it has interfaces like nurse interface, doctor interface, and administration interface. Ultimately, if you see this particular product, when I showed you, this comes with the Doppler and Toco, and it has to be placed on the abdomen with the belt, which is that's little bit of uncomfortable for the pregnant woman. And to also bring that comfort level, we have also brought this technology which is a patch-based technology to monitor fetal heart rate, contraction, and maternal heart rate. This do not need any belt to place it. You do not need to relocate the sensor until she deliver. As soon as she get admitted in the hospital setup for after the labor pain, you just place this patch until she deliver, and it will keep giving you the 3 parameters simultaneously. So that is another technology what Janitri have developed, and it comes with the in the form of Diomax, which comes with both the sensor. So when we have started deploying these products in the maternity hospital, both in public and private setup, and when we started talking with a lot of obstetrician nurses and all, we figured out that after the delivery, there are a couple of another maternal parameters which gynecologist needs to monitor, like BP, pulse, and SpO2. And further, they are calculating the shock index value of the mother, which is linked to postpartum hemorrhage. And they started asking, why can't you also give that us in the same product, which can also give us the shock index value. So we have introduced this another product which can monitor those vitals and can give the shock index value and the graph to the nurses and gynecologists, so they can further take decision to prevent the postpartum hemorrhage risk. So these are the direct impact products which we have raised as a part of our 1000 days journey. So yeah, this is something which Max Plus, which comes with both. So this is a first product which has both the features simultaneously in the world. It's a smart fetal maternal plus shock index monitoring device. Nobody gives that. Now let's come to the software part and how we have also evolved our software journey for this 1000 days product. So ultimately, if you see, we identified 3 major users here. One is the nurse who is going to use the product. One is the doctor who is going to see the data and take action. And one is the administrator for the statistics, dashboard, past data access purpose. So we have these ultimately three interfaces as part of our software. So on the product side, it's a nurse interface who is adding the patient, monitoring the patient and all. On the doctor side, gynecologists have the mobile app who can access the data at any point of time, anywhere. And the dashboard and central monitor, which can be placed on nursing station or at the administration room to actually access the data, past data at all. So I'll just quickly skip this. And these are the offering. So Janitri Premium application is the application where it can help you digitalize the whole labor monitoring process and immediate postpartum. Starting from a mother get admitted in the hospital setup after the labor pain till she get discharged. So your whole labor case sheet, which you are writing on your labor case sheet, it's a 15-20 pages labor case sheet. Each and everything we have brought into our premium application, which can digitalize your whole labor process, which includes WHO partograph, pre-delivery checklist, post-delivery checklist. You can calculate all the scores like Robson classification, APGAR scores and all. So ultimately, your whole digital app for your whole labor monitoring experience. Now, what happened eventually in last 3 years? When we have, so ultimately if you see, we have made the sensors small, wireless and Bluetooth based. We have made every product which is an app based. Eventually, the home monitoring market opens for us, which was not there because all the traditional products was too bulky, big, they cannot go home. They even do not transmit the data anywhere. And so eventually for us, because it's a portable, small, wireless sensor, it's all app-based. So now, couple of these monitoring like fetal heart rate, NST, non-stress test, all these now can happen at home. In collaboration with the gynecologist and hospital, now we have also started doing that. So ultimately, this product now going home in the last trimester, performing NST test at home. And we are not selling at home. We are just giving that home on a rental model because you don't need the product after delivery. So it goes home based on the doctor recommendation. You can do the test and it comes back. And if you really also want to monitor contraction at home, there is another probe. Now, another thing which is a part of our 1000-day journey is a smart handheld Doppler, which we have launched. Just quickly, you can check the fetal heart rate and within the range of 6,000 rupee. So ultimately, the whole 1,000-day journey, you will see in the next 6 months that if you really want to monitor any parameter in this pregnancy, labor and newborn, Janitri will be able to provide you all these parameters with single software for both hospital side and for the home side. A couple of doctor and mothers testimonial where they have used the product, very happy. We are a clinical validation have been publications, all clinically validated product in couple of AIIMS and medical colleges, clinical partners across the country. We have been supported by multiple partners since last 8 years who have supported our journey in terms of funding, investment, procurement, and different government sector have deployed that. Not just in India, even outside. We have been part of Shark Tank India Season 2 where Namita Thapar have become part of our journey and invested in us. So yeah, let's innovate for saving life at birth, and I'm open for any question, and I'm here. We can definitely interact and talk about the product. Thank you.
Thank you for enlightening us about this innovative medical device. And I'm sure that this would definitely help the gynecologists in reducing maternal mortality and maternal complications. Thank you. Now, may I invite the next speaker, Ms. Neha Rastogi. Thank you.
Hi everyone. My name is Neha Rastogi and I am one of the founders of Agatsa. Till few years back, this was just a number for us. We all know cardiac diseases are becoming a menace these days, but till 10 years ago, we just knew it, that okay, there is something called cardiac disease until something happened in our own family. My father-in-law, who was 55 years of age, he was a working professional. He just came home and just complained of a tightness in chest. We never thought that a 55 years old, seemingly fit person could have anything related to his heart. We got his checkup done. Thankfully, the disease was diagnosed, but the doctor suggested that every time he has any pain or any tightness or any symptom, he has to get his ECG done. So, traditionally, we all know, we have heard this word ECG, and we know that ECG is the first tool and is the gold standard to find anything related to heart. Any disease is detected by the ECG. But nobody ever thought that since 100 years, ECG has been so complicated, not just in the way of how it is taken, like all the leads attached to the body with a monitor, with a huge monitor, and with a paper report in a strip, with a graph, which cannot be read and interpreted by anyone and everyone. Only few doctors could read it. So we know that 12-lead ECG is a gold standard. ECG determines different kinds of problems like heart rate, heart rhythm, variability and everything. But we had a lot of limitations in our ECG machines. Now when we had this problem in our family, and when doctors said that every time you have to do this ECG, my father-in-law used to stay away, and we were working professionals, me and my husband, we both were engineers and, comfortable in our jobs. But we got thinking that, if at any point in time, he gets any pain or any symptom in the wee hours or, sitting at his home, who is going to take him to to get his ECG done? And even if he goes, there's a long queue, there's a long process of getting the whole process done. Now we have been, thinking and listening about getting things digitalized, making things portable. We searched and we knew that there were portable ECG devices available, but even those were complicated, they were only smaller, but they were not easier to use. So until the device was this big, we were not satisfied that this was a portable home-based solution, and that is when me and my husband, we left our jobs and we thought that, okay, we will make a solution.
May I request, the sound is too much from the back. I have been requesting with folded hands. It is disturbing the head table badly. Those who are on the exhibition area, please be silent. May I request on the exhibition area, I have been keep on coming to you guys to please be silent.
So to convert anything which was so bulky, which was so complicated, it had to be this big. It had to be without any wires. When I say without any wires, no wires on the body, no wires connected to the mobile or the system, no power, nothing connected to the power, everything digital, everything wireless, everything leadless. This is what we have made. And this device is called Sanket Life. So we had other options available which were like Holter ECG, handheld ECGs, but all of them had their limitations. No device was available until date. No device is available which is a 12-lead handheld pocket ECG which does ECG just by touch. It is only Sanket Life. So obviously when we got working on this, we met a lot of doctors and we got to know about their pain in diagnosing a problem. Now, they told us that most of the deaths happen due to cardiac issues, not because of cardiac issues, but because of the delays that happen due to cardiac issues, because of misdiagnosis or the delay in diagnosis. Now, their pain is that they are too busy, and either the patient with a very small gastric pain is coming to them and taking up their time, with a critical patient somewhere lying and fighting for his life. So definitely this problem had to be solved. Now with this device, this IoT device, anybody can keep it at his home. If it is a gastric problem, the patient can do the ECG himself. He gets to know that, okay, this is nothing related to heart. He sends his, to get the peace of mind, because we only get peace of mind when we listen from our doctors. So to get the peace of mind, he can send the report to his doctor. We have a doctor's app, it's also, and he can get the review within 10 minutes. If there is something critical, the doctor can call himself immediately to the hospital and get his treatment done in time. And even if the patient has undergone any surgery or any treatment, the doctor can advise and he can monitor the patient remotely. He doesn't have to call the patient every time to get his ECG done, and the patient is definitely getting convenience because he's having this tool in his pocket all the time, so he doesn't have to go to the diagnostic centers or the hospitals to get the ECG done and then wait for the doctors to read it, to just hear that, okay, this is a gastric problem and not the heart problem. So yeah, so these were the opportunities. We were in need of an IoT medical device, which also has AI inbuilt into it, and obviously value-added services like 10 minutes doctor review, which is a lifesaver, because even if if a person is having a heart attack, even if he rushes to the hospital, no doctor can see him and diagnose him within 10 minutes. So this is how Sanket Life 2.0 is innovated. It is a touch-based ECG, pocket size, cost-effective. This is another factor which adds to the value of Sanket Life 2.0, that it is the most affordable ECG device, and that's how everybody can carry it. And everybody can keep it at home, like a thermometer, digital shareable reports, real-time info, and cardiologist review. So how Sanket Life 2.0 helps? Quick ECG at home, quick ECG at OPD and clinics also, because when we met doctors, we came to know that not all the doctors have ECG apparatus in their clinics, and especially who are not specialists, who are not cardiologists. So this device is helping them diagnose the patients, even the walk-in patients in their clinics at the right time, patient management, and definitely remote consultations. Then when we got more into the system, we came to know that, doctors and another pain point that, this device, a healthy patient can still use. But if a person is already unconscious, or if he's too old to hold it stably, the leads had to attach. So we innovated another version of Sanket Life, which was Sanket Life Pro Plus, which was mostly directed for hospitals and doctors, and the same device can be converted into a lead-based system for the continuous monitoring or the simultaneous monitoring for unconscious patients, or the patients who are too old to hold the device and take the ECG. So in the last session, IOMT session, I was hearing that, tagging the medical devices so that the nurse can actually find where the ECG machine is kept in the hospital. Why not each nurse having an ECG device in her pocket, and she can quickly go and get the ECG done. So yeah, that's what Sanket Life offers. So in COVID times, we had another product which was an amalgamation of ECG and other parameters, because SpO2 and temperature were other parameters which had to be monitored during COVID times. So Multivital was a device which was again a pocket device with the screen onto it, which could take 12-lead ECG and also SpO2 and temperature just by touching. So these are the other products that Agatsa offers. Then NCheck was a experiment. We had researched a lot, and we had made a device which could take blood sugar just by touch. So no pricking, no blood is required. You just touch the sensors and the blood sugar is monitored. This device is still not commercialized because we are still making it more accurate so that it can be used in medical purposes, clinical purposes. Then H360 is another product which is soon to be launched. It has a very beautiful feature which is touch-based blood pressure. So till now, even blood pressure, nobody has thought that we can go away with those cuffs and we can just monitor the blood pressure by putting our finger into a probe or a hole. So this is a device which can take ECG, of course, but touch-based blood pressure, then SpO2, and then of course other features and other services are already there. Then this is a standalone blood pressure cuff, which is again, people who are not able to monitor their blood pressure through touch, they can wear the cuff, the standalone cuff, and continuous monitoring can happen. Then this is a wearable ECG patch for continuous monitoring of ECG for people who are going to gyms and people who are having arrhythmias, because for arrhythmias, continuous monitoring is required. So yeah, this ECG patch can be worn at all time, and the report can be shown to the doctor. Digitally again it can be sent, and the diagnosis can be made. So Agatsa, in last 10 years, we have not just made the devices. There's a lot of chatter about AI, but to reach to a point where the device or the machine can interpret or diagnose a disease, we need to have devices which can collect data. So these devices are towards an effort towards that. And of course, once the data is collected, now we are building the algorithms over it so that the device itself can diagnose and interpret a disease before a doctor, and also it can detect a disease earlier. So, prevention of disease can happen, and not just the diagnosis and treatment. So we have devices, we have our mobile app, and then all the data is stored on the cloud, so the reports can be fetched back, and past reports can be referenced. So how Agatsa Health Platform helps? Quick and accurate detection, in your pocket all the time, remote review of ECG report by cardiologist, disease management by remote monitoring, and patient engagement, because doctors and patients can work collaboratively towards managing the disease, so patient engagement also happens. Future possibilities with Agatsa's platforms, we have not explored these, but yes, constant cardiac monitoring for gym goers or athletes, artificial intelligence prediction of disease, like I said just now, effortless heart management, quick triage system for medical systems, like there can be a common system in the hospital monitoring all the devices all the time, and as soon as a SOS button is pressed, the hospital can send the ambulance to the patient's home and can pick the patient on time. So these are the future possibilities and future projects that Agatsa is hoping to go for. So this is the impact by Agatsa so far. We have sold about 25,000 devices, and the devices are sold to both the individuals to use at their homes and also to the doctors, and now we are integrating with the hospitals also, so that hospitals can use these devices in their premises or outside their premises for the patients who have just got operated. And we have saved a number of lives, and of course the number of diseases captured are there. Like our devices are medically validated. So any disease which is captured on a traditional ECG device, our device is also capturing that disease. So this is a roadmap of, we are present all over India right now. These are some of the prestigious awards that we have won over the years, and mostly all the awards for innovation and invention. These are some of the memorable moments that we had in the past. We had a privilege to showcase our device to Honorable Prime Minister and have won a lot of awards in the past. So yeah, so this is about Agatsa. Thank you so much.
Thank you, ma'am. Again, a very useful device, and I've been lucky. I have had the opportunity to use this device for my family, and I must congratulate you, ma'am. It's a very nice device, and I'm glad that you continue to innovate. It is a very small device, around 2.5 inches long, can be kept in the pocket. It easily connects with your smartphone. And taking ECG is not that simple. There are various leads which have to be connected at various positions. If the position is not right, the ECG won't be right. So the smartphone, the app of Agatsa app would guide you where to keep, where to place the device. And it's not a big hassle. The ECG is taken very easily. And it's generated in PDF format, which can be sent to the doctor immediately for consultation. And I am pretty sure that it must be saving a lot of lives, because it makes life easier for the doctor, and it makes a very safe thing for the patient also. Thank you. May I invite the next speaker, Mr. Ashwin Amrapur, please.
Hi, good afternoon. I'm Ashwin, and I'm co-founder and CEO of Iconist. So how many of you must have actually really faced like difficulties in going through MR or CT scans? Can you raise your hands? I'm pretty sure, everybody would have felt a lot of claustrophobic going through the all these scans, but it's quite inevitable when you're facing very difficulties in many critical illness or important issues. So what we at Iconist we are making is medical imaging very affordable, convenient and faster. So with our software, we are completely, the name says it, it's a AI based knowledge specialist. So we built all the AI technologies to make things simple and easier. A little bit about ourselves. We started in 2019, end of 2019, started by serial entrepreneurs. After years of research, we built the first technology based on generative AI in 2022. So we built the generative AI technology much before, today it became a very fashionable word. So in 2023, we got ISO 13485 medical device certification. We started last year with about 100 installations. Today, we are happy to say there are about 300 installations. a lot, it's only a software, so we sell it as a pay-per-use subscription-based pricing, and our customers predominantly are radiology centers, med device companies, pharma companies, all across India, but also more than like 6-7 countries we are already there. The team is an experienced team in the deep tech business itself. We have built a business, we have built technologies of very reputed technologies which we have sold, not just in India, but more than 30 plus countries. We have doctors who are experts in this domain. We have business leaders who have built business in this space as part of the team. So it's the very experienced team which has come together to build the technology, what is revolutionizing the medical imaging today. So setting the context, you must have seen, like, any radiology process is not a easy process for you, right? So it's a very, especially for patients, they feel claustrophobic going inside the MR machines, right? And they really, worry about the exposure to radiation when it comes to the CT, right? And also they have to wait for longer times. And sometimes if it is a public-private partnership, as we see names, like, I was just talking to a doctor, what's your waiting time? They said like 2 years, right? I know in the paper it has come 1 year. I was not surprised that it's even more worse. So that's the kind of, like, access to important medical technology which is there today in India, right? So, and also for the, radiology centers or the diagnostic centers, they want to make better utilization of the machines, because these machines are not cheap. Each machine costs you about $1 million to $2 million, and they really want to actually use maximally whatever they have invested in, right? So this is also, once you actually have the scanning done, but again there is access to radiologists, that itself is a major problem, right? So there are not enough radiologists. We have about, like, in 1 in 10,000, one radiologist is for the 10,000 of people. That's very low number in India, right? So that's a kind of, like, the skewing that's there. So considering all this thing, where, like, we see that it takes days to get an appointment, to get a scanning done, everything, right? So it's really important problem to solve. And it's not just India problem. And if you're thinking that it's a India problem, it's a very global problem. And you'll be pleasantly surprised that countries like Canada or UK, there is, like, 6 months waiting period. Okay, and that is, if you are not, like, very emergency, right, it's easily about 6 months. So that's the problem that we are going to solve with the technology. So what we built is a suite, which we call it as a quick suite, which is a end-to-end software stack built on AI platform completely, and making the thing simpler. So we cut down the time by 70% at every step. So we looked at it. So how do we make this very easy? So today, when you actually go and do a security check, how much time it's going to take? It's going to take you maximum about 3 to 5 minutes, right? So why is your scanning inside the body is taking so much of time, right? So that's what we are trying to change with our technology. The first is that you want to get an appointment time based on the emergency. We have a solution called Quick Flow. So we look at the prescription, and based on that, we devise the solution to find out what will be the optimal slot that we can give it for the scanning. Next is a quick scan. This is a patented technology. Patent has been awarded to us. With this technology, what you can do is that, let's say you take about 30 minutes with the scanning with the existing machines. It can take about 15 minutes with the same software, right? So that's the cut down of 50% of the time with the existing machines. And today, if you have machines which is about 1.5 Tesla, which is 5 years old, it can easily extend the life of the machine by another 10 years. So it's the same hardware, it's the same coil, but we extend the software using software. So that's a completely a software-defined MR. So same thing with about the CT. CT is more about the problem of radiation exposure. See, we cut down the radiation exposure by more than 70%, right? So that means that you are much more safer inside the CT. And then we want to automate the reports, because there are not enough radiologists. Suppose you have a stroke and somebody suffers a stroke, then you want to detect immediately, and the care has to be delivered within few hours, right? So that is what we do, that we detect stroke, we detect what is the extent of damaged tissues, and with that we recover those tissues using mechanical thrombectomy by doctors. Finally, the entire put it in a platform which is a radiological, so it is cut across like CT, MR, X-ray, nuclear medicine, everything together, all built on AI, and it can easily help for the radiologists to prepare reports much faster, share the reports with the patients much faster. So we come across all the things that, as part of the workflow for the patients. In terms of, I talked about how we can get a better appointment time, and in terms of quick scan, I just want to give you a little bit, spend more time on this because it's a very, very key solution that we have done after years of research, and we are the only person in the world, like one of the only one company, or there's one other company in the US, the only 2 companies which have come up with this kind of technology in the world. So that's like something very unique that we have done, where we actually take with a faster protocol, you take it GE, Siemens, or Philips machines, you use a fast protocol that we prescribe, get the scans faster, and we do the processing outside the MR machine. What used to happen inside the MR machine now happens outside the machine, so the patients can actually come out and walk out very easily. And this is what just one sequence where on the left you say it takes about 1.1 minute. The same sequence we do it about 30 seconds, and there are about 10 to 15 sequence like that for each scans. And this is again, it's a real hard validation because one of the few companies which have done in the world. We have done several validations, and we cut down the time in some cases in more than 70% of the time what is today. It also helps to save power because we can do less number of hours for the operation. We have done about 500 patient study where radiologists agreed that the images were sharper, lower noise, and there is a good delineation of pathology and anatomy with a user-friendly viewer what we provide. And then we actually, today we have talked to a lot of physicians, doctors, and they say we can't really find out how consistently we can make out what radiologists are reporting enough, right? So first of all, they can't read the scans by themselves. Second, they cannot easily understand the reports by themselves. So we automate the report generation also. So what today radiologists can do is that what they are seeing, they just need to tell, I've seen a stroke at certain position of certain size. Then we immediately generate a report which is very parameterized, which can be actually read by any physician. So you go to the cardiologist, orthosurgeon, or the neurosurgeon, so they can easily read the report what we provide. So again, it cuts down the time by more than 70%. So the entire thing we put it, and just I want to show some of these things what we do with our solution. Very fast reporting, 3D cross section that we do. We do 3D volume rendering. We do pathology, so there are multiple types of pathology and radiology and other things actually comes together to provide a very effective report. We detect using AI and auto-generate the reports using AI. We use nuclear medicine, so a lot of quantification people do where the cancer things are always the progress. So we do that with our solution. So the entire thing actually we put it in a single platform as we see. And a little bit more on kind of things that we detect is for using CT-MR is the stroke. So as I talked about, stroke is most important. You do MR based stroke detection or the CT based stroke detection, and we provide a comprehensive study. Again, this is one of the very few companies, very advanced technology, one of the very few companies in the world we are providing this kind of technology. And this kind of technology where we can detect stroke very accurately with a pinpointed location, and how much to recover the cost is another thing which is very unique for the doctors. Same thing with the CT stroke AI and mammogram breast cancer detection, again very accurate breast cancer detection. For the X-ray AI, again based on the nodules what you have inside, suppose we can detect with using X-ray. And then they do something study about the perfusion, how much, where is the blood flow happening in the stroke, and then how to do. So it's that kind of technology that we have developed. This is another important technology. So your body health depends on how much is your visceral fat is. So we do a lot of abdomen fat quantification using technology. And then the same thing with the thigh fat quantification. Other is about your spinal compressions, fractures, and those kinds of things. All the measurements we extract using AI. So what you see is a glimpse of what is going to come in days, because a lot of things, the AI, what is not possible today is going to make it very easily possible. So fast forward 5 years, everybody, just like how you do your airport screening, you'll just do screening of your body and potentially can detect if there is any ailments inside much ahead of the time that you're going to suffer. Thank you.
Thank you. Again, a very nice example of artificial intelligence making the entire process faster, easier, simpler. Thank you. Now, may I invite the next speaker, Ms. Nayamat Bindra, please.
Hello. Yeah, I wanted to just ask everybody, how many of you have actually checked your lung health at home? So Swasa does exactly that, and I'll take you on the Swasa journey. Volume.
Using ML models to detect respiratory ailments like tuberculosis, COVID, COPD, pneumonia, etc. Typically, when a patient consults a doctor with respiratory ailments or symptoms, the doctor can advise SWASA test and other possible diagnoses. A small and quick enrollment can share the web link with the patient on their phone. The patient can start recording cough sounds in their SWASA application. The results are instantaneous. On one side, the patient can see their preliminary assessment of their lung health and associated risk. Simultaneously, the doctors can access a detailed report of the cough sounds on their web dashboard or mobile device. The report provides general lung health read comprising of spirometry results followed by identification of various respiratory diseases. In cases where the symptoms indicate a high risk, the doctor can choose to refer the patient for additional tests for further treatment. SWASA is developed and maintained by Salsit Technologies, and we are committed to making respiratory healthcare accessible and affordable to everyone.
So as you just saw, Swasa, which means swas or sas, is from the Sanskrit word. We work in respiratory health and we are unbound. Unbound means we are not restricted to a certain geography. We are sorry. Yeah. Yeah, so what do we are Swasa, we use audiometric analysis of cough sounds to assess the risk level and identify the respiratory disease or ailment. So we work in the space of respiratory health. If you see something like this, you also must have seen this in your car, but this is like our lung health index, which is basically that tells you what is the lung health of the person. So green zone, orange zone, and a red zone. What is our solution? Our solution is accurately vetted. It's a cloud-based analysis based on a 10-second cough sound via a smartphone. We are real-time, so it's in a few seconds. We're inexpensive. We are scalable. We are unbound. We are accessible anywhere. And most of all, anybody can use it. Any trained person who has basic knowledge of a smartphone can use Swasa. So what is the magic? What do we do? So we take the cough sounds and a respiratory questionnaire and put it through our algorithm, and then we come out with these outputs for you, whether the person has a respiratory disease or not. So that's the first thing we can tell you. What is the pattern of the person? Is it obstructive, restrictive, mixed or normal, the lung pattern? The severity, and we also give you spirometry values. We can also tell you the lung, the rich data, which is the lung, I would say characteristic, whether it's a wet cough or dry cough, and the LHI. We're able to detect the likelihood of COPD, the previous strain, asthma, TB, and COVID. What are use cases and offerings? We work in screenings in community health and population health through screening camps and checkups, OPD or CHCs and PHCs. We aid in diagnosis, in triaging, and aid in treatment, diagnosis, and monitoring with remote patient monitoring, and in occupational health. This is a little image of how we do the lung health screening. These are some of our patents and publications. So we have CDCO and we are applying for FDA and CE. We are aligned with this. We are aligned with the Sustainable Development Goals, goal number 3 and goal number 10. These are our data security and quality standards. Our trusted global organizations. So the spirometry, as you know, requires significant capex. So lab setup, equipment cost, OPEX of lab technician, power, consumables. Whereas Swasa is just a mobile phone. You just need a mobile phone for the to assess the lung health through Swasa. This is just some analysis. The basic costing of how much it would be. Our results, so not everybody can do a spirometry test. So severe COPD patients find that difficult, whereas in Swasa it's a little much easier. We are also we've joined hands with our Honorable Prime Minister in the call of TB eradication and pulmonary TB, so for TB Mukt Bharat. So of course we are also wanting, and our mission is that no respiratory illness death that could have been prevented should happen. These are some images. We have over 12 clinical trials, over 8 patents, 9 research publications, and over 18 recognitions. Our emphasis is on scientific rigor, scalability, and medical AI capabilities. Thank you.
Thank you, ma'am. I'm really surprised with the innovations that are taking place. It's wonderful to know that this app is giving so much of information which would help and aid the clinician in reaching a diagnosis very fast. Thank you. May I invite the next speaker, Dr. Seema Singh, please.
A very good evening, everyone. In this panel of Illuminous tech founders, I feel like the only odd one out because I'm not a tech founder. I am a domain expert and a business person. I'm the founder of Unconsult. Unconsult is a business consulting service with a difference. We are not traditional consultants who come from consulting backgrounds. We are a group of people who have worked in businesses, in trenches. We have worked as domain experts. We have worked in early stage companies, in late stage companies, and we have scaled up businesses. And we work very closely with early and mid stage companies to help them go to the market and to help them scale. Because at the end of the day, whatever gets built by these innovators has to be taken to the market, has to be scaled up, and has to be sold. So that's what Unconsult is all about. A bit more about myself. Well, I am a medical doctor, a general surgeon by training, practiced surgery for 15 years. After 15 years, I hit a midlife crisis, did an MBA, and have been working in the digital health space since then. So these are not just logos. These are some of the early stage digital health startups that I have worked with over the past 7 years. And you can see a lot of names here. The domains would range from chronic disease management to infection management to post-discharge care management. You can also see some accelerators here because I also work as a mentor with early stage startups. And the latest stint is I work with the Technology Innovation Hub of IIT Delhi, helping, I would say, indigenize the medical technologies. So this is a bit about me. This is the kind of work that I've been doing for the past 7 years in my second innings of my career. You have been hearing about all the technologies, all very specific innovations in healthcare, in digital health throughout the day. What I'm going to talk about is more of a 30,000 feet view of this space. What is happening in the digital health space? What is the kind of money that is flowing in? What is the kind of value that is getting created? What are the kind of problems that are getting solved? And what's in future for this space? So it's more of going to be more of a 30,000 feet view. We have all been talking about this since morning, that health tech startups, they are the new stars of the Indian healthcare ecosystem. And having listened to my fellow panelists, I'm sure we all agree that these are the people who are leading the innovation in healthcare from the front. Just to look at the numbers, these data have been collated from the Startup India's website. In the healthcare and life sciences domain, in the time period 2016 to 2023, since the Startup India mission has been in existence, 11,000 plus startups have been recognized by Startup India only in the healthcare and life sciences domain. So you can imagine the kind of scale at which we are making progress in the healthcare domain. 1.11 lakh plus employment generated and 127% growth. So this is the kind of development, the kind of pace at which this industry is moving. And when you look at region-wise analysis, among all the startups across domains, health tech startups, healthcare life sciences startups have been some of the top performers. This is one region. Startup India report has data from all the other regions, and in all the regions, healthcare life sciences seems to be the star. So a lot of startups are getting created, and we all know, the ratio of success of startups is 1:1,000 maybe, or maybe even less. So is it just that these startups are getting created? Are they really, delivering any value? Are they really making money? So this is a report which was published by Invest India, which talks about the Indian unicorn landscape. And here they talk that healthcare is one of the star performers. Some of the health tech startups which have originated out of India have gone international, made their mark in the US market. We all would have heard about companies like Innovator, Indigenes. These are some of the star unicorns of this industry, which were born in India and they have made their mark across the world. This is a BCG report which projects the growth over the next few years. And it says that by 2030, the size of this market is poised to grow by 10x. So total digital health market, including the various domains, e-pharmacy, e-diagnosis, teleconsultation, everything is poised for growth. And wherever a sector is growing, one of the proxy indicators is the kind of funding that is flowing in. So this is a year-on-year funding which has flown into the health tech sector. And you can see that during COVID, this suddenly peaked. 2020, 2021 saw a humongous amount of funding flowing into this sector. We'll talk about the factors which have influenced this market, but for now, just look at this graph. Look at the way it climbed. It has declined over the past few years due to various reasons. There is a funding winter across, and obviously the domain is not untouched by that. But just look at the numbers here and look at the kind of funding that is flowing into this space. And the more the funding, the more the risk that a founder can take, the better the kind of innovations that they can do. And it's not just funding. Look at the number of patents that are getting generated. We talk about innovation. So healthcare in India till now has been traditionally a hospital-led business. We have had large businesses which have gone public, large hospitals which have gone public, which have generated money. But what about innovation? What about new technologies? So we as a lot of startup founders are here. We are not lagging behind in any way in new innovation. Just look at the number of patents that are getting generated in this space. So it's not just that we are making money, we are innovating, we are generating new technologies. We are at the cusp of a flexion point wherein a lot of new medical technologies are going to come from India, rather than India being the usual importer of medical technologies. So what I spoke about till now is something you are all aware. That is the reason why we are here today talking about digital health. But just a sneak peek behind the scenes. Why is there a sudden jump in the number of healthcare founders, technologies, money, funding? What's going on behind the scenes? And I love to talk about this thing that I call as enablers of the ecosystem. First and foremost, we had a gentleman from ABDM talk about it. First and foremost is the push of the current government on these digital technologies. I have listed some of the logos here. Startup India, we all know about how they are supporting and funding startups. Make in India is giving a lot of push on indigenization of medical devices and technology. The aim is that India should no longer be a net importer, we should be a net exporter of healthcare devices. National Health Authority, Ayushman Bharat Digital Mission, we all heard in the previous session how they are creating a baseline layer on which newer applications can come and they can revolutionize the space. And one very specific mission that I want to talk about, and something which I am very closely associated with, is a national mission on interdisciplinary cyber-physical systems. This is a mission under which Government of India, Department of Science and Technology, has established technology innovation hubs across all the major medical and technical institutes in the country. So we have what we call as TIHs. We have 25 plus TIHs today across the country. These are housed out of premium institutes like the IIT Delhi, IIT Mumbai, IIT Mandi, and some of the tier 2 institutes as well. What these innovation hubs are doing, they are supporting researchers as well as startups. So any research which is slightly technology ready, any startup which is new into market, working in health space, is being supported by these TIHs in terms of providing funding, mentoring, guidance, technology transfer, connects with industry and all. So I work as an advisor with iHub Foundation for Cobotics, which is the technology innovation hub of IIT Delhi. And we have recently set up a very dedicated medical center, what we call as a medical cobotics center. And this center is focused entirely on supporting products based on AI and robotics in health tech domain. So this is the kind of enablement that is happening for this industry, this domain currently. Technology as an enabler. In the last session, we spoke a lot about IoT, AI, ML and all. So these new technologies, some of the technologies which I, over the last 7 years, have seen grow exponentially and which I feel today are the major game changers. I have just listed down those here. First and foremost is cloud computing, the kind of cloud computing power we have today. Without this, any AI ML algorithm, any large language model would not have been possible. So cloud computing was the first thing that changed the whole space. AI ML, we worked in an AI ML startup 3 years back, and we were struggling with digitizing the doctor's handwritten notes. We tried natural language processing, we were not successful. Come 3 years later, today large language models are able to even listen to the conversations, read handwritten notes and convert them into digitized data, and also able to extract information out of it. You all would have used ChatGPT. So ChatGPT kind of applications in healthcare are changing the whole scenario. Robotics is a domain which is close to my heart since I work very closely with it. A few other things, and I would like to talk about sensor technologies because most of our startups sitting here on the dais are working in that technology. So a lot of new sensors being developed, although a lot of components we are still importing because it's still not being made in India, but we are definitely making progress in that direction. A lot of sensors enabling home monitoring, enabling point of care devices, enabling much closer monitoring of the patient in conjunction with Internet of Things. So these are some of the technologies which are currently driving the innovation in this space. We have heard about these technologies from the founders themselves. Now coming to the biggest enabler, the biggest push for the digital health market in the country. While COVID was not a good news for most of the industries, somehow for digital health, COVID acted as a boom. So when I started working in the digital health space way back in 2015, when we used to go to the doctors and we had a solution for management of diabetes, we used to take it to the doctors and the question was, what's in it for me? Why should I even try a digital technology? You know, and suddenly after COVID, it's the other way around. The doctors would come to us and ask, do you have any solution that can make our lives better? So that's the kind of sea change that COVID has brought in. The user acceptance has certainly skyrocketed. You can see it from all these apps, the number of downloads that have happened in the past. So these are some of the things, the changes that were majorly pushed by COVID. Today the user is, especially the doctors, they are far more open to adopting technology solutions than they were prior to COVID, majorly because during COVID times we have all seen the kind of potential that's there in this space. So just a brief overview of what kind of companies are coming up. You all know that, I don't need to talk much about it. And I have an eye on the clock also. So these are some of the sectors in which companies are working: health and wellness, healthcare services, pharmaceuticals. According to a NASCOM report, these are the common problems that are getting solved. A lot of these companies are working on accessibility and affordability of healthcare. You would have gathered from the kind of presentations that happened here. A lot of these companies are working on improving the accessibility and affordability. These are some of the kind of businesses, integrated healthcare providers. We all know these are the IHPs are the stars of the ecosystem today. We all know PharmEasy, Precto, Tata 1mg. Then there are healthcare SaaS companies. As I mentioned earlier, a lot of these SaaS companies, although they are born in India, but they have a US-focused business for various reasons. Innovation and Indigene being the Indian unicorns. Then we also have some other healthcare SaaS companies. E-commerce and personalized healthcare solutions. We heard about Swasa, we heard about Sanket. All these are personalized healthcare solutions which can connect the patient to the doctor. So this was all of what I wanted to talk more as a general overview of the industry, what's driving it. We can go on talking about the other side, that is the challenges which all of us who are working in the industry face, but maybe that's a story for another day. Just to conclude, I would like to highlight a few points which were highlighted in a recent report published in the ET Health. Going forward, the funding is going down. A lot of consolidation will happen in the industry. For companies to succeed, they will somewhere have to look at a phygital model wherein they will have to integrate some physical devices or services with the digital models. Digital-only models are more difficult to survive. Vertically integrated care will be more successful, and patient experience remains the bottom line. Healthcare being a space where patient experience matters a lot, we really cannot get away from a good patient experience, whether we are a digital, phygital, or a brick-and-mortar setup. Patient experience remains the same, and we are hoping for tech being built in India for the world. Thank you.
Thank you, ma'am, for a very informative talk. Now the session is open for questions. Any questions, please? No questions, so we end the session here. Thank you.
Thank you very much, ladies and gentlemen. We keep on listening, data, one side, digital, you know. So what I feel is, after listening to everybody, we can give all the credit to the government and everybody, but all these devices really got a push after the COVID. I think half of the room, those who are sitting here will agree, because the real push came after the COVID, you know, because only the COVID patient used to come to the hospital. The other people, whether it is cardiology problem, gynae problem, all used to scare to come to the hospital. That's how all these entrepreneurs have come up, and now the funding has started. So congrats to all of you, the entrepreneurs in the digital health. Some entrepreneurs should come up with this room also soon to join you to take this digital health to the next. So I request Dr. P.N. Singh to present the mementos to the distinguished speakers. First to Mr. Arun Agrawal, founder Genitri. I really found this Genitri things very good for all the hospitals, like Swasa and other things. This is also very good, these things. Neha Rastogi. You know, what a coincidence that Dr. P.N. Singh is already using the device, and here is the founder. Ashwin. Namat Bindra. And Dr. Seema Singh. We also heard how Dr. Seema has changed from the medical to the digital and the business lady. Dr. Saab, I will present a memento to you. So we'll have a quick 15 minutes tea break. Please join us back, the last session, then we'll get into the cocktails and dinner. So, so just 15 minutes, quick break. मैंने भेजा कुछ देखो.
For any of our needs. Let it be the schools, hospitals, malls, entertainment hubs. Everything is available just a couple of steps away. A well-planned community living facility brings the world together to where you live instead of making you want. For them. While we are aiming for accessibility, we need to ensure these cities are safe for living. Yes, security systems are vital for smart cities. Why do we need to have a security plan in the first place? The answer is simple, because we as a community are going to live there. We need to ensure social safety, assuring complete city monitoring, help to maintain law and order in the community, controlling the traffic flow, improve city functioning, crowd management, and analysis. How Norden Communications can help with all the concerns we discussed. City surveillance with constant video monitoring, providing public safety with accurate surveillance, traffic monitoring and law enforcement ecosystem, proper law enforcement with ANPR, automatic number plate recognition, and FRS, facial recognition systems. Smart crowd management and people counting, real-time alert for analytics and safety. Smart cities are meant to be safe cities too. Contact Norden Communication to discuss further.
Welcome to Shivam Metasoft. where we are dedicated to simplifying hospital management with our advanced hospital management software, NeoSoft. We make hospital operations effortless. NeoSoft covers the entire chain of healthcare delivery, from small clinics to multi-specialty hospitals. We not only provide information, but manage the hospital, allowing you to focus on exceptional patient care. Introducing hospital control towers, real-time insights, timely actions, and multidimensional data exploration. Our hospital control towers revolutionize the way departments within a hospital manage their operations. A one-stop solution tailored to your hospital's unique needs, NeoSoft is built on the entire ecosystem of computers, tablets, mobile, and TV screens. Join our satisfied clients and let Shivam Metasoft simplify hospital management for you.
हमारा विजन है कि कोई भी माँ और बेबी प्रेगनेंसी के टाइम, डिलीवरी के टाइम या पोस्ट डिलीवरी के टाइम ना तो उसकी डेथ हो, ना ही इसको कोई लाइफ लॉन्ग कॉम्प्लिकेशन हो।
Here with us today, we have the co-founder of Agatsa, a company working towards making healthcare services easily and readily accessible and available to all.
We always believed in the power of technology and innovation to solve complex problems. The challenge was really to miniaturize the big machines that are kept in hospital. So we've just miniaturized the whole setup and connected that to a smartphone.
My father was a heart patient, so we were regularly required to get his ECG done. So we thought, why not buy some device which could be as easy as touching your fingers and the ECG would reach to us. We couldn't find such device, so we thought, we both being engineers, why can't we make a device? So that's how we started.
We set up a lab in our home and started designing the prototype, which was set up in a matchbox. The ECG could be displayed on a smartphone, and that was a eureka moment for us.
That making high technology work for the rich, very easy. Making low technology work for the poor, very easy. Making high technology work for the poor is very difficult. And that's exactly what he has given basically done.
Very revolutionary thing in terms of digitalization and transformation in healthcare. From community standpoint, यदि हमारे जितने भी elder patients होते हैं, या बेड रिडन पेशेंट्स होते हैं जिनको किसी कारणवश वो हॉस्पिटल नहीं आ सकते या जिनकी एक्सेसिबिलिटी हॉस्पिटल पहुंचने में कम रहती है, चाहे उनके पास कोई भी साधन नहीं होता या उनके बच्चे बाहर होते हैं, एंड देयर इज अ लॉट ऑफ ग्लोबल मेडिसिन, लोग बहुत ट्रैवल कर रहे हैं, उस टाइम पे आपको रिक्वायरमेंट होती है कंट्रोल रिमोट मॉनिटरिंग की। आपको ज़रूरत होती है एक डॉक्टर की जो आपके किसी भी लैब या डायग्नोस्टिक को समझ के उस टाइम आपको बता पाए कि आपके शरीर में क्या प्रॉब्लम है। इट्स अ कॉस्ट इफेक्टिव डिवाइस और वो मेरी कार्डियक हेल्थ या ओवरऑल कार्डियोवैस्कुलर हेल्थ के बारे में हेल्थ बता सकता है। इजी एक्सेसिबिलिटी, गुड अवेयरनेस एंड कॉस्ट इफेक्टिवनेस, ये तीनों जिसमें है वो है संकेत लाइफ।
आपके पास एक डिवाइस है जो 15 दिन पहले आपको बता देगा कि आपको हार्ट अटैक हो सकता है, नहीं हो सकता।
संकेत लाइफ,
संकेत
देगा लाइफ का,
डिजिटल संकेत देगा।
Patients can have it at home. So if they keep it at home and they use it, and they can send it to the GP immediately.
In the Indian settings, you can say it can reach to a more number of people. So those can be diagnosed early, can be saved.
Swassa, an ultra-scalable and affordable respiratory health platform developed as a point-of-care solution for triaging, monitoring and surveillance of various respiratory diseases. Swassa uses audiometric analysis to analyze the cough sounds using ML models to detect respiratory ailments like tuberculosis, COVID, COPD, pneumonia, etc. Typically, when a patient consults a doctor with respiratory ailments or symptoms, the doctor can advise Swassa test and other possible diagnoses. A small and quick enrollment can share the web link with the patient on their phone. The patient can start recording cough sounds in their Swassa application. The results are instantaneous. On one side, the patient can see their preliminary assessment of their lung health and associated risk. Simultaneously, the doctors can access a detailed report of the cough sounds on their web dashboard or mobile device. The report provides general lung health record comprising of spirometry results followed by identification of various respiratory diseases. In cases where the symptoms indicate a high risk, the doctor can choose to refer the patient for additional tests for further treatment. Swassa is developed and maintained by Salsit Technologies, and we are committed to making respiratory healthcare accessible and affordable to everyone.
We live in an age of nearness and ease of access to every need, and in fracture around us. We have this concept of growing smart cities, where we have all the living amenities together. Today, the idea of community living has transformed into sensible cities. We do not have to step out from smart cities for any of our needs. Let it be the schools, hospitals, malls, entertainment hubs. Everything is available just a couple of steps away. A well-planned community living facility brings the world together to where you live instead of making you wander for them. While we are aiming for accessibility, we need to ensure these cities are safe for living. Yes, security systems are vital for smart cities. Why do we need to have a security plan in the first place? The answer is simple, because we as a community are going to live there. We need to ensure social safety, assuring complete city monitoring, help to maintain law and order in the community, controlling the traffic flow, improve city functioning, crowd management, and analysis. How Norden Communications can help with all the concerns we discussed. City surveillance with constant video monitoring, providing public safety with accurate surveillance, traffic monitoring and law enforcement ecosystem, proper law enforcement with ANPR, automatic number plate recognition, and FRS, facial recognition systems. Smart crowd management and people counting, real-time alert for analytics and safety. Smart cities are meant to be safe cities too. Contact Norden Communication to discuss further.
Welcome to Shivam Medisoft, where we are dedicated to simplifying hospital management with our advanced hospital management software, NeoSoft. We make hospital operations effortless. NeoSoft covers the entire chain of healthcare delivery, from small clinics to multi-specialty hospitals. We not only provide information, but manage the hospital, allowing you to focus on exceptional patient care. Introducing hospital control towers, real-time insights, timely actions, and multidimensional data exploration.
May I request all the delegates please join us back. Our last session of the day, Bharat Digital Healthcare Summit. The CIO panel. Digital Healthcare CIO panel. May I request all of you to please join back. Very interesting session. No hospital will be able to run without CIOs. May I request all of you to please join back. Delegates, those who are standing behind, please join back ASAP. To run a hospital to smart hospital, we need CIOs. Father Bittu, please have a seat. We'll start the session. We need to start the session. Ladies and gentlemen, this session, hospital needs and expectations towards technology and data. Digital transformation in healthcare, a journey into smart hospitals, records and data storage in hospitals and other healthcare providers. Generative AI to reshape the future of healthcare. That's the 3-4 topics which we are going to talk now. The entire session is moderated by Mr. Prashant Singh, Senior Associate Director, KPMG. Prashant, may I request Prashant to join us, please. Ladies and gentlemen, please welcome Mr. Prashant. The distinguished panelists in this are Dr. Sushil Kumar Meher, Head IT AIMS Delhi, Mr. Arun Goyal, Director and CIO, Sir Gangaram Hospital, Mr. Praveen B, CIO, Amrita Hospital, Mr. Pushkal Mishra, Chief Information Security Officer, Dr. Path Lab, Mr. Srinivas Lu, Tayyam CTO, Arvind Eye Care. So we have a very, mixed panelist in this, which is going to talk, one from Eye Care, one from Path Lab, two from hospitals, three from hospital, and consultant who is going to chair the session. A beautiful session. Without CIOs, as I said, hospital to smart hospital is not possible. So over to the chairman. Sir, thank you. Please, gentlemen, have a seat. Over to you, sir.
Thank you, Shashi. So, good evening, everyone, and welcome to this last session on healthcare service provider needs and expectation towards technology and data. India's healthcare system is a vibrant mix of tradition meeting innovation. India has always been admired for its skilled doctors and specialists.
One minute. Those who are again behind, please make less sound. I've been requesting again with folded hands, please. Your sound should not disturb the panelist. Thank you. Sorry.
Sure, Saji. Thanks. So India has been always admired for its skilled doctors, specialists, both in the public and private sector. And its reputation extends beyond borders. And India has become a hub for medical tourism, attracting patients from across the world, seeking high quality healthcare and competitive costs. While we've always had a strong foundation in medical expertise, recent years have seen a surge in efforts to make quality care more accessible and affordable. The India government's commitment to a healthier India is evident in groundbreaking initiatives like Pradhan Mantri Jan Arogya Yojana, providing health insurance to about 50 crore people across India. That's covering across approximately about 40% of our population, and they're gaining financial security in healthcare. This scheme is a game changer, providing health insurance coverage to millions of underprivileged citizens. Similarly, CoWIN too had streamlined the entire vaccination process and demonstrated the power of technology in public health emergencies. The ambitious Ayushman Bharat mission is a multi-pronged attack on the healthcare challenges, aiming to establish 1.5 lakh health and wellness centers, and this coupled with the Ayushman Bharat digital mission in over 2 lakh health facilities is laying groundwork for a truly connected healthcare system. The health infrastructure mission is another exciting development where we are focusing on strengthening medical colleges and hospitals around the country. These initiatives are not just about brick and mortar, they are more about harnessing the power of technology. New technologies are rapidly transforming the healthcare landscape. And Gen AI healthcare future is right on the cards. Telemedicine is poised to bring specialists closer to remote areas, and medical wearables are empowering patients to take charge of their health. These possibilities are truly game-changing. However, with great power comes great responsibility. And as we embrace these advancements, we must also prioritize robust data security. Cyber attacks is a growing threat, and safeguarding sensitive patient information is paramount. Data privacy is another critical concern area. Ensuring patient trust and ethical use of healthcare data is crucial. And that's precisely why this panel discussion is so important. Today, I have with me a distinguished group of experts who will share their insights on the needs and expectations healthcare providers have from technology and data. We'll learn about their journeys towards becoming smart healthcare providers, explore secure data storage practices, address cybersecurity concerns, and delve into the world of data privacy. We'll also explore the cutting-edge potential of generative AI in shaping the future of healthcare in India. Now let me start with you, Arun. You've been very much involved with the Ayushman Bharat Digital Mission. You've been a project director there for several years. India's healthcare landscape is vast and diverse, and there's a significant gap between urban and rural healthcare access. I'm curious, in your opinion, how can digital transformation help bridge this gap, especially in the context of ABDM?
Thank you, Prashant. Let me tell you that there were basically 3 building blocks while conceptualizing or creating the National Digital Health Mission, which is renamed later at Ayushman Bharat Digital Mission, was standardization of the healthcare data across the industry, across the healthcare provider. So that was the one mission which we wanted to achieve. To achieve this, we studied all 5 continents, major healthcare programs, and suggested to the government that these standards should be followed up. And I am pretty much confident that the private corporate hospitals are already following those standards when we talk about those. So be it following the ICD-10, ICD-11, be it SNOMED CT, be it LOINC in the laboratories, in the data transmission HL7, FHIR4, R7 form protocol, or other formats in the healthcare. So those were the standards we suggested and imposed into the hospital. We created 3-4 registries which were basic requirements of the NDHM, so that we can make sure that all healthcare providers, be it hospital, diagnostic pathology lab, radiology laboratory, pharmacies across India, nursing homes and standalone clinicians in the remote areas could get connected to the this network. That was the basic concept of this National Digital Mission. Government wanted that the whole healthcare arena should get integrated with this. So once we have a standardization across the industry, we will be able to achieve interoperability of the data, which government is pushing forward. So initially, government has implemented this particular project in all the union territories, in government hospitals, 100%. So that has been already achieved by the government. Government is struggling to implement it into the corporate world because this particular, one statement is there in this mission is that this is a voluntary mission. So when you say the voluntary, it is up to the people to adopt it or not adopt it. Then there is I personally, when I came out of this particular mission, I see that there is a lack of initiatives from the government side to market this particular project, where government is failing to make corporate understand the value of this particular mission, how patient is going to benefit out of it, how clinical fraternity is going to benefit out of it, how the country and the healthcare policy makers are going to benefit out of it, which is already envisaged out there in the policy document of the National Digital Health Mission. Sorry, I'm saying that National Digital Health Mission, now it is renamed as a ABD, and the Ayushman Bharat Digital Mission, wherein if you have a geographic data, gender-wise data, age-wise data of health tech, then you will be able to implement the health policies in more effective way. Wherein, if you have a pandemic breakup in a particular region, you can control it from the central or the state health government perspective. So that was the idea behind. And particularly one particular concept was kept in mind while implementing and designing this concept was, everybody, be it a standalone doctor or it's a nursing home or it's a standalone pharmacy or a chain or a corporate, private, whoever it is, they need not to share the data. They will be the custodian of the main data themselves, and they will be the data fiduciary for their data. They need to only share the link of the individual patient's data among the fraternity through respective technical modes, health exchanges, etc. Keeping the cyber security in the consideration, where the encryption mode and All the protocols have already been suggested into the document, which needs to be followed up. So it is up to the government to make sure that there are incentive scheme, or there is some convincing marketing initiative should be there from the government side to make sure that people are adopting it and reaping the benefit out of it, for which this particular project was conceived.
Thank you, Arun. Srini, now when Arun talked about, the basics, the policy seems to be pretty, solid, and it has a lot of benefits. But, it is not being adopted at the pace at which it should be probably. So are you seeing any regional nuances or any other challenges in adopting this particular policy?
Yes, in fact, prior to this session, we were talking about the kind of challenges why we are struggling to implement. Okay, it's a long way to go, because I think the most priority is how we can make, the affordable care to reach to the unreachable people. That is a major. Okay, today I think Sushil sir maybe know, today if you take our hospital as an example. I'm from Aravind Eye Hospital. We are world's largest eye hospital. 22,000 patients in a day across 123 facilities. If you come to our hospital, you will see patients are waiting in the queue in the morning 3:30, 4 o'clock. So just imagine kind of a volume, kind of a need. Okay, so I think, particularly from Aravind Eye Hospital perspective, we have a very clear vision, how we can eliminate needless blindness. That's our vision. To reach out that vision, what we did, okay, we have two policies. One is design for non-customers. Okay, you design your approach for non-customers. That means you don't think they're a customer, you need to reach out to them. Okay, and then develop the competition. So to reach out to your vision, so you need to design for non-customer, develop the competition. So what we do, today we have 123 facilities. If you see the 123 facilities, so tier 1 we have a tertiary hospitals, tier 2 secondary hospitals, tier 3 if you see we have something called a vision center, where we are very clear, there are 50 villages, there is no hospital around, there is no facility for transportation, where we set up the hospital. We make sure that there is no hospital around 50 villages. So reach out to the people where they are not reachable actually. So the ultimate objective is to reach out your vision.
Accessibility basically.
Yes.
Right.
So I think the fundamental is one, how you can make it your healthcare is affordable to common man, and how you can make sure reach out to them. So that's a way you will be able to bridge this gap actually. So that's my view in that perspective. So once we make this happen, then we can build all these things.
Okay. Thank you, Srini.
Prashant, can I add in?
Yeah, sure.
So I heard Srini, his major concern seems to be they don't want to fund this particular project because their mission is first to achieve their mission to provide and eradicate blindness out of the society. So government has already taken this into the consideration while designing this particular project, and they have provided all possible applications inbuilt freely available into the project. You need not to spend anything into it. You need to make sure that you standardize the data. You can use the application if you don't have. If you don't have a telemedicine application with you, it is available free into the portal. If you don't have a standardization protocols to standardize your data, they are providing the facility and assistance to you to standardize it. So government is providing all assistance to digitize your things and operations so that you can get integrated with other hospitals.
That's really great to hear, Arun. I think very similar to the Bharat stack that government had promoted.
Yeah,
I think
so
what you're saying is
e-Sanjeevani and e-hospital is a part of HIS in the project, which any nursing home or any doctor who hesitate to implement the HIS or spend money on the HIS, they can go to the portal and start using it.
Perfect. Let me also ask Praveen. Praveen, can you give us some specific examples from your own experience in your hospital? How technology is helping to improve the patient care and operational efficiency these days? What are you doing to work on that?
Sure. Again, thank you for providing this platform to share some of our ideas based on the experiences and the vast knowledge that we have gathered over past years. So just to quickly introduce myself, I'm Praveen and I'm with Amrita Hospital. In Faridabad, we have a 2,700 bedded hospital, one of the largest facility. We're not fully operational, but yes, we've been there for almost 2 years now. And prior to that, we had a hospital in Kochi. So we had an experience of 25 years that we brought up here in Delhi NCR. So in terms of how technology is providing efficiency, not only from the hospital perspective, but also passing on the best possible care to the patient, thereby increasing the efficiency and also reducing the cost. So there are multiple prongs, multiple perspectives that you can look at. So technology has been a very much essential backbone that we have utilized, starting with good EMR implementation, because any new tool, any new technology that you have upcoming, especially the Gen AI that you mentioned, relies purely on having a digital data, a digital source of input data behind it. Unless and until you have that, you could have the best of AI tools and it will do no good to you. So we had this experience earlier of digitizing or having a good EMRs, and that was one of the fundamental that we ensured that we build upon from day one, and we had the advantage because we were opening new and we had that leverage. Then touching upon the previous question, I also want to point out that in the US, when they were implementing EMR, actually the government, as part of ARA, American Reinvestment Recovery Act, they actually incentivized the physicians, the hospitals, they gave money for the people who are using EMR, and so they had the carrot, and then over years they reduced that incentive, and then finally they started penalizing the physician and the hospitals, and it was well planned out effort. They had different phases of it, so maybe something like that would have helped, because that would give them the incentive for the hospitals and the physician to adopt or become early adopters of it. Coming back to technology, other than the EMR, we are using AI to bring down the waiting time for the patient. We are using that to reach out to the patient, making sure that we are able to deliver a very personalized, I won't say treatment, but at least a care plan, because we have implemented some of the latest tools that are available. A lot of them are still in a proof of concept kind of a stage, but yes, I think that is something that will tremendously help. And also technology being very ubiquitous, we could reach out to all the rural area that we're talking about, and with the availability of mobile and the data on the mobile, we could utilize those features, especially in the ophthalmic space. I know that there are a lot of tools that are available where you can use the camera of the mobile to do some of the basic tests automatically. So that will help, instead of reaching out to the patient physically, that with technology you can also reach out to them. So that was a brief answer.
Thank you, Praveen. Let me turn to you, Dr. Susil. You've been a stalwart in the industry, more than 25 years now?
In the 32 years.
32 years. Being in technology and looking at the technology landscape of one of the premier hospitals in India, can you tell us a little about what are the typical challenges that healthcare service providers are facing in this digital transformation journey?
So today technology is not an issue. Issue is that how the technology will be implemented, in what way, what place, in what time. Before that, you have to understand very clearly what patient needed for. That has to be. See, the patient footfalls per day in AIMS, already I have told you, is the 14,000, say around 14,000 a day. Total OPDs specialized, very unique disease-based clinics, it will be around 600, more than 600 different type of clinics and departments they work in a day. That has to be managed properly. And when the patient, 14,000 patients are coming, with the patient attendance and all these things, if you add it, it is 50,000 people in one building, one place is gathering. When they are gathering, they have to come in a different mode of travel, where they will be parking. Most of the hospital, whether it's a government or private, it is be a challenging that where they will park. Can you solve this to the technology? Because this is the first experience of a patient when he's coming in, that where I have to park or where I have to land. When I have landed it, I'm not well, I have to walk around 100 meters. Can I walk, or whether you need a wheelchair? And at that time wheelchair is not available. If somebody can't walk, he needs a stretcher, and stretcher is already been finished, and he has to wait. Where he has to sit? These are the challenges are there. If you can do through the technology to bring them, then no. If you want to come with your car, you can have a parking, you can book at the time of appointment. In that case, it is easy for him. Otherwise, automatically in the appointment will tell that don't come with your car because the parking is full on that day, and you come with your Ola or Uber or Auto, anything else. So this is going to be implemented in a month in our place, that you can book your wheelchair, your stretcher, your parking. Second part is that when you reach there, if you need a attendant, that yes, I can afford it. So one attendant on hearing basis, hourly basis, you will be available to you. These are the facilities. This makes a sense, because when person is coming and he'll find that it is very smooth. Second part is that registration part. Registration part will already it is given to the patient. Patient or patient attendant, they can do the registration from their mobiles. We have the QR code, scan it. If you have AVA ID, you can give it. Otherwise, create the AVA ID. You will get the registration number, you get the room number, you will get the doctor's name. Another plus point it is that, let's say your queue number of that room number is 9. And for 9 person means 8 person has to be seen by the doctors, and 9th will come to you. What much time the doctor will see this patient for that 8 patient? It is 1 hour, then he will inform you that you reach around 9 o'clock. After 10, your turn will come. So that 1 hour he may use for he can go for a cup of tea in the cafe or somewhere else, he can do it. Third part is that, if you have a particular disease, you are going there, we'll send because your mobile is with us, we'll send a link to you that learn this link, that what disease is that, and what is the symptom of the disease, and what has to be take care of that. So before going to doctor, you know many things that this disease has this. So which anything is doubt beside that, you can talk to the doctors. So doctor time will go down. So these are the technology leverage you are giving to the patient level to have a good time in AIMS.
Excellent, Dr. Sushil. I think that will definitely help to improve the patient experience, right? Now, let me change track a little. Pushkal, you being the CISO of one of the large diagnostic centers in India, with this increasing reliance, and we're not talking about medical health records, how do you ensure that there's a robust cyber security measures around protecting these confidential private records of patients, and also the business records that as an organization you guys are managing? What are some of the strategies that you're adopting around that?
Absolutely, that's a very pertinent question.
Thank you for asking. When you think of a pathology, for an example, Dr. Lal pathology, we are catering over 1 lakh patient every day when it comes to the diagnostics. Now, that scale obviously cannot be handled with any simplified technology. And obviously, there are 2-3 key elements here. The technology that is generating the data, which is really a clinical information, patient identifying information, as well as the business information. In the same breath, the sales data is equally important. What happens from a board content standpoint is also equally important. So one of the first thing that sort of, goes in terms of designing the cyber framework is really be able to understand that what is confidential and restricted for me in the universe of data that we are collecting. And obviously, when we start from that point, we don't end up putting, let's say, $10 lock on a $5 bicycle. And that's the problem, that most of us grappled with, that how do I make sure that we deliver the, value also when it comes to business risk management. So that's the very first point. How do we identify the, the confidential and restricted informations? Once we have identified it, the another important element that goes with is that, now how do I control the data exfiltration? Now there are 2 actors constantly involved in it. You will have the insider threat as well as the external threat actors who will be motivated to take the information. Now the insider threat is rather, in the last 5-7 years have been a little difficult to manage, but there are technologies in place that can help you do something called a data leak prevention. And you can do it with the help of enterprise grade technologies and sort of control the exfiltration across the channels of data. That's the very important point. Now the story doesn't stop when we think of a strategy. We think of insider and outsider both, right? And we then think of what is trusted, what is not trusted. Now, most of you, one way or the other, have heard the term called zero trust, right? This is what is sort of, we are also trying to bring into our technology landscape, right? We no longer want to have a sort of implicit trust for the employees or a pathologist or a clinicians, while we have explicit problem with somebody who's trying to access our data from outside. You don't know, which point, the information is gonna get, leaked out of. So we look at both the angles, right? For the outside world, what we try to do is we try to create a sophisticated security operations center, right? That is critical part of our cyber strategy that will actually look at all the information systems. Is there any abnormality going on, right? We all understand that what is actually a normal behavior in terms of system that are generating the data, in terms of people that are accessing the data. Now, once we see there is a deviation to an otherwise normal behavior, Security Operations Center is your only option to actually detect and remediate on it. And these abnormality can be caused by some rogue process, probably getting installed by some ransomware or malware of these days. That's a very important part. So I talked about classification of data. I talked about data leak prevention. I also talk about the importance of Security Operations Center. But the story does not stop here. There are 2 more important points that actually goes in part of making a robust cyber strategy. The one is really, and this is actually new, there's something called attack surface monitoring. In a course of a business users will reach out to IT for a variety of technological interventions. And IT, being an IT, has to create service and deliver those services to them. And that means huge lot of web applications, that means lot of mobile application, that means lot of services that are publicly accessible also. What are our ways to actually know that my digital footprint outside? The attack surface monitoring is an essential part of, I would say, 21st century cybersecurity strategy
to actually know your digital footprint and see what are the loopholes. So you fix them before it gets exploited by the adversaries outside. And last and not least is the end user. Good old end user awareness is a very important part. You do whatever you want to do in terms of spending a lot of money in technologies and creating let's say world-class processes. Some user somewhere, is gonna sort of succumb to an email or a WhatsApp message, and that will sort of create a lot of issue over the period of time. So that is also a very important element. So it's what I call it a defense in depth. There's no one platform, there's no one process, there's no one technology. It goes on like a defense in depth strategy. That's what we do. And being a healthcare provider, its onus is on us really to be able to see the threats coming from all over the areas.
Great, thank you, Pushkal. I know that all the healthcare service providers are doing their own bit to ensure that the data, the patient data, their own data is being protected and is made available to who needs it. But let me open this question up to the entire group here. According to you, what do you think that the healthcare service providers, along with technology companies, along with government intervention, can do to build further trust and ensure this integrity of the patient data?
Maybe I could take a quick minute stab on it and then we leave it to the forum. See, there is a very famous saying in the world of cyber is a shared responsibility. 10 people, 5 people or 3 people in a one corner of company cannot ensure the cybersecurity. It's a shared responsibility model, and it becomes really a great tool when the power of collaborations actually gets in. When we think about government, we think about CERT-In, right? We depend on CERT-In to actually give us a nice, intelligence when they learn it from our peer group. This is a ransomware that has attacked a certain healthcare. This is a ransomware that has attacked a certain banking system. This is a data breach happening on a certain insurance company, and that's intelligence is very important for us to act on. So that's the very first and foremost important part is the collective collaboration on it. So I think that is the fundamental part, because that is also sort of gives us the ability to generate that stakeholder trust. You can't fight this battle on your own. There's just no way you can fight this battle on your own. So the partner also become a very critical ecosystem into this when it comes to the collaboration. So the common groups are being created now and more and more in terms of healthcare that we can leverage.
So Praveen, you want to add something to that?
Yeah, so definitely I totally agree with him that when it comes to cybersecurity, it's a collective collaboration that can help us safeguard our data. So we have also been kind of grappling with this situation. So we have been a little conservative to be frank. So we do have most of the data in-house, and but to add to that, we have so Amrita is also having a university, and we have some good IT resources. They have created their own SOC, so to speak, and they have done fair bit of development in terms of coming up with the SEAM and SOAR of our internal teams. So we have kind of gotten their help, and then we have implemented those. So those have helped us in overall. But I totally agree, it's not a easy problem to solve, and also not a very cheap, because there are very expensive solutions in the market if you really want to do end-to-end security of it.
Sure.
Really, cyber security is a major challenge for every organizations already. The eye-opener when it has come, when AIMS has attacked on 23rd November 2022. And government also wake up on that call only, that it is really a threat. And they have started many steps they have taken it. They have installed many honeypots in different locations. They are observing very closely that what are the threats is coming in which place, where it is coming up. And periodically they are giving the message to other organizations that these are the threats, it is there, be careful. The alertness is coming to the public domains that you have to be careful in this area. But major challenge what I am talking about it, we do not have a single solutions to protect ourselves. There is no single solution is there. Nobody can protect 100% of your data. But you have to be more resilient on this, how to protect yourselves. So you're supposed to make a proper such type of architecture and such type of tools you have put it so that you can recover as fast as possible if the attack has come out. See, not a month back, United Health is a very big organization. It has collapsed due to the ransomware attack recently. So they have invested 22% of their IT budget in the IT security and they failed. So if you talk, I am spending a lot of money on this and I am safe. No, it is not safe, basically. And second part is 100% I agree. It is a collaborative and team efforts to do it. It is a journey. It is never ends. Every day you have to learn and every day you have to alert. I talk to my cybersecurity people. We are around 18 people in the cybersecurity in my team. That be careful when you go home and have a sound sleep at your home. Otherwise, in the morning, what will happen, we do not know. So this is the objective, to take care of it and you work for it, because in the market you will get a lot of tools and every tool is really important for us and it is not possible to afford it. So you work in a team, and second part is that what are the vulnerability what you have, it must be communicated to the top management that this is the vulnerability is there, I can't protect it. First thing. Second part is that social engineering. 92% of the attacks through the social engineering. So always you train to the users what to do. And simultaneously the exercise has to be done, because you send the malicious mail to them, how they are reacting, you check each and every users so that you can know what is the status of your users, what they are doing it and whether they are alert or not. Third part is that when you are doing these activities, simultaneously you are supposed to have a strong backup programs, just like the concept is 3 to 1, 3 copies, 2 different media and 1 outstations. This resident program has to be implemented seriously if your data is highly important. Thank you.
I think I agree with your statement. It's everyone's responsibility, but I categorize the whole thing in 3 use cases. One is data privacy, data security, data protection. That's the way I categorize. Data privacy is considering the DPTP Act by the government. Okay, so it is everyone's responsibility to protect the data. So more than a protection, you need to ensure there is something called, you're responsible to, retrieve the data based on the patient's request. So that's something you need to ensure you get the consent, and you need to ensure the data is protected. That is from the data privacy. Second one is on the data security. So in today's scenario, as Mr. Sushil mentioned, you need to think that you will be attacked anytime. He is already into your territory. You always need to assume that your infrastructure, your data is being under attack. So you need to assume that. So you need to be prepared for it actually. So that's where the data protection comes. So for that, what we need to do, particularly when we have a peak, let's say on Mondays, you have a huge number of patients, something happens, what we need to do. So we need to have a clear playbook. Okay, imagine something 11 o'clock on Monday happens, what you need to do. Okay, So do we need to switch to the case sheets? Do we need to switch to the alternative cloud? Do we need to switch to the local? These are all the things we need to be prepared. As sir mentioned, the 3-2-1. Okay, do we have the local backup? See, today the attacks are, it's something like the attacker attacks backup first, more than a main data. So you need to have a offline data. That's most important. Even though you keep the data in the cloud, so there will be the traces, you need to ensure you need to have a offline data. So we need to be prepared. Okay, if attacker attacks, what we need to do? That's no other way today. Okay, so of course, while for data security, you need to ensure, most important thing is, even the attacker takes the data should not be able to use by him. How you can do that? You encrypt the data. You encrypt the data, even though he takes the data, he will not be able to use the data. You understood, right? So let him take, he will not be able to use. Okay, so the way we need to think, so one is the data privacy. Okay, so when I say data privacy, particularly the consent management or the Data Protection Act, if you go through the data protection, I mean, any violation you need to pay huge penalty. So I think we all need to go through the entire Data Protection Act. It's very neatly well drafted, almost like in a GDPR. Okay, that's the first thing. And the data security, your data encryption is most important. Okay, how you encrypt the data. Third one is data protection. Once it happens, how you can retrieve the data. I think these three are critical to ensure your hospital and your data, your patient information is protected. Yeah, thank you.
Can I put one? Yeah. Before DPDP, it was another thing which was in the parliament. It is personal data protection bill. In 2018, it has been in the parliament, but that has not been discussed in the group of ministers. Then they have gone through the more details and they have come with the DPDP. But personal protection bill, that when it was there is another draft it has circulated to the public. It is called DISA. DISA is meant only for the protection of your healthcare records. So right now it is not been approved because they are waiting. The DPP has to be approved and implemented. After that, revise the DISA and they will be implemented for the healthcare.
Thank you, Srini. Brought up very good points. I take cybersecurity and particularly in the healthcare arena differently. In the health tech or in the cyber world, security has been oversold. I feel so. There is a cybersecurity hype was made. I take it security in three sense. As a CIO, you need to first make sure that your operation doesn't suffer if there is any attack. That should be the first agenda of any CIO, any CISO. Second is, all the responsibilities and the obligations covered under the DPDP Acts are covered. Or any compliances if you are working into any MNCs, all the compliances are covered. Those are the second priority. Third is, if your data gets hacked, XZ rightly mentioned that it should be encrypted or should not be able to be used by the hackers so that your brand value doesn't get hampered. So these should be the three basic concepts should be there in the mind while addressing the cyber security in the healthcare, particularly in the hospital environment. So far as you mentioned about the UHG, etc., the attacks on that, they have a different type of data where that data can be used into the market for the clinical trial purposes or other purposes and the pharma purposes. But so far as the hospital data is concerned or the patient data is concerned, you need to make sure that these type of objectives are met by any CISO or any CIO.
I think getting back to normal operations and making sure that the data is.
That's why you have to be more resilient. Means what is your business model? You have to say it. whether you need a 2 hours downtime, whether you need a 2 minutes of downtime. Based on that, that infrastructure has to be placed, and that way you have to be more resilient on it. Yeah.
Yeah, so he rightly mentioned that, in case you come across this type of situation, you need to make sure that your BCP is in place, be it manual or other way around. So business continuity plan is there. So those things are the part of operations that, if anything happens, be it there is any DDoS attack or any type of data encryption happens, the data gets logged by the hacker, or any type of services are getting hampered, you have any BCPs in place so that your business or operation doesn't get impacted in the hospital environment, which that when there is a human life is on the stake in the hospital environment. So you need to make sure that should not be impacted, rest follows.
Just to add just one point. Cyber security cost is becoming too high. So now what they expect by 2025, overall cyber security cost is going to be $10 trillion. So, you are talking about zero trust architecture. So being a non-profit organization, from what I always focus, can we do zero cost architecture? So bringing more open source tools, like, how we can make it as a zero cost architecture. That's something, because it's becoming, now cyber insurance is becoming another additional expenses.
See, I just add a few points, Prashant, if you allow me. There's always this challenge of putting the business first and then enabling it and then thinking about the cyber, which is, in my opinion, is a right approach. But there are a lot of exceptions and deviation to that. Obviously, there are different businesses who have a different profit obligations. And you rightly said, for a non-profit, we have to be able to stick to the objective first, than doing anything else. So, but the thing is that in a course of business, the value of data, whether it is a private hospital, or whether it is a profit-making hospital, whether it is a non-profit making hospital, remains the same. Now, it is always easy to actually get hold of the data when you don't really have much of a control. I suggest in those situations, there's this new focus is being developed. It's called cyber crisis management planning. When you look at cyber, you look at it from identifications, preventions, detections, recovery, response, right? It's the entire cycle. Not everybody can invest the kind of dollars into every phase of it. Once we know that we're not going to put a lot of effort on the prevention, then we'll have to make a balanced choice between what can we do in detections and what can we do in terms of investing right amount of process and training the skill sets to deal with the cyber crisis. Every industry has its relevant cyber threats, right? There are those 5-7 threats that we all are dealing with. It's not different. And if we can create right playbooks, and like Dr. Sushil said that, business continuity, if we can link this with cyber crisis and identify this is the data loss we are going to incur, and this is the time that we are going to take in the face of adversity, it will give you some respite.
Yes, simultaneously you have to do whatever the recovery plans. The simulation process supposed to be there, okay, regular basis. Because when the threat has come, again you have to, you have a SOP, you have to follow this one. That SOP will continuous basis, you have to check it, whether you are in the right place or not. That is your most required. And simultaneously, we supposed to give the training that in these cases how to react. Because in other places, I do not know what it is that when the AIMS has attacked, we are facing the media, we are facing the different agency, 9 agency. 24/7 we are addressing everything. They need the data because, see, the problem is what it is. When the investigation agency is in your place, you have to give the data, and transferring the data from your database, you have a huge database. It takes 3 to 4 days. The 100 gig backbones, from there you are copying it, the data, 9 petabyte of data. What data they needed it, that has to be look into it. So it is a big challenge for that. Simultaneously, the attack is there. Many people, they do not report to the certain. You have to report to the certain, because certain also, they have to learn the type of data has been happened and what way it has been happened, so they can give the alert to other people also.
Within 6 hours, we need to.
Yeah, within 6 hours, yeah. Thank you.
So I think we have a lot of CIOs and CISOs in this panel. So, and cybersecurity is a topic that I think we can go on discussing for days on end, right? So, so let me just kind of change track again. Now, as far as cybersecurity is concerned, we already covered that. But I think Srini spoke about large volumes of patients coming through on a daily basis, and so did Pushkal refer to that. Now that leads to a large volume of data, right? How is all of that data getting managed, and how can some of the cloud technologies and cloud services help to manage the data while at the same time protecting the data and making sure that, you know, the security and accessibility is in place?
Yeah, I think, you know, to manage at a scale, okay, you need to have the right infrastructure, right tools, right processes. Otherwise, it will be a, you know, big nightmare, right? So, the way Arvind, like, you know, for us, the EMR is a very critical thing. Electronic medical record, where just imagine, particularly for the eye care, particularly on the glaucoma patient, where they need to come every 3 months to the hospital, and tracking the history of the patient for the last 5 years. And imagine, like, you know, an average, any person, the health data per year, on an average, it is 80 MB data. For any person, the healthcare data on average per year is 80 MB. Just imagine, you know, 22,000 patients in a day. So kind of a data, bring it into the whole structure mode. So you need to have a right tool and right application. So the EMR is only the option way we will able to bring the structured data. See, another challenge with the, you know, it is not that, like, you know, I'm making this statement against the doctor, making doctors to, you know, see, doctors are comfortable writing this prescription rather typing it. So they're not comfortable typing the, you know, diagnostics or advice. That's a bigger challenge for us, actually. So we have been struggling the last few years, like, you know, what we do, like, you know, we give a field level in application, they ignore it. They are comfortable in typing it. But if you type, it will become an unstructured data. Okay, and getting the analysis from the unstructured data, you need to, you know, do a lot of processing. If you have a structured data, it is easy to do analysis. Okay, so that's the evaluation, like, you know, we have been going through it, and it took some time for us to, you know, make doctors understand, because the more you data collect, and you will be able to do more analysis. For example, what we do typically, for every, you know, we have something called cataract QA. So we do a quality analysis for, we do like almost 50,000 surgeries in a month. So we do the analysis of the surgeries, okay. For example, you know, one surgery takes maximum 3-4 minutes. So what we do, we collect the data. If any surgery takes more than 5 minutes, then we'll get into the detail why this is taking more than 5 minutes. Is it a doctor issue? Is it a equipment issue? Or is it a issue with the patient? So we do the analysis and improve the overall efficiency over the period of time. So that's where the data helps a lot. Okay. So to, you know, to answer your question, to manage the data, first you need to have an EMR. Without an EMR, unfortunately, if you see, like in India, not even less than 10% hospitals have a EMR. Okay. So most of the hospitals got a IHMS. Okay, but the EMR will be able to help improve the diagnostics, improve the patient care, improve the patient safety. That's the most important thing. See, typically, you know, when the patient comes, what we do, the doctor asks the previous history. Let's say the patient visits like 50-60 visits. If he needs to go through the 50-60 visits, it's impractical. Imagine you bring the entire summary of the 50 visits in one dashboard. It becomes easy for any doctor. It becomes easy for any doctor to go through the summary, give the medication. Okay, so that is one help. Today, the EMRs are changing as a clinical decision support system. When I say clinical decision support system, when the patient complains, understand the patient problem, looking into the patient history, parameter, the EMR provides a recommendation. So the doctor can spend efficient time with the patient rather going through the records. So that's the intelligence what you bring in the EMR. So because of the data, what you have in the EMR, because the way the data has been structured, so these are all, you can bring the intelligence within the system. So that the doctor will be able to give her efficiency in his advice or whatever the medication. So one is, getting the data, making the structure of the data, then managing the data. So the managing the data, typically what, see, typical healthcare, there are three kinds of healthcare, the characteristics. So in any new technology, you see like, most of the times bankings are first place to utilize. But healthcare, typically what we see like, technology gets matured, then we'll implement the healthcare. That's the kind of an attitude in healthcare. So, but again in healthcare, you have one set of people, they always look forward the technology. Second set of people, let's see other healthcare providers are using, let's learn from their lessons from them, then we'll implement. Third one, they'll never go for any new technology. Okay, so the technology implementation in the, today it is inevitable, not like in the past. That's the way what we did, we have moved everything to the cloud. See, because imagine like 120 hospitals managing it, it is going to be a nightmare. So what we did, we moved the entire into the cloud. Now we have any place from any time we'll be able to access the data. And most importantly, the resources. So resources, what we can do, let's say on Mondays and Saturdays, I need to have more computing power. What I do, on Sunday night, I increase the CPU computing power. And the Monday night, I will decrease the computing power. So in that way, I manage the resources based on the demand. I don't need to have the entire infrastructure on premises, so that I save the cost. Okay, so in that way, you have a flexibility to use the technology to manage your data, you manage the resources. That's what I would say.
Pushkar, you want to add something to that? Yeah.
I think in this time and age, having more data and the companies having to manage it should not be a problem. The reason being, the cost of data retention is not that exorbitant what it used to be, let's say 10 years before. More data is good, but irrelevant data is not good. In my past experience as an IT guy, and now that being from a cyber standpoint, every data comes with the liability of managing it, right? So unless there are retention requirement or business requirement, we should not really keep the data longer than what it required for, and that's where you build the data retention life cycles. Now, if we don't have a data retention life cycle, we get in this situation where we don't know what data to keep, what data to get rid of. But like Mr. Shivanaslu said, that in the advent of cloud computing, you can take this call, how to actually slice and dice, and how to, when to use high computing, low computing, and so on and so forth. But by all means, you collect the data that you need it, which is in line with the purpose for which you have collected that data. This problem will not be, as we go forward. Long-term retentions also, there are cheaper ways to actually retain them. Whether you go for cloud services or whether you want to have an in-house way of retaining it longer, it's manageable. What is not manageable is the liability that are associated with the data. And those liabilities have to be worked out. In my opinion, it's the liability that needs to be think through. It's always easy to collect and retain.
All right, so let me ask you this. We are, like Srini mentioned, this vast amount of data. You are saying that, the liability is more important than the volume of the data itself as the costs are coming down, etc. What about standardization of data and interoperability? Again, we started with the ABDM mission. That's to, connect or have the client data, the patient data accessible anywhere that the patient is going into. How is the interoperability being worked upon as far as data is concerned? Are you guys looking at some standardizations? What is happening on that front?
Of course, I think without standardization, it's going to be difficult. Imagine like you get the data from PACS, you get the data from the EMR, you get the data from the wearable device. So to speak all these things, we need to. In that way, ABDM, the team is helping a lot. Kind of bring the standardization, so that a doctor can see in one place, end-to-end data in one place from the EMR. And the EMR can speak to the all application. So typically, we use an HL7. Now we are transforming towards FIR, FIHIR. So that way, EMR can speak to other applications, and doctor will be having a complete landscape of the data. So without standard, it is going to be difficult actually.
Absolutely. And that brings me to the next area. Now, everyone is talking about AI, and especially generative AI, right? And that's having exciting possibilities in drug discovery to personalized medicines. Now, with all of this structured, unstructured data that you're talking about, how mature are your data models in place to leverage this new technology, and how is this generative AI being leveraged by you as service providers? Can you talk about some of these standard use cases that you are coming out with and leveraging this new technology?
So let me take a stab at this. Generative AI is probably slightly new construct, but a traditional machine learning has been there for quite some time, right? And for us to be able to make sense of data and find new revenue streams or improve the process, those decisions have been something that the organizations have been working. What is good at this point is that with the advent of cloud, the information processing has gotten down. The cost of information processing has gotten down. Instead of speaking what is specifically we are doing, but what I have been saying is, what I've been seeing is, there is now a rather easier way to integrate your multiple data sources to a data lake, right? And from data lake, you actually creating the data warehouses, running the analytics on it, and creating a whole sorts of dashboards and the outcomes for the business to take decision on. So those are some good initiatives. I think the medical or the clinician side of it is going to be benefited by that. In addition to a core business processes, which is the traditional finance, marketing, sales, which will also leverage on it to find new sales and marketing opportunity. But I guess these new interventions in the clinical side is what, at least I've been saying last 5 to 7 years, a lot more developments are happening, right? We talk about machine learning with the help of large language models. There are certain models are being built which have a promise to outperform the pathologist. Now, if they become mainstream, wouldn't that be good from an overall patient journey standpoint? Ultimately, all of this makes sense when we look at patient, how quickly he can know about the disease or she can know about the disease and learn about the right treatment. This is the distance that is pretty huge these days, and that's the distance we all are trying to shorten over the period of time. I think machine learning and its right implementation in the clinical side is the one that is most poised to reduce it.
Right now, AI is playing a major role in the healthcare. Everybody they are saying it. Recently, we have launched another iOncology.ai. It is in the public domain, so anybody they can use it for this. This project has taken about 4.5 years. Why this is? See, other than your healthcare domains, if you are using the machine learning, that is fine, because data may not be that much of clean or complete. That can some extent will help you out. But in healthcare, if the prediction is 99%, and can you rely the whole things on that product? No, it will not allow you. Because a cleaning process, it is a very challenging process. Okay, challenging process in the sense, let's take one cancer patient, he has the adenocarcinoma and the cancer is upper stomach and the tumor has been detected from the your PET scan as well as CT. Is the document, this data is sufficient? Let's take, he has a pain. In clinical information, he has a pain in the stomach. The doctor has written on the file or EMR that he has a pain on the upper stomach. But pain has more than 1200 pains in the stomach. Which type of pain it is? That is not mentioned. Means measure of the EMR record is not complete. Why I am saying? When we have developed this model, at that times we have gone through the whole files and we have rewritten it, that which is not written by the doctor. The means the medical record is not complete. If the medical record is not complete, when you will put the machine learning, the machines how it learn, it do not have any intelligence. So that's why in the health sector, totally dependent on any ChatGPT or OpenAI, I'll not agree it because I have gone through the whole services. See, the cleaning process I'm talking about. Whatever data in different sources is, you import it, then merge all the data sets. Next one is rebuilding the missing data. Another is standardize the data if all the records is not standardized. Then you have to normalize it. Another one is any duplication is there, again you have to work on it. Then verification and enlargement, that has to be follow it. Then export the data to a data lake and do it. No one is doing this sort of things. Frankly speaking, anybody has done it, you can tell us. And that's why for 12,000 patient records for the build up a eye oncology to AI, it has taken 4.5 years. And 18 specialized doctors, they are involved to clean the data, complete the data. So it is a big exercise which yet very few people they have tried on it. So my perceptions, you can say my understanding is that if you're using any AI tools, it should not be dependent totally on that. Slowly what it happens, so small example I'm giving you. We have given to a users to use the registration process and he's done the registration that one very VIP person has come to us and the registration has been done. He is from Madhya Pradesh. Then when the state has come, he has written M, means it has got a Madhya Pradesh, Manipur, Maharashtra. But he has to enter Maharashtra. Because the user is more confident to the system that it is accurate, but he has not verified it. What happens when you use this type of tools? Again, they will say, अरे ये मॉडल तो अच्छा काम कर रहा है, कोई प्रॉब्लम नहीं है, मुझे बाकी देखने की जरूरत नहीं है. This is the concept which come up. So that's why when you are using the tools, that it will be used in such a place that it should not hamper. People used to not to be dependent on that tools. In one tools I am talking about it. When the patient is doing the registration process, appointment process to a department, we have using a one bot to it, AI based bot. Because 32% of the patients are going to a wrong department. And when we have used the bot, it has gone down to the 10%. In that case, it is acceptable. Because 10% means it has been reduced. So this is my suggestion. Any tools in AI you are using it for the healthcare, it should not be dependent. That is my suggestion.
Just a 10-second response to that. That's why we have a concept called responsible AI. So I think that's what is the one way to sort of give us a sense what makes sense in terms of using the right model or not. I think it's pretty much like how you started working on cloud. It's pretty much how you started working on new age data analytics platforms. So it starts with skepticism, but if you have a sort of a way to deal with it, the sky is the limit.
I think the confidence on the data model, on the model itself, as well as ensuring, thorough testing to ensure that the models are not hallucinating, needs to be done before they are kind of rolled out. Of course, of course. I think let me kind of end this by asking you a futuristic question. Do you believe that in the future, with all of this AI, Gen AI technologies coming up, do you think that the technology can become the first point of contact for patients and can, to an extent, and I don't know what is the extent of that, but to an extent, can it even go on to replace, the initial doctor-patient interface as well?
Absolutely, that is going to happen actually. So that is going to happen. So, in fact, like last week we were presenting one of the AI, what we did, we have taken an image from the Google. We gave that image to the AI algorithm, LLM, and it gave very clear, conservative, medication, optimized. So kind of, the doctor was sitting next to me. He just said, "You guys going to replace me?" So, but the fact is, the way we need to look at this, it is going to complement them. So they're going to review it. It is going to complement them, and they're going to see more and more patients by using these tools. So in the AI, I see 5 areas. One is screening, diagnostics, treatment, operational efficiency, and it is going to make affordable healthcare. So that's the way I look at things.
Affordable and accessible as well.
Affordable and accessibility.
Absolutely.
So that's what we need to look this on actually. So I'll just share one quick use case. We have done something diabetic retina. I was sharing with him, today it's 1 out of every 5 Indian is a diabetic. Imagine to screen 40 million Indian patients, you need how many doctors? So what we did, we built a algorithm to detect diabetic. So today we don't need a doctor. A non-clinical person goes to this village, does the screening. Within a minute, the algorithm provides. So you don't need so many doctors actually. So that's the way I look at it actually.
Absolutely. I think I'll just take some last comments from the panelists before I kind of then open the floor to the audience to ask some questions as well.
Yeah, I'll just give one more example of how AI can be used not only to reduce the cost but also to improve the efficiency. So we all know that breast cancer is becoming more and more prevalent these days, and we need very expensive equipment to do the screening also. But now we have AI-based, thermal screening-based solutions which can do at a much lower cost and much faster, and you don't need, extremely talented resources to detect that. So with the use of software, with the use of right technology, this can prevent lot of these questions about reachability, accessibility, cost, and all of that. So yes, AI is very much here to help us, but HI, the human intelligence, have to use AI to do a better job at it. AI by itself won't be able to do that.
Yeah, I can extend this project. It is a very successful project in India, that thermal scanning bra is available in the market right now. So the ASA worker, they can move to a village and they can see the clinical history. If the clinical history is somewhere, it is doubtful, in that cases, they can ask to the lady to use this bra and come up. And from there, after scanning it, the ASA worker can transfer the data to her mobile, then transmit to the cloud. And there the AI model is there, and they can give the reports on it. And it is a very successful model. It is used in Punjab and Karnataka, then Tamil Nadu, already it is there. And this product is in the commercial stage. It is coming out very soon.
Yes, sir.
Answer to your question is that whether AI or Gen AI is going to replace the clinician is no. I can give you the example. If you put the AI and if you start using the AI for calculating the platelet count into the blood, we have experienced that if you are using it for platelet count, it ignores the number of the cells. So pathologist has to apply their human brain to make sure that whether it is a 1 cell or it's a 4 cells. So human brains or the clinicians are not going to be replaced in any case, be it AI, Gen AI or anything. So far as the Gen AI hype in the IT world is concerned is that your data has to be localized across the regions. Otherwise, your Gen AI is going to reflect wrong answers. If you put pilot onto the Google, it will throw the answer is the men. If he'll say that he is the pilot, it will not be the she is the pilot. So you need to
Bias
make sure.
is what you're talking about.
Yeah, no, I'm talking about the Gen AI data, the data, because you need to localize the data. So until unless you make sure that data is localized, your Gen AI and AI will reflect accordingly the answers. That's the one thing. And second, the first answer was that you cannot replace the human brains with the AI or GI because that is based at the end of the day based upon our experience and our data.
Yeah, I think I agree with all the panelists. I mean, if you go far back, the way the technologies have been coming up, while it is impacting the traditional jobs in one way, but it was also creating new jobs in a way that is more meaningful for the person doing it and for the patients at large. Just before this session, I was sitting here and actually going through all the presentations which were happening in the MedTech area. I could see that a good amount of AI and ML is being used to actually change the way traditionally the diagnostics are being performed. We live in an evidence-based medicine era, right? It's this report that tells the clinician what is the next course of the treatment that's going to take place. So that from that point of view, I think it is akin to how a BSNL phone was back in 90s. Late 80s was very difficult to get the line, and then the mobile came in, and it sort of given the independence to everybody, and everybody got it. So there wasn't much of a push in terms of selling the mobile to Indians. I don't think there's going to be much of a push to sell machine learning and AI based capabilities to, particularly in the field of healthcare, because it needs solutions. It needs a lot of intervention in terms of making the healthcare affordable, faster, and saving lives on so many levels. So this is what I strongly believe, that while it will have a initial hiccups in terms of its adoption, its accuracy, some would say that it is delusion, some would say that it is it's always answers and so on and so forth. But I think 7 years down the line, we may not be learning, but machines are learning, and learning at the pace which has a potential to sort of replace the human collective intelligence to a certain extent. But what will be more meaningful is this narrow AIs with its implications and use case across the industries that will define and change the way we've been living our life. So I'm hopeful for that.
Yeah, I agree. I think we're living in very exciting times today.
I can one point I've given. Today's days, whatever model it is there, who has approved it? Is it biased or not, who will know it? So biased model might be there also, you do not know. And that biased model, the biased might be a 0.1%, it might be. So that we have to be more careful, and regularity has come up. The government is already trying in the health sector also. Already one task force is there in the Ministry of Health, 7 people are there. They are working on it, yeah.
Yeah, I'm sure that there have to be great strides to be taken for the new technologies to mature. But we are in a very, very exciting time now, and the pace of innovation is accelerating, and no one has seen that kind of pace before. So I think thank you all panelists for all your insights that you have provided. I think it was a very, very engrossing, detailed session on the various technology aspects in the healthcare space. If we can have 2 minutes more, I think we can open the floor up for anyone who has any questions for the panelists. Yes, I think there is a question there.
Yeah, thank you. I appreciate having a very insightful discussion and very good moderation. In the changing time, where the focus is on context and the cognition, and the problem remains reduction of medical errors. Where do you think we should be looking at it, at the strategy or the execution? Is it okay?
Arun, do you want to take a stab at this?
Could you repeat the last one though?
I said in the changing times, where the focus is on context and the cognition, the problem remains reduction in medical errors. Where it should be looked into, the strategy, because you are all wonderful CIOs, where it should be looked into, the strategy or the execution.
Education of the clinical caregivers?
No, generally where we should be looking into for reduction of medical errors, into our strategy or into our execution.
Yeah.
So we took the problems from multifolds, cyber security and all the things. But the actual problem in hospitals remains reduction in medical errors.
Medical errors.
So where it should be looked into our strategy or into our execution?
So strategy and execution will be the secondary part. I would say that we need to make sure that our data we get corrected, because the data refinement is the best policy to reduce the medical errors or the clinical errors, because based upon the refined data you would be having a better clinical decisions. If you have a wrong data, you will be having a wrong decision support system. So you have a correct data, you will be having a correct clinical decision support system. With that, you will be able to reduce the clinical errors.
And just to add on top of it, sir, errors are decreasing. Now more predictions are happening through AI. If you see, in the past, we don't have a prediction mechanism. Today we have so much of prediction through AI and all these things. So able to predict the diseases much early. So in that way, improving the errors actually, decreasing the errors. That's what we see now.
One more thing I'm adding at this point. Error means the doctor is making the error. Are you? Is it? Yeah. Huh?
Errors on the outcome.
Yeah, errors is outcome. Then errors is outcome of, see, yeah. Arun, what he was saying that if data is not correct, it is one point of things. Okay. What it happens, when you do a test and that lab is not properly means NABL compliance and they are giving the reports, it may be wrong. But that things, it has to be done in different levels. We are talking about what you are talking about, the attitudes. Attitudes supposed to be there with the top management. But errors, what it comes, I'm talking about it. Doctors do not want to make errors. Try to understand in this way. But where the data is not in proper format or missing the data, in that cases errors has come up. Let's take, you are treating two different doctors and you are showing that one doctor's report and other doctor's report, you are not showing it. You have a hypertension and you are taking a medicine which is thinning your blood. Somewhere you have a bleeding. Okay, and they are taking another medication. It is medical errors. Because data is available and if it is visualized in proper way, technology is there, you can visualize this kind of medication is going on right now. These medications are required to be done, how to be done, that has to be planned out. So you have a strong EMR, it is integrated and data is accurate. In that cases, medical error will go down. And simultaneously is facing by the US, 5 lakhs people die in a year on a medical errors only.
The answer to your question is there are tools available. We are using those tools to make sure that clinical errors are reducing. We have drug-to-drug interaction softwares available in the hospitals, which is making sure that clinicians are prescribing appropriate medicines to the patients. And they are evaluating, and there are tools and applications available which analyzes the patient history based upon the clinician's current prescriptions and so far interaction between the two situations, and gives the suggestion to the clinician. Based upon that, clinical errors are reducing, and that's how we are trying to reduce the clinical errors, be it into the hospital or into the laboratories. These type of tools are available to reduce the errors.
So just one last point, I think, before we end. So when you talk about clinical errors, so there are two kinds. Obviously one is the prescription kind of thing, and second could be administration errors also, right? So you ordered the right medication, but what got administered is different. So the drug-to-drug interaction kind of decision making tools will prevent the first one. And if you have scanning based solution for administration, that will prevent the second one also. So there are, in the US, you have this 5-hour checking for every single administration, in right patient, right route, right time, right dosage, right drug. So these 5 hours have to be checked before you administer. So obviously in India, it's not always possible given our other constraints of the time and the resources required for all of that. But technology is there, but then end of the day, it's the balance, and like you rightly said, the strategy and the execution have to both go hand in hand.
End of the day, data entry and data output, no? The in and output the in has to be correct, then only the output will correct. If instead of Chablani, it is Dablani, is gone, no? As you write C, it can be D also. So input and output depends. So when you put the input, the correct is, so that CIO can't do anything. Yes.
Yeah, so I just, it was a very interesting discussion. So being an AI guy all my life, I have very, point that I wanted to understand, what is happening today is that, it's very clear, the AI era is going to be much bigger than internet era we have seen so far, okay. And what I have seen at least, and what we can foresee is AI computing becomes a very important thing. So we have like multiple layers as like AI stack. We have a computing resources, and then the apps that comes and sits on top of it. So my question is what being eminent COS in eminent hospitals, what do you see like in terms of AI computing? What do you want to equip with, and what kind of applications you want to equip? I know it's a very broad question, but just wanted to just get a one-liner from you guys, like how you can happen.
So see, AI implementation is all across the hospital operations. If you talk about the AI implementation into the hospital environment, right from the patient's admission till the discharge, laboratory testing, clinical consultation, all aspects, everywhere you can use the AI. So, as Praveen was saying about admission, the appropriate admission of the patient, how to direct them to the appropriate clinicians, because patient comes to the hospital with, they say that I have some problem into the spine, I have a pain into the spine, but they think that they need to meet to the orthopedician, wherein they should be meeting to the neurosurgeon. So those type of AI interventions are being used into the respective hospitals in the admission level. At the clinician consultation level, clinical decision support system applications are being used to facilitate the clinicians to take appropriate decisions. He rightly said that if medicines have been prescribed to the patient and he is going to the pharmacy and pharmacist is giving a wrong medicine, so that is also being used, correlated by the barcodes and QR codes on the prescription, so that right medicine has been given to the pharmacist, to the patient. So at every level, AI can be used in the hospital environment to improve the efficiency, to reduce the error, to improve the patient satisfaction and the clinical decision.
I think his question is what kind of applications? I just add one more point. I think in addition to that, in diagnostics also, there is a huge scope of AI. The pace at which it is finding the patterns and quickly returning the response, that is what is going to come as we move along. probably this area will get impacted the most.
Well, I'm sure that technology in healthcare is a very, very interesting topic, and there'll be several more questions. But unfortunately, there's no technology for constraining or expanding time, and we are out of that, unfortunately. So I'm sure the panelists will be around for some more time after this discussion as well. So if anyone has any more questions, please do walk up to them, and I'm sure they'll be more than happy to kind of discuss with you on some of the areas that you still have doubts or questions about. I think I'll like to call this session to an end and thank all the panelists for their insightful points of views that they have placed today in front of you, and I hope that you take away something from this meeting and be as excited as I am towards the future of technology in healthcare. Thank you all.
Thank you, Prashant. As Prashant rightly said, the future of healthcare with digital. Now it is very clear that doctors and the CIOs have to work together, whether they sit together or not, but end of the day they have to go together. Otherwise, all these kind of errors will happen. And it's very clear now the AI is part of the health, and whether we like it or not, whether it is ethical AI or non-ethical AI, we can deliberate in later, but we need AI in our life, which is going to come in. Having said that, ladies and gentlemen, we come to the end of the conference. I would like to thank all the panelists. We have the brains of the Delhi, you can call it, all the CIOs here. Give them a big hand. They are the people who are running this hospital in this Delhi, from Gangaram, Artemis, AIMS, and we have all that, and the Path Lab people and everybody. So thank you to each one of you. Before I break it for dinner and cocktails, I request Prashant to present the mementos to Sri Arun Goel. He is the Director and CIO for Sir Gangaram Hospital. Thank you, sir. Thank you. Lovely session. Lovely session. Praveen Bist, CIO Amrita Hospital. Praveen sir, insight. So thank you very much for sharing the insight on the AI. Pushkal Mishra ji, the Chief Information Security Officer of Dr. Lal Path Labs. The upcoming CIO, the young CIO from the industry. Sri Srinivasulu Tayam CTO, Arvind Eye Care System. I've been told this is the biggest hospital in the eye care, right? Yes. Thank you. And I would like to present a memento to Prashant. We talk about digital, my team is also digital. They said, sir, already de diya humne. So I would like to, I'll take 2 minutes, please sit. We have excellent partners on this first conference, I would like to present a moment to all our partners. To start with, I request Father George PA, if he is here, please come on the stage to receive the memento. I request Sri Arun Goelji, Director CIO, to present this memento to Father George, the Director of Holy Family Hospital. Thank you, sir. I'll request Mr. Praveen Bist, CIO Amrita Hospital, to present the memento to the partner Norden. I request Prashant to come on the stage. Anybody is here from STEMS? STEMS? No. Shivam? You're there, okay. I request Mr. Dr. Sushil Kumar Meher to present the memento to the Shivam Medicos, Shivam Medisoft Services. Thank you, sir. Thank you, sir. Now I request again to Mr. Arun Goyal to present the memento to Diash. May I request someone from Diash to come on the stage, please. Thank you so much to be partner in this. I request Pushkal Mishra, the CIO of Dr. Lal Path Lab, to present a memento to taxpayer Gopal Joshi. Yeah. They all are our partners in this event. You know, without them, it's impossible to organize such conferences. STPI from MedTech. I request someone from STPI to come over. No one from STPI, Meditech from team? From startups, no one from STPI? Okay. Janetri, anyone from? Yes, please come on. Please come. Please come. I request Dr. Amitabh to come on stage to present this memento. Dr. Amitabh is the cardiology head and HOD of Holy Family Hospital. I request Prashant Singh, Senior Associate, to present a memento to LMES Techno Consultancy. I request Rajesh Toll to come on the stage. This is the helping to all the startups in medicals. So Rajesh Kaul helps with Gajendra and the team. Yeah. So I called. I request anyone from Augusta. I'll request Srinivas Lu to present a memento to Madam. Alchemist. Yes, please come on the stage. I request Mr. Arun Goyal to present a memento to him also. Then Swasa. Swasa, please come on the stage. Someone from Swasa. I request Dr. Vikas to come on the stage to present this memento. Swasa. Dr. Vikas is from Holy Family Hospital cardiology team. Anyone from ORT is here? No. The STPI, please come over. The startups, they said they are here. STPI. I request Prashant to present this memento to STPI, you are the partner. No? And Father Brito from Rupcha, the Executive Director of the Rupcha. Ladies and gentlemen, give him a big hand because the Rupcha full support, we got it for this organized. Please come on the stage. I request Shri Praveen Besji to present this memento. Rupcha is an association of all the Christian hospitals in Northeast, in the North. Thank you so much. Thank you. So ladies and gentlemen, we come to the taxpayer दे दिया ना हाँ गोपाल जोशी आया ना you didn't come he got he is worried about Gopal Joshi. Okay, so thank you ladies and gentlemen, we come to the end of this conference. And it went on well, the first digital conference. As I said that UNICEF and IIT Mumbai has started a course for all the healthcare people to start for their digital health course. They started IIT Mumbai with UNICEF. Last week only they inaugurated this syllabus. Those who want to be part of it, they wanted to be part of this event, but I'm sure they will be there the next year. So ladies and gentlemen, without taking much of a time, please enjoy the cocktails and dinner and have a networking and discuss about what all you want to talk about the digital healthcare. End of the day, providing the healthcare is very important, and affordable healthcare. Again, I put, underline affordable healthcare. Thank you so much.
Give it to Sunil.